Ladies and gentlemen, may I have your kind attention? May I request all our distinguished guests and delegates to kindly be seated as soon as possible with their mobile phones either switched off or put on to silent mode. We will be commencing with the proceedings of our event today very shortly. Once again requesting everybody to take their seats. Ladies and gentlemen, may I have your kind attention? Once again requesting all our distinguished guests to kindly be seated as soon as possible and please put your mobile phones onto silent mode. Thank you. Ladies and gentlemen, requesting everybody to kindly be seated. A very warm welcome to each one of you on this very auspicious day, the Unani Day celebrations for the year 2021 and the National Conference on Unani Medicine, Opportunities and Challenges in Times of COVID-19. Ladies and gentlemen, as you all are aware, the National Unani Day is celebrated every year on 11th of February to mark the birth anniversary of the great Unani researcher Hakim Ajmal Khan. He was an eminent Indian Unani physician who was a versatile genius, freedom fighter, educationist and founder of the Scientific Research in Unani Medicine CCRUM under the Ministry of Ayush, and has organized this two-day national conference on, actually this year, a one-day national conference on Unani medicine. The theme of this year's conference is Unani Medicine, Opportunities and Challenges in the Times of COVID-19. And ladies and gentlemen, we have a very important announcement for all our guests and delegates before we start the proceedings of our day today. Our Honorable Chief Guest for today, Shri Kiran Rijiju. Shri Kiran Rijiju, Honorable Minister of State with independent charge, Youth Affairs and Sports, Ayush and Minister of State Minority Affairs, was to chair the session, our inaugural session, but he has been called for some very important meeting and we will have the inaugural session at 12 o'clock when he arrives at the venue. Meanwhile, at 10:30 we will commence the proceedings of the day with the technical session. Once again, ladies and gentlemen, we will have the inaugural session today at 12 o'clock when our Honorable Chief Guest, our Honorable Minister of State with independent charge, Youth Affairs and Sports, Ayush, and Honorable Minister of State, Minority Affairs, Shri Kiran Rijiju will join us at 12 o'clock. We will begin the proceedings of the Unani Day celebrations and the National Conference at 10:30 with the technical session. Once again requesting everybody to kindly be seated.
ऑर्डर में है ना? हाँ, मतलब ऑर्डर में है उसको देखिए। दिस इज ओके, इसको पढ़ लीजिए एक मिनट।
Today the Council is signing an MOU with the National Institute of Pharmaceuticals Education and Research, Raebareli. And this MOU aims to enhance the collaborative research between the
between both the organizations on
both the organizations
on mutually agreed priority areas on और करनी है। इसके बाद यू अनाउंस की साइनिंग तो हो चुकी है, देन देयर विल बी एक्सचेंज है ना?
Morning, sir.
I think what we have to do it now is that we have to start the session. हमारे पास पहली सेशन की दोनों स्पीकर्स हैं।
Ladies and gentlemen, requesting everybody to kindly be seated. We are ready to commence with the proceedings of our first session. Ladies and gentlemen, kindly be seated. We are ready to commence with the proceedings of our first session. So as we earlier informed, we will have the inaugural session at 12 o'clock when the Honourable Minister will join us, our Honourable Chief Guest will join us. We will begin with the proceedings of the Unani Day celebrations with the first technical session. And ladies and gentlemen, for the first session of keynote addresses, I have the proud privilege in inviting on stage our eminent and distinguished moderators, Professor Abdul Wadood, Director, National Institute of Unani Medicine, Bengaluru. A very warm welcome to you, sir. May I request you to kindly grace the stage with your presence. Our distinguished moderator for the first technical session, Professor Abdul Wadood. I also invite our distinguished moderator, Professor S. Shakir Jamil, former Director General CCRUM, New Delhi. A very warm welcome to you, sir. Kindly grace the stage with your presence. I invite our eminent co-moderators, Dr. Sheikh Zubair, former Vice President, Unani, Central Council of Indian Medicine, New Delhi. May I invite you, sir, to kindly grace the stage with your presence. And our co-moderator, Dr. Danish Usmani, Drug Inspector, Directorate of Ayush, Delhi Government, New Delhi. I also invite our eminent speaker, Professor G.N. Kazi, Director General, Hamdard Institute of Medical Sciences and Research, Jamia Hamdard, New Delhi. And our second speaker for this session, Dr. Kim Sung Chol, who is Regional Advisor for Traditional Medicine, WHO Southeast Asia Region, New Delhi, will be joining us virtually in this session. Once again, inviting our moderators, we have on the stage with us Professor Abdul Wadood, Professor S. Shakir Jamil, co-moderators Dr. Sheikh Zubair and Dr. Danish Usmani. Our rapporteurs for the session is Dr. Mahe Alam, Research Officer Unani, and Dr. Rasid Javed, Research Associate Unani. Ladies and gentlemen, as you all are aware, the National Unani Day is celebrated every year on the 11th of February to mark the birth anniversary of the great Unani researcher Hakim Ajmal Khan. He was an eminent Indian Unani physician who was a versatile genius, freedom fighter, educationist, and founder of scientific research in Unani medicine. And to mark this day, the Central Council of Research in Unani Medicine, under the Ministry of Ayush, has organized this one-day national conference on Unani medicine in the hybrid virtual mode. And the theme of the conference is Unani medicine, opportunities and challenges in the times of COVID-19. And we begin the first session of keynote addresses. Our first speaker is here with us, Dr. Kim Sung Chol, who is the Regional Advisor for Traditional Medicine at WHO Southeast Asia Regional Office. He is a qualified conventional and traditional medicines, Chinese and Korean traditional medicines with MPH, and worked as a medical doctor and researcher at the National Academy of Korean Traditional Medicines in DPR, Korea. And today he is going to present his presentation on traditional medicine and its role on combating COVID-19 pandemic on the virtual mode. He is joining us virtually. You can see him on the screen. And over to you, Dr. Kim Sung Chol, for your presentation. You have 20 minutes for your presentation, sir.
Kindly unmute yourself.
Sir, you may kindly unmute yourself. We cannot hear you. Dr. Kim Sung Chol, if you could unmute yourself. And may I request all our delegates to kindly take their seats. We have started with our presentation, the first presentation, which will be presented by Dr. Kim Sung Chol. May I request you, sir, to kindly unmute yourself? Sir, you are on mute. May I request you to unmute yourself?
Yeah.
Yes, sir, we
Hello.
can hear you now, sir.
Hello. Yeah.
And sir,
can
you have
hear me?
20 minutes. And may I request
hear me?
everybody to kindly take your seats, please. We have started with the presentation. We have our international speaker, Dr. Kim Sung Chol, doing his presentation, requesting everybody to kindly be seated and all mobile phones to be either switched off or put onto silent mode. And over to you, Dr. Sung Chol, for your presentation.
Okay, thank you. Thank you. Can you see my slide? Hello? Can you see my slide? Hello? Hello?
Yes, we can hear you, Dr. Kim. We
Can you hear
yes,
me?
we can see your screen also.
Okay, thank you. Okay, first of all, thank you very much that Central Council for Research in Unani Medicine under the Ministry of Youth, Government of India, for giving me this opportunity. My voice is very echo. Can you, my voice is clear?
Yes, sir, we can hear you, sir.
Okay, thank you. So, first of all, let me congratulate the Central Council for organizing all this important international conference on the occasion of this 5th National Unani Day. So, today I'm going to talk about traditional medicine and its potential roles, particularly in fighting against COVID-19. So my presentation covers that, following that, why traditional medicine is important, and also global traditional medicine strategy, and traditional medicine interventions, as well as some research activity against COVID-19 in different countries, and so conclusions. So let me begin by talking about the importance of traditional medicine. So as you know that the traditional medicine is a very long history and also very strong cultural root, and well accepted by the local community. That's why quite a substantial of the global populations actually they are using some form of the traditional medicine and for their healthcare purposes. Traditional medicine, as you know, that this has own strengths. Particularly, they have to offer for the health promotions and disease prevention, and also management, particularly for those lifestyle related, chronic conditions with this holistic approach. For many people, also traditional medicine is often the main source. In some areas, the only source of the healthcare, particularly in the rural and remote areas. That's why, in many countries in Southeast Asia region, 10 countries have adopted national policies on traditional medicines. And out of them, 9 countries have the formal training and education systems for the traditional medicine practitioners. 6 countries have the co-located traditional medical services in the healthcare system at some all levels of the health system. So given the such importance of traditional medicine, particularly, that as nation's cultural heritage. That the WHO launched the Global Traditional Medicine Strategy in 2014. So, Global Traditional Medicine Strategy have two main goals. One is the harnessing potential contribution of the traditional medicine to the health and wellness and people-centered healthcare, and also is to promote safe and effective use of traditional medicines through regulation, research, and integrations. Global strategy also clearly define how they are going to achieve this global, the global strategy goal. So, strategical objective include that building the knowledge base on traditional medicines for the active management of traditional medicines through appropriate national policies. And secondly, also to strengthen regulatory system for ensuring the safety, efficacy, and quality of traditional medicines. And finally, also is to promote universal health coverage through integrations of traditional medicine in the national healthcare system. As you know, that the goal of the universal health coverage is to ensure everybody access good quality of medical services based on their need and when they need, but without any financial constraint. So it is important that we have to capitalize its roles and contribution, particularly for improving the health. It is very important and very crucial, and all these three objectives actually are all interconnected. So let's quote one of the important statements that made by the former DG, Dr. Margaret Chan. He said that the two systems of traditional and Western medicine, they do clash. But within the context of the primary health care, they can blend together in a mutual harmony, using best the feature of each system and compensating for certain weaknesses. So I think this is the first step over the directions, why we are going to integrate of the traditional and Western medicine in our healthcare delivery system. So, from this slide, we can see now the global community, is facing huge strain by this COVID-19. So, as of 8th of February, more than 100 million people are affected by COVID-19, and also more than 2.3 million people also died because of this COVID-19. As you know, that in traditional medicine, there is no term of the pandemic, but instead, highly infectious disease, and traditional we refer to. So in such a way that the COVID-19 is can be named as a primary pestilence, and also, this international community also has been threatened by, communicable disease outbreaks, in recent years. As you know, that SARS in 2003 and NH1 and influenza in 2009, and Middle East respiratory syndrome in 2012. So during that time, many countries have some experience. They just do leveraging of traditional medicine for controlling of all these disease outbreaks. So that's why at the beginning of this pandemic, many countries actually, adopt strategy that combination of the Western medicines as well as traditional medicine for this COVID-19. So particularly, this at the beginning there is no any specific medicines for treating of this COVID-19. So traditional medicine expert, they select some of the traditional medical formula from their traditional medicine classes, as well as from their experience. in combating recent outbreaks, and they start using opium in a systematic way. So in the country, they have issued national traditional medicine advisory as well as treatment guideline, which include traditional medicine as well. And many countries also initiate a number of research projects on traditional medicine and against COVID-19. Of course, that including India, Indonesia, Nepal, Thailand, innovation, and also China, Korea, and some of the African countries outside of the region. And some countries also traditional medicine practitioners. They are part of the chain for managing COVID-19 patient. So generally, as you know, that COVID-19 patient can be divided in four groups: mild, moderate, and severe, and critical cases. So for those mild and moderate cases, traditional medicine normally in many countries they use as a main treatment. But for those in severe critical cases, traditional medicine normally take the supporting role together with the conventional medicine. Let me take some of the example that some of the data from the website, and some of the slides actually presented by the local country. Particularly last year in November, we had the International Regulatory Cooperation for Herbal Medicine that the IRCHC annual meeting was held in November last year. So some countries made a presentation on their traditional medicine activity for controlling COVID-19. So as you can see this slide actually from the government website in India, you can see that Prime Minister also highlighted the importance of the traditional medicines for prevention of the COVID-19. And also the website also having a number of Ayurvedic intervention related, that information, and like some of those daily regimens and immunity boosting, etc. So it's a quite many people is a very widely using of these traditional interventions. This slide, as I mentioned before, that is presented by the government media in that IICF. So you can see that government issued, that Ayurvedic advisory and also treatment guidelines for the traditional IUC practitioners for COVID-19. So as of October last year, more than 80 research projects actually is going on in India, across the country, and some of those preliminary findings from that some of the research projects that IUC interventions has the preventive effect. So you can see that from this line graph that incidence rate has been declined, particularly at the second week of the intervention. And this slide is for the China. So when the COVID-19 affected in the country, the government immediately adopted a strategy that using several mobilizing traditional medicines for the prevention and treating mild and moderate cases, and also treating the severe and critical patients together with Western medicine, and also that is a strategy that the person that is using various modalities of traditional medicine, like herbal medicines, acupuncture, dietary therapies, and Tai Chi, and Qigong, etc. So more than 74 confirmed COVID patients actually were given some form of traditional medicine. This figure is about more than 91% of the total confirmed cases by the time in China. So these are some of the key research findings that made in India and China. So they did some of the pharmacological and toxicological study, and they found that the traditional medicine has the, viral load, reduction effect, and also it can contribute to improving the lung function by relieving those, the pulmonary etc. And also, many of the, clinical trials, they found that traditional medicine has the impact improving the symptoms and also preventing mild case from becoming severe and critical conditions, and also reduce the mortality as well as, transporting it to the ICU and shortening the recovery period and so on. So those are 5 pieces of quite promising. And this slide actually, made presented by the Korea. So when the country, is invaded by the COVID-19, the country immediately issued that national treatment guidelines that include 17 traditional medicine, formulas. So those medicines actually are using for the different types of the, permanent indication. And also they initiate clinical research for some of the common medicine as well. And this society is actually presented by the Zimbabwe, which is one of the African countries. So as you know that many of the African countries actually, they are very shortage of the human resources in their sector. So when the country was affected by the COVID-19, government immediately set the policy and strategy that mobilizing of the, traditional medicine practitioners. So they assigned them to assist the health personnel on the, contact tracing, and also let them to conduct health education for the community, and also provide some of the lead for the potential, medicines. So they provided training to those traditional practitioners together with the community health worker on COVID-19, and let them also equip some small scanners, mobile phones, masks, sanitizer, and ICU and so on. And so they conduct health education in the community, and also they are responsible for reporting suspected cases as well as monitoring, those contact with the catchment areas. Also, country also successfully undertaken some clinical trial on herbal medicines, and they found that some herbal products for managing that COVID-19 patient. So I think why I'm just to make this present here, I think this is a very good example, particularly for those low-income countries and developing countries, because many countries actually they don't have enough human resources in that sector. But how they are best to use those existing resources, particularly for this emergency situation. So in general, we strongly believe that traditional medicine has the contribution in improving the conditions and symptoms, and also preventing mild patients from becoming severe and critical cases, and also increasing cure rate and reducing mortality, and also accelerating the recovery period. And some of the traditional medicine also have the same effect, but less side effects if we comparing with conventional medicines. And those effects is attributed from the harmonized physiological functions, enhance the immunity, and suppress the replication of the virus, anti-inflammatory reactions, and also suppress the inflammation reaction, and accelerating also the exstates and normalize population and manage septicemia and so on. So let me conclude based on those observations, and also referring some of the articles that issued in the European Journal of the Integrated Medicine. So you can see that COVID-19 and pandemic actually provide all opportunity for the traditional medicine people to evaluate its efficacy through randomized trial. And those outcomes of the traditional medicines against the COVID-19 in number of research is quite positive. And also we believe that the traditional medicines are usually doesn't focus on pathogen virus instead, but instead they are focusing on adjusting the body's immune system so that it can clear the symptoms and reduce complications. And also rigorous clinical evaluation on traditional medicines against different stages of COVID-19 is really in need. One of the challenges that often observe that diversion to view, particularly on the most promising investigation of traditional medicine, among those traditional medicine practitioners is one of the key challenges. So in order to overcome such a different opinion, I think it is important to strengthen coordinate efforts. So that can be done through the establishment of the national coalition of all the stakeholders throughout the initiatives, and also to inform that multidisciplinary team, which consists of expert in the area of the COVID-19 and traditional medicines, clinical research methodologies, ethics regulation, as well as those persons who are representing the patient. I think each of the government has to increase that research investment, which can enable that researchers systematically collect all the data on the outcome so that we can see the insight how traditional medicine impact on this COVID-19, and it can also help us to identify which formulation is the most promising for further assessment in the phase 2 and phase 3 randomized trial. And also trial design should be very practical in order to generate quick interpretable efficacy and short-term safety results. I think we also have to carry out randomized trial in a transparent manner, which can help clearly defining that robustness of the current national policy on the use of traditional medicine. And also, I think the evaluation of the outcome of traditional medicine will strengthen the evidence base. This is not only for the sake of the public health, but also for the promotion of the traditional medicine status at the international level. So with this, end my presentation. Thank you very much for your kind attention.
Thank you very much indeed, sir. Let's put our hands together for that wonderful presentation by Dr. Kim Sung-chol. He was virtually joining us from Korea. And moving on, the next presentation, we have with us our eminent speaker, Professor Dr. G.N. Kazi, who is currently holding the position of CEO at Hamdard Institute of Medical Sciences and Research, HIMSR, a prestigious modern medical institute conceived and executed under his leadership. Dr. Kazi joined Jamia Hamdard, the Hamdard University, as Vice Chancellor on October 13, 2008, after serving as Director CSIR IIM Jammu for over 8 years. He has more than 25 years in a leadership position and groomed scores of scientists and technocrats in the area of the core competence. He has more than 350 international publications and over 37 granted international patents to his credit. Dr. Kazi sits as a chair or a member of several prestigious committees of various higher education and scientific bodies of the country. And today he is going to present on integration of traditional and modern health systems. Over to you, sir. You have 20 minutes for your presentation. Yes, sir. And let's put our hands together to welcome Dr. G.N. Kazi once again.
Very good morning to you all. We just heard Dr. Kim Sung-chol, advisor WHO, and he was perhaps the most appropriate person to speak about the traditional medicine and its importance. I would like to, at the outset, thank Professor Asim Ali, DG CCREM, for giving me this opportunity to be with you after a long break of about 3 years. I'm here. But I remember the first meeting that we had in the same hall a couple of years back. I acknowledge the presence of Professor Shakir Jamil, who was the former DG CCREM and a distinguished professor at my university, Professor Jafri, present Vice Chancellor Jamia Hamdard, and other distinguished persons on the dais and off the dais. It's a great pleasure for me to be speaking on a topic which was given to me by CCRUM, integration of traditional and modern health systems. I added dash education and research because I will not be speaking on the scientific output of traditional medicine, particularly Unani traditional medicine in the context of COVID-19. This has been slated for in our institute tomorrow. I will be very glad if any one of you would be interested in having the details about the tomorrow's meeting. So we'll be talking about more or less touching upon all the issues that were identified by the first speaker with regard to traditional medicine and its integration in the context of COVID-19. I would also like to mention on behalf of Hamdard National Foundation, Medical Division, and my own behalf, felicitations to all of you and particularly to CCRUM on this particular day, International Unani Day. As we all know that we belong to a Unani stream of healthcare, which in my opinion, I may be pardoned for giving my opinion on this because I'm not a traditional doctor, I'm not a Unani professional, but I have my own perception. Because particularly when I was asked to talk about the integration of traditional and modern health system, perhaps it was on the background that I come from an institute, CSIR Institute, where Indian Institute of Traditional Medicine was the focus of my research for about 15 years. And therefore, perhaps the perception is that I belong to that stream. I have moved on and I am now looking after the modern medical system, but I work within the modern system on the traditional practices as well. The basic concepts of this Unani system, as I understand, have emerged from Greece, but it was contemporary medicine system at that point of time, almost 7 centuries back. Perhaps the system was not built as a Unani system. This is my own perception. It was a contemporary medical system at that point of time. and a great physicians and scientists, as existing about 13th and 14th century around, contributed enormously to the development of health concepts and welfare of human beings, and distributed such concepts world over, resulting thus into strong Western medicine and which is called a conventional system. So what we have adopted as a Unani system was a contemporary medical system at that point of time, which later on transformed into a Western system because of certain developments which I will talk about. India and China, though at that point of time and much earlier to that, developed their own systems. And that was very comprehensive and thrived for a long, long time. So what we see as Ayurveda and Chinese traditional systems were already existing for centuries, even before the Unani system came into being. Unani system thus got incorporated into the Indian system and continues to operate independently and in an integrative mode. Its growth may appear to be limited, but its foundations are very strong. This I have realized when I was chairing some of the very important committees in the Unani system, CCRUM, particularly pharmacopoeial committees. I had realized that how strong the roots of this system are. But from the context of integration, not only to the Indian systems, but to the modern system of Western medicine, I would say that in that context, we are grateful to Hakim Ajmal Khan for pioneering the cause of Unani medicine in India, not only in its traditional state, but its Renaissance state as well. Almost about more than 100 years back, we had started transforming Unani system of medicine that was in vogue for at least 400 to 500 years at that point of time into a modern system in India. In early 20th century, when modern basic science was progressing, Hakim Ajmal Khan proposed the absorption of Western ideas and concepts into Unani system of medicine. It was not traditional at that point of time. It was not also, very rarely seen abroad that the systems that were existing, that they would be transformed within a short span of time. Therefore, having said what he did almost more than 100 years back, he can be called as the father of integrative medicine concept. So therefore, when I was asked by the Indian Parliament to convert my institute, CSIR Institute in Delhi, in Jammu, into an integrative medicine institute, I was baffled actually. And because we were doing natural product chemistry and drug development in our institute based on traditional drugs available to us, I thought Hakim Ajmal Khan had done this much, much early. So therefore, it is most appropriate that on this day, when we are celebrating International Unani Day, and it is at the background of Hakim Ajmal Khan, we should pay respects to him, we should try to understand how he tried to transform the traditional Unani system into a most modern system from the point of view of validation. So therefore, we call him as the father of integrative medicine. He recognized the vital importance of laboratory bench research and clinical validation, providing the therapeutic efficacy of traditional Indian medicines. I think it's a very fascinating story when we look into how in early years of 20th century, he identified a great contributor. I'll come to his importance and his contribution. He said that the great contributors to the Indian traditional medicine were the scientists of that time. And one of the important persons, the two persons that have come onto the stage soon after Ajmal Khan left this world. One was Hakim Abdul Hamid. Hakim Abdul Hamid, founder of Hamdard, and the other was Professor Salim Zaman Siddiqui. It was Siddiqui's work that gave us the insight of the contribution that Unani system of medicine or Ayurvedic system of medicine through its drugs can be identified. Rolfia serpentina was perhaps a strong link that he gave us, which was being used as for hypertension, treating hypertension, hysteria, insomnia, and various neurological disorders. And then Salim Zaman was the first scientist who identified the constituents of Rolfia serpentina. And then named almost 9 such alkaloids named after Ajmal Khan. Ajmalicine, ajmalene, and isoajmalene were some of the molecules. So therefore, I must say, the bench science based on traditional medicine started thriving at that point of time. I would say that Hakim Abdul Hamid took over the stage soon after Ajmal left it. And Hakim Abdul Hamid was basically a great, I must say, Hakim, and also visionary. He developed the university system for where the Unani system of medicine was profoundly followed. And that's rest is the history. We have Jamia Hamdard, which is perhaps one of the top universities, not only for traditional medicine, but for the modern medicine and as well as for biotechnology and pharmacy. Apart from producing graduates and postgraduates, we have a very strong research base which is actually validating the traditional medicine in its proper form. In fact, in the context of COVID-19, we have launched several clinical trials, perhaps in the same lines as was mentioned in the first presentation. And perhaps the net result of these in the context of COVID-19 are yet to come up, but there are several studies which are going on in the integrative mode in Hamdard Institute of Medical Sciences and Research, where a triangular approach has been given, where modern medical doctors, traditional medical doctors, and scientists are working together. And you will see, hopefully very soon, a lot of the outcome of this research, the projects, where CCREM, of course, was part of, developing these concepts, and ICMR was also involved at the same time. The rigor of these studies are going to appear, and I'm sure it's going to be on the similar lines what WHO was propagating in the lecture that preceded. So I would like to conclude here to say that it's a great pleasure for me to be here. It's a great pleasure for me that the continuation of the Unani Day celebrations is taking place even during the present pandemic times, and it will hopefully continue. As I said, that tomorrow we are going to have a half-a-day conclave in our institute on Unani medicine, and I will welcome you all through Zoom or personally to come and visit us on this day. Let me thank you, Asim Saab, for giving me this opportunity here today, and I am thankful to you all for listening to me patiently. Thanks a lot.
Thank you very much indeed, sir. I would now like to invite our distinguished moderator, Professor S. Shakir Jamil, to kindly give his concluding remarks and the closing remarks for this session. Over to you, sir.
Bismillahirrahmanirrahim. Nahmaduhu wa nusalli ala rasulihil kareem. I am very much thankful to organizers, Dr. Asif Ali Khan and his team, for providing me this opportunity. It's my honor, rather, to say a few words after the keynote addresses of two stalwarts, Dr. G.N. Qazi, a great scientist, administrator, academic manager, though not from the clinical background, but also clinical researcher, I can say, because when I was in Jamia Hamdard, he has guided me in a clinical research protocol on arthritis. And at that time, he was the part or heading so many clinical research studies. And another stalwart, Dr. Kim, the regional chief of the Southeast Asian region of the WHO. The first lecture was on traditional medicine and its role in COVID-19. Dr. Kim emphasized the historical and cultural roots of TRM. He further emphasized the holistic approach and gave a detailed account of the WHO objectives, methodologies, and directions regarding the fighting TRM, especially for the fighting of the COVID-19. It's very informative, as I have noted 82 projects have been conducted during this period. He concluded that we should come out with the rigorous clinical outcomes, and most importantly, the divergent views that should be given due weightage. Now it is we to decide that how and up to what extent we can take benefit, we can utilize the facilities, and you can utilize the guidance and benchmarks by the WHO. Fortunately, in previous few years, CCREM has conducted two projects, basically on literary-based projects, funded by WHO. WHO Regional Health Center, Professor Jaffrey, Vice Chancellor, Jamia Hamdard, is here. That is a pending project. Jamia Hamdard can be again established as a regional WHO regional center. Dr. G.N. Qazi, former Vice Chancellor, Jamia Hamdard. It is a very difficult task to say a few words. मेरे लिए उनके लिए सूरज को चिराग दिखाना है, but He has been the founder of the Indian Institute of Integrative Medicine, and definitely integration of the various integration of the scientist, clinician, especially pharmacopoeial scientist, because there is one international problem with the natural systems is the availability of the quality products, and the pharmacopoeial research is the key solution. But one thing I have to submit here, that when this all should happen, and up to some extent work is going on up to some extent, and that should be further promoted. There should be exhaustive studies including clinicians, modern medicine clinicians, pharmacopoeial scientists, chemists, botanists, and ultimately we should work on not so many but few drugs, as Dr. G.N. Qazi Sahab has already been suggesting for a long. But one thing we have to think, that we should be correctly perceived the integration of Unani medicine into healthcare. That should not be misperceived. I am very much thankful again to the organizers, and I am very much thankful to Dr. G.N. Qazi Sahab and also Dr. Kim. Thank you very much.
Thank you very much indeed, sir. And I would now like to invite Professor Asim Ali Khan, DG CCRUM, to kindly do the honors of presenting a token of gratitude and appreciation to all our dignitaries on the dais for the first session. Professor Khan to do the honors of presenting a memento to our distinguished moderators, Professor Abdul Wadud, thank you very much indeed, to Professor S. Shakir Jamil, former Director General CCRUM New Delhi, to our co-moderator, Dr. Sheikh Zubair, former Vice President Unani, Central Council of Unani Medicine, New Delhi. And to our eminent speaker, Professor G.N. Qazi. May I request all the dignitaries to kindly step forward for a group photograph. A group photograph, sir? May I request everybody to kindly step forward for a group photograph? Sir, a group photograph. A group photograph. And ladies and gentlemen, we will quickly with that move on to the next session of keynote addresses. And let's put our hands together for all our dignitaries for that wonderful session we had. Thank you very much indeed. Thank you, Professor Khan, for doing the honors. We now move to the next session, and I would like to invite our distinguished moderators, Professor Saud Ali Khan, Principal Ajmal Khan, Tibbiya College, AMU, Aligarh. May I invite you, sir, to kindly grace the stage with your presence. And let's put our hands together to welcome him. I invite our distinguished moderator, Dr. Zubair Ahmed, Principal Ayurvedic and Unani, Tibbiya College, New Delhi. I invite you, sir, to kindly grace the stage, and let's put our hands together to welcome him. I invite our distinguished co-moderators, Professor Mushtaq Ahmed, President All India Unani Tibbi Congress, New Delhi, and Dr. Muhammad Akram, Associate Professor, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. inviting our distinguished co-moderators to kindly grace the stage with their presence. And eminent speakers for this session, I invite Dr. M.A. Waheed, Member Scientific Advisory Committee, CCRUM, and Member Board of Governors, Central Council of Indian Medicine, New Delhi. A very warm welcome to you, sir. And I invite our eminent speaker, Professor M.A. Jaffrey, Vice Chancellor, Jamia Hamdard, New Delhi. And our rapporteurs for this session are Dr. Amanullah, Research Officer, Unani Scientist 3, and Dr. Shamim, Research Associate, Unani. We begin the proceedings of this session by a presentation lecture by Dr. M.A. Waheed, Member Governing Body, CCRUM, and Member Board of Governors, CCIM, New Delhi. A Padma Shri awardee 2017, is a leading researcher and specialist in Unani system of medicines. Dr. Waheed has served as head of the Central Research Institute of Unani Medicine, Hyderabad, under the aegis of Central Council for Research in Unani Medicine, Ministry of Ayush, Government of India. And he has published 27 research papers in national and international journals and presented more than 60 papers in national and international conferences. And today he is going to present on immune boosting potential of Unani medicine during COVID-19 pandemic. But we will begin with the presentation by Professor M.A. Jaffrey, who is presently working as Vice Chancellor Jamia Hamdard and Professor in Department of Ilmul Adwiya, School of Unani Medicine, Education and Research, Jamia Hamdard, New Delhi. Besides having an experience of 35 years of teaching and research in Unani medicine, he has about 23 years of administrative experience working as the head of the Department of Ilmul Adwiya, serving 3 terms the Dean of the Faculty of Unani Medicine, Jamia Hamdard. And he has served as Director of National Institute of Unani Medicine, Bangalore, an autonomous organization under Government of India for more than 7 years. And today he is going to present on stress problems in academia due to COVID-19, possible solutions in Tib-e Unani. And let's put our hands together to welcome Professor M.A. Jaffrey for his presentation. And sir, may I request you to kindly conclude in 10 to 12 minutes, as the Honorable Minister is going to join us at 11:45. And I would invite Dr. M.A. Waheed, our distinguished and eminent speaker, to kindly join us on the stage, please. Let's put our hands together to welcome Dr. M.A. Waheed. And inviting Professor M.A. Jaffrey for his presentation. Jaffrey, sir, you may kindly continue with your presentation. Professor Jaffrey. So we have Professor Jaffrey's presentation on the ready. So if you could go first, sir. Professor Jaffrey, if you could continue with your presentation. Yes, sir. So you could use that. That's it. Achha.
ये स्टक हो गया, इसको तो कर सकते हैं वापस इसमें प्रेजेंटेशन में।
अच्छा, सर आपके लोड में
लोड वहाँ है, तो देखिए
तो यहाँ सिग्नल्स की प्रॉब्लम है एक्चुअली हॉल के अंदर।
सिग्नल की, अच्छा अभी तो आ रहा था।
दैट इज व्हाई यहाँ पे स्टेज की प्रॉब्लम।
Okay. Bismillahirrahmanirrahim. Good morning to all of you. First of all, I would like to thank the organizers for giving me this opportunity to speak here before you. My topic is stress in academia due to COVID-19, possible solutions in Tibbe Unani. There are 3-4 words in my topic, which are, maybe taken as keywords. I would like to define, as far as stress is concerned, everyone experiences stress and anxiety at one time or another in life. And it's a feeling of emotional or physical tension, and it may be a result of any event or thought that frustrates a man. Anxiety, while, is a feeling of worry and fear, and especially about the future. If we see stress versus anxiety, there may be a fine line between stress and anxiety. Both are emotional responses. When stress is typically caused by an external trigger, while anxiety may be called as persistent, excessive worries that don't go away even in the absence of a stressor. Another word in my topic was academia. Friends, had I spoken in Jamia Hamdard, I would have chosen the word students or teachers. But intentionally here, because I am speaking before the community of CCRU, I have chosen the word academia, which involves students, teachers, and as well as researchers. Another word, COVID-19. People are well aware of signs and symptoms of COVID-19, so I don't need to go in details of this. But besides the main clinical manifestations, fear, depression, and psychosis also play a crucial role, not only in COVID positive cases, but also in general public. And it has been observed during lockdown period in view of apprehension of catching the disease. This was main important reason. Now I would like to discuss incidences of stress-related problems. UNESCO estimates that over 1.5 billion students in 165 countries are out of school due to the COVID-19 pandemic. And as per one research study which was conducted on 8,000 people, following results were obtained. At the beginning of lockdown period, there was increase in emotions, anger, irritability. I think any need to go in detail. It was observed as 6%, loneliness, boredom, 13%. Yeah, this slide is here. I will skip the details. And this all resulted due to sudden change in lifestyle, problems in adjusting to life at home. I'm talking at the moment about the students' problems. Missing colleagues and peers, loss of freedom, because the students have to remain confined at their home and in front with parents around when there was a lockdown. So they were feeling loss of freedom, lack of social interaction, being stuck in same environment for long periods, feeling uncertainty. And after a period of about 2 months, it was noted that they were highly stressed individuals, which made 33%, and moderately stressed individuals, about 50%. Now I would like to discuss challenges faced by the students. As I told, lack of stable and high-speed internet access in rural areas, because teachers as well as students have to remain confined to only on online studies. So they were in need of high-speed internet access, which was very difficult in rural areas. And focus of online teaching is, you are all are aware that it remains only on theory. Hence, no practical training could be done. Especially in medical field, it was very, very difficult. And online education, as far as is concerned, it is not a substitute of regular teaching. but it's an appendage to classroom teaching. It's only a temporary aid during difficult situations. Uncertainty, especially among final year students, internees, preparing for competitive exams. Wastage of time, unemployment, undue extension of internship, postponement of dates of exams. It was very difficult, which caused confidence level decrease, stress due to apprehension of catching the infection. All these problems resulted into stress and anxiety. Challenges faced by researchers: closed laboratories and institutions, libraries, non-availability of human subjects for clinical studies due to risk of COVID transmission, difficult to enroll and review of patients because some hospitals were designated as COVID hospitals. Likewise, problems in experimental studies were also observed in labs. Wastage of time, which could have been utilized for crucial research work, was lost, and delay in submission of MD and PhD thesis and project reports, if we see the situation of researchers. This circle shows various aspects of during pandemic period and post-pandemic period about the stressors for researchers. Say, fear of infection, havoc in experimental setup, fear of contamination, death of cell lines, unexpected time lapses in research work, scholarship disturbances, decrease in productivity of scientific writing. And after that, if we call it a post-COVID period, खुदा करे कि ये post-COVID period हो जाए. Psychological issues are still there, delayed supply of chemicals, fear of infection is still there, depression due to increased duration of research work, peer pressure, administrative support. These are the main things which caused as stressors for researchers. Challenges faced by faculty. Communication gap within academia. And it was very difficult to maintain the discipline and tracking the available activities of students. Because if we talk about the standard measures of teaching, it is said that there must be eye contact, one-to-one contact between the students and teachers, and the teachers should address the students by taking his name. I have gone through this, difficulty, because I have also taken online classes, and it was very difficult. What students were doing, I have seen at my home also, I have seen my children also, what they used to do. They joined the class in beginning, और after that दूसरे कामों में लग गए. कोई नाश्ता कर रहा है, कोई कुछ और काम में चला गया. अब टीचर ये नहीं देख सकता कि जो स्टूडेंट को मैं पढ़ा रहा हूँ, जो क्लास ले रहा हूँ, सारे मौजूद हैं या नहीं. तो प्रॉब्लम ऑफ अटेंडेंस. एंड जब भी हमने ट्राई किया कि भाई, क्योंकि नाम साथ में आ जाते थे लेकिन फेसेस नहीं होते थे, या ऐसा भी हुआ कि बिल्कुल न्यू बैच को हमने पढ़ाना शुरू किया, तो उसमें वी फेस्ड ए ग्रेट डिफिकल्टी. वी वर नॉट नोन बाय देम with their names and with their faces. Whenever we tried to interact, when we tried to ask some questions, so there was no reply. पता चला कि हम उसको पूछ रहे हैं नाम लेके, वो है ही नहीं. शुरू में ज्वाइन किया, अटेंडेंस लगी. तो इट वॉज ए ग्रेट डिफिकल्टी विद टीचर्स ऑल्सो. तो जो स्टैंडर्ड जो हैं टेक्निक्स ऑफ टीचिंग, क्लासरूम टीचिंग, विच इट कुड नॉट बी ऑब्जर्व. एंड अडेप्टिंग टू टीचिंग थ्रू ऑनलाइन मीन्स इट वॉज वेरी डिफिकल्ट to maintain never-ending interest of students. There must be quality of teacher to maintain the interest of students, but it was very difficult to maintain it. To conduct online tests and examinations while ensuring that no unfair means are being used, it was not possible. These are just, I have tried to show various studies which have been published. And friends, just I want to make clear one thing. What I am presenting before you is just a result of review of literature and the information what is available on net. I have not done any study so far. Just I am putting before you my observations and results of net, what is available on net. Now I would like to come to the Unani medicine approach. If we see in the name of what Unani says about the stress during COVID-19, or speaking generally, what Unani presents for the patients of COVID-19 treatment, in the name of COVID-19 cases, no description in classical literature, because these are the new manifestations as far as these things are concerned, whether it is COVID-19 or any other viral exposure. No description with particular name in classical literature. It's not possible under a specific name. And however, Unani offers a great treasure of literature comprising of concepts, principles, and remedies for various disorders. Because Unani, I can say with responsibility with this podium that as far as the traditional medicines of whole world are concerned, I think Unani is the system which is very, very rich. It has been traveled all over the world, well traveled. इसका जो ज़ख़ीरा है वो इतना सदियों में और हज़ारों साल की काविशों के बाद दुनिया भर के तमाम ममालिक में जो चीज़ें राइज थी उनका एक एसिमुलेशन वर्क लेने के बाद वो और सिस्टम्स के साथ में ये प्लस नहीं है. तो वी हैव ए वेरी गुड ट्रेजर ऑफ आवर लिटरेचर, एंड द नीड इज टू बी एक्सप्लोर्ड फॉर न्यूअर डिसीजेस. वी हैव टू कोरिलेट, वी हैव टू गो into the literature and search what answer can be given for these things. A need of the hour is correlating classical Unani knowledge with recent scientific developments for finding a solution. As far as approaches are concerned, great emphasis have been given on six essential principles. Asbab sittar zaruriya. I don't think any need to name those, because everyone is aware of that, but necessary is very necessary for maintenance of health. There is no doubt about that. As far as the quality of diet is concerned, quality of air, environment is concerned, and other essential principles about sleep, about other things, about other activities, or exercise. So these are very, very important for maintaining the health, or for maintaining the immunity also. But we know the present trend about the quality of air, food habits, especially liking for junk foods, aerated drinks, etc. Disturbed and late night sleeping pattern, disturbing the biological clock, especially in youths. I think sufficient number of students is here. This is the main problem in youths nowadays. Whole biological clock is disturbed. When one used to sleep round about at 2 a.m. or 3 a.m., passing the whole night, how can we think to maintain the immunity? Lack of exercise, undue stress, disturbed and late night, I have discussed. Can we still hope for maintenance of health? No, absolutely not. Now, as far as management according to Unani system is concerned, can we, the Unani people, present a solution of these problems? The answer is yes, we can, but I can say that we will. As far as Ilaj with Tadbir is concerned, Unani drugs are there, single drugs, compound drugs. I'm not going into the details of, boosting immunity boosters. All are covered here because our drugs are very good for immunity boosting, no doubt. About regimental therapies, Nutul is the best technique, Talak, Hijama. In COVID-19 stress patients, Nutul may work very nice. It works for ikhraj mawad fasida, tadil mizaj, and roganiyat are very good. There are some clinical studies also which have been carried out in various institutes. I want to name a few. Nutul therapy showed statistically significant improvement in all the parameters of insomnia, severity index, when pre and post interventional values of the parameters were assessed in intra as well as intergroup comparisons. This study was carried out in NIUM, role of Dalak in rehabilitation in post-stroke hemiplegia. The last study is one case study which I would like to discuss. As far as Unani single drugs are concerned, these are limitless, which may work in anxiety disorders or in stress conditions in this era also. So I have just to name a few. This is not the whole list, and I cannot provide whole list here. Neither I am going to discuss nuskhas, etc., because you are all aware with these things. Just in this table, I have tried some recent reports as far as antidepressant and anti-anxiety studies reports are concerned with these drugs. Now I would like to name a few compound formulations which have been found very good in stress conditions. Maybe they may be useful in COVID-19 stress conditions also. These are all well-known things, nothing new is there. Sorry. Now, documentation of the findings. I would like to speak on this slide. As I said, Unani literature is very rich with solid concepts, principles, which were developed after extensive research. ये बिल्कुल गलत कहा जाता है कि यूनानी में रिसर्च अब से 50 साल पहले शुरू हुई या 100 साल पहले शुरू हुई. देखिए इतना वास्ट लिटरेचर, एनसाइक्लोपीडिक वर्क, इतनी एनरिच फार्माकोपिया जो हमारा ज़ख़ीरा है वो विदाउट रिसर्च के, और वो भी ऐसा नहीं है कि वो सिर्फ किताबों तक महदूद है, बल्कि जो हमारा ट्रीटमेंट है, जो लोग एक्चुअल प्रैक्टिस करते हैं यूनानी की, उनके नताइज आप देखिए. तो ये सब जो हमारा लिटरेचर है ये ऐसे ही डेवलप नहीं हो गया. इट वॉज डेवलप्ड, ओके, इट वॉज डेवलप्ड बाई एक्सटेंसिव रिसर्च, बट वट वी लैक इन हिस्ट्री ऑफ रिसर्च. नाउ वट इज द नीड, देन वट we lack in proper documentation, rather I should say digital documentation. And it is said, rightly said, if anything is not documented, whatever you have done, if it is not documented, it is supposed to be not done. Documentation is not a very tough job, friends. It requires only 3 things. What treatment is being given to a patient, what for it is being given, and what is the result of the treatment. If we note, our clinicians in general practice, if we maintain a register, note these things, I think we will add to documentation, and proper documentation will be prepared. Just I am finishing. The final verdict. Unani system of medicine may play a key role in preventing and managing the problems of stress and anxiety in COVID-19 era. However, stringent research is required for their role as adjuvants and as a therapy in mild to moderate cases. Research proposals need to be developed on scientific lines. And in the end, I would like to quote Theodore Roosevelt, former President of United States. It is hard to fail, but is worse never to have tried to succeed. So, friends, if we want to succeed, we will have to evolve with new changes. Thank you very much.
Thank you very much indeed, sir. And now we would quickly invite our next eminent speaker, Dr. M.A. Waheed, Member Scientific Advisory Committee, CCRUM, and Member Board of Governors, Central Council of Indian Medicine, New Delhi. And he is going to present on immune boosting potential of Unani medicine during COVID-19 pandemic. Over to you, sir, for your presentation. And we would request Dr. Waheed to kindly conclude in 10 minutes, as our Honorable Minister, Honorable Chief Guest would be joining us very soon, and we don't have enough time before he comes and we begin with the inaugural session. Over to you, sir.
Very much. Good morning to everyone. Since there's a short of time, probably I'll brief up my presentation. So my presentation is on immune boosting potential of Unani medicine during COVID-19 pandemic. Let us have a flash of the COVID-19. May I have the next slide, please? As all of us know that the global pandemic novel coronavirus that is called named as COVID-19 now has taken the form of worldwide disaster. The outbreak of SARS-CoV-19 caused 12 million, that these are statistics of initial 3 months of the emergence of the COVID-19, which is reported over 12 million cases about in 119 countries within a span of 3 months and various territories, resulting about over 1 million deaths. The viral agent shows rapid outbursts due to the increased adaptation in different environments of different countries. And the patients affected by this pathogen shows various symptoms like common flu, fatigue, cough, shortness of breath, loss of sense of smell, and other complicated problems like, pneumonia, acute respiratory distress syndrome. These are statistics, as I told you initially, that there was no concept of the availability of the vaccine and the therapeutics. So there was the ongoing diagnostics for COVID-19. So patient with strong immunity can survive through this production of antibiotics known as immunoglobulins. So World Health Organization and the many researchers have been emphasized on maintenance of strong immunity and mediated by consumption and use of medicinal plant in different ways in our daily life. All of us know that pandemic disease are of global concern in the present area. To cause a gigantic morbidity and transient regardless of the extensive medical facilities, particularly antiviral therapies have been fraught because of surfacing the mutants competing through the subdues of drugs, targeting these viral elements. So most importantly, enhanced universal travel and swift urbanization has led to the contagious outbreak by raising the re-emergence of these viruses. There have been a report of over 23 million cases of COVID cases, along with that over 8 million deaths globally, which are very commonly used in Indian systems of medicine, which is already documented, researched and documented by various authors across the world. I'll just bring a few of these. Unani somnifera, ashwagandha, naguri. See, the administration of an extract from the powder root of this plant, Unani somnifera, was found to stimulate the immunological activity in mice. Treatment with 5 doses of this Unani somnifera root extract, 20 milligram dose, was found to enhance the total WBC count cells on the 10th day and the bone marrow cellularity, as well as alpha steroid positive cell membrane, and also significantly increased after the administration of this drug extract. Treatment with Unani somnifera extract along with the antigen produce an enhancement in the circulating antibody titer and the number of plaque formation cells in the spleen. Maximum number of these plaque formation cells in the spleen was obtained in the 4th day. Within Morris alba tooth, which is very called, the methanolic extract of this was administered orally at a low dose and high dose of 100 milligram per kg and 1 milligram per kg body weight respectively, and along with the tulsi, Ossipum sanctum. And these used as a strength drug to compare this. It showed a significant increase in the phagocytic index in carbon clearance assay, a significant protection against the cyclophosphamide induced neutropenia, and increase in addition of the neutrophils in the neutrophil addition test. Hence, it was concluded that Morris alba increases both humoral immunity and cell-mediated immunity. So this is one of the best known drug which is available in the Unani system of medicine. Acacia catecho, that is a katira. Acacia catechu extract showed an increase in the neutrophil addition in the nylon fibers, produced a significant increase in the phagocytic index and significant protection against the cyclophosphamide-induced neutropenia, indicating its effect on cell-mediated immunity. On the other hand, Acacia catechu extract produced a significant increase in the serum immunoglobulin level, increase in the hemoagglutination titer values, decrease the mortality ratio in the mice, so suggesting its effects on the humoral arm of the immune system. From the above results, it was concluded that the aqueous extract of this Acacia catechu or the Kathira has a significant effect on the both the cell-mediated and humoral immunity. Jataphocurcas, the immunomodulatory effect of an 80% extract of this methanol extract of this particular drug to 1 day old specific pathogen-free chicks were determined. The stimulation of both humoral and cell-mediated response was observed. So remarkable effect increased the antibody titers, lymphocyte and macrophage cell in blood were computed. Achilla wilhelmsi, that is a Dukhme Gandana. The immunomodulatory activity of this aqueous extract of this particular plant among 25, 50 and 100 milligram per kg body weight for 5 days was given, evaluated on body weight, relative organ weight, delayed type of hypersensitivity, that is DTH, and response and hemoagglutinin titer, that is HT in female Swiss albino mice. So no significant body weight gain differences were recorded in various groups of animals. Significant increase in the relative organ weight of spleen was observed. No elevation in the levels of the liver function test. That speaks the safety of these drugs. Enzymes and kidney relative weight was observed in tested doses of the plant. So the extract of this Achilla illustrated a significant increase in the DTH. That is delayed type of hypersensitivity. This response to the dose of 100 milligram per kg body weight. So in the HT plant extract showed stimulatory effect in all doses. However, these hangs were significant at 50 milligram per kg body weight. So no mortality was occurred in the tested doses. Overall, showed a very good stimulatory effect on the humoral and cell immune functions. Picoriza Flora Kutki. These drug was tested from a methanol extract of this particular drug shows immunomodulatory properties by structure. This which enhances the proliferation of the splenocytes and their response in polyclonal T cells mitigation. So there was also a significant increase in the activity of peritoneal macrophages and natural killer cells, that is NT cells, were treated with doses of this particular plant. So by and large, the dose-dependent increase was also observed in the population of mature T cell subsets. So the production of cytokinase and the CD4 and CD8 population of the splenocytes were also elevated, which the levels of interleukins, the anti-inflammatory markers, were also studied, and these expressed by culture splenocytes were significantly increased when the cells were exposed to a sclerophyte. These results indicate that this particular drug may exert immuno-enhancement effect in immune system. In addition to its traditional use in some diseases, it may become a new immunostimulating agent in the near future. Another drug, Bartang, the seed of Plantigo asiatica, were often used as a traditional Chinese medicine for some immunological weak patients suffering from chronic illness. There are many conditions where with the immune compromised conditions. So the weak patients, immunological weak patients suffering from chronic illness, these use could be related to the immunomodulatory properties of the plant. So in this study, effect of extract of the seeds of Plantigo asiatica were investigated on the maturation of dendrite cells, which play a significant role in primary immune system. There are probably, there is short of time, there are many more drugs which has immunomodulatory effect. Another is a garlic. An important medicine spice displays a plethora of biological effects including immunomodulation. Although some immunomodulatory proteins from garlic have been described, their identities are still unknown. The present study was envisaged to isolate the immunomodulatory proteins from raw garlic and examine their effect on certain cells of immune system, lymphocytes, mast cells, and basophils, in relation to the mutagenicity and hypersensitivity. So finally, these drugs, all these proteins exhibit mutagenic activity towards human peripheral blood lymphocytes, murine lymphocytes, and thymocytes, which speaks the immunomodulatory effect of these drugs. There are spectra of drugs, probably I will not go into that because of the short of time. As all of us know that the natural compounds have contributed enormously to the immunomodulatory therapeutics. Since ancient times, the natural medicines have constituted the treatments with minimum side effect, both as a single use and in formulations. And there are thousands of natural compounds that are known to influence the immune system, be either affecting the functions of the immune cells or affecting antibody secretion to control the infection and to maintain the immune hemostasis. The relevance of this research would be crucial to the search for a better treatment, both to complement those that already exist and to develop new strategies for the prevention and treatment of immune-related diseases. Therefore, it is interesting to dissect the molecular mechanism of the immunomodulatory effect of the natural compounds and to discover the novel, promising candidate that can be used in the future immunotherapeutic strategies like COVID-19. As all of us know that, probably I will speed date. Undoubtedly, there remains much more work to be done by this avenue of natural immunomodulators. Is one highly promising pathway to continue and explore and to investigate. Many more surprises are awaiting to be discovered in the prevention or treatment of inflammatory and immune-regulated diseases in the future, and extensive investigations is required with respect to their mechanism of action at the systemic, cellular, and molecular levels, and extension to a broad spectrum clinical trial. Given the multiple biological effects of these natural compounds, it is exceedingly interesting to design future therapeutic strategies for inflammatory pathologies and malignant diseases and the infectious diseases with a synergetic combination of these natural compounds together with the various conventional therapies. Various herbal medicines, these particular herbal medicines have an effect on innate and acquired immune components. So these medicines have been found to modulate the various components of innate and acquired immunity. Innate is a natural immunity, and which is created is acquired. In fact, based on the proper understanding of various immunomodulatory activities, the herbal plant-derived the secondary metabolites in natural products can be a lead molecules for the future development of immunomodulation for therapeutic use. So various immunomodulators have been suggested in various allergic manifestations, virus infections, and tumor on the basis of experiments performed on various animal models. So some future suggestions. So improvement of the improvement of the study design for clinical studies to establish the herbal drug safety for therapeutic use, international collaborations and pooling of research data from different parts of the world, reinforcement of the target-based approach using newer innovative techniques to identify the lead molecule. More and more research should be focused on existing herbal products, both single and polyherbal formulations, to remove the therapeutic dilemma. Then final message, what to do if you feel unwell. The most common symptoms when you interact, then probably you need to speak to your doctor and seek the treatment. And probably when you are at home and a crowded place, there are guidelines for the WHO given. You need to follow. A lie can be halfway around the world before the truth gets its boots on. Thank you.
Thank you very much indeed, sir. And ladies and gentlemen, may I now request Professor Asim Ali Khan, DG CCRUM, to kindly do the honors of presenting mementos as a token of appreciation and gratitude to our dignitaries on the stage. So we have Professor Asim Ali Khan here with us, DGTC RUM. I would request you, sir, to kindly do the honors of presenting the mementos as a token of appreciation and gratitude. We present to our distinguished moderator, Professor Saud Ali Khan, Principal Ajman Khan, Tibbiya College, AMU Aligarh. Thank you, sir. We present to Dr. Zubair Ahmed, Principal Ayurvedic and Unani Tibbiya College, New Delhi. I would request you, sir, to kindly step forward to receive the memento. Dr. Zubair Ahmed, he's not here. I would invite our co-moderator, Professor Mushtaq Ahmed, President All India Unani Tibbi Congress, New Delhi. And our co-moderator, Dr. Muhammad Akram, Associate Professor, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. Presenting to our co-moderator, Dr. Muhammad Akram. Thank you very much indeed. And we now present to our eminent and distinguished speaker, Dr. M.A. Waheed, Member, Scientific Advisory Committee, CCRUM, and Member Board of Governors, Central Council of Indian Medicine, New Delhi. Thank you, sir, for that wonderful presentation. And we now present to our eminent speaker, Professor M.A. Jaffrey, Vice Chancellor, Jamia Hamdard, New Delhi. Thank you very much indeed, sir, for that wonderful presentation and very informative presentation we had from you. Thank you, Professor Khan, for doing the honors. And may I request everybody to kindly step forward for a group photograph. All our dignitaries to kindly step forward for a group photograph. And ladies and gentlemen, requesting everybody else to kindly remain seated while we set up the stage for the inaugural session. Our Honorable Minister would be joining us any moment now. Once again requesting for all mobile phones to be kept on silent mode. Ladies and gentlemen, requesting everybody to kindly remain seated. The Honorable Minister would be here any moment now, and we will commence with the proceedings of the inaugural session. Once again, a warm welcome to the Unani Day 2021 celebrations organized by Central Council of Research for in Unani Medicine under the aegis of Ministry of Ayush. As we all are aware, every year on 11th of February, the Unani Day is celebrated internationally.
argument. Now, Asim, how do you see Unani's effectiveness in the management of COVID-19? Very briefly.
Similarly, on the pattern of other Ayush systems, the Unani system of medicine is also taking a lot of leads in managing and trying to control this spread. The basic approach of Unani system of medicine in controlling is the increasing the immunity status of the person, because in Unani system of medicine we consider that it is the body within the body that we call as medicatus naturae, that unless and until body is considered to be strong, patient has to otherwise suffer with the disorder. Same is the case with the pandemic, with this COVID-19. So we are also taking a lot of studies in different parts of the country through our various institutions which are spread over the country. And as I told you, the basic focus is on the immunity enhancement. We have many medicines in the United System of Medicine which are known for immunity enhancement, and we are giving those drugs either in single way or single drugs or as compound formulations. And many trials in different parts of the country we are continuing at the moment also, and some of them, as I told you, some prophylactic studies, population-based studies we have already concluded. They are being analyzed, and hopefully the results which are right now we are seeing, they are very encouraging. The system is same. We have a very wonderful, robust system wherein we have multi-level of scientists who are looking after. There is as Dr. Sanjeev Sharma told, that there is a senior group of scientists who are the multidisciplinary task force who basically looks into those protocols, and accordingly we disseminate that through these different parts of our of the country, our institutions, wherein those studies are being carried out. We are finding wonderful results. Many papers are being communicated, and some are in the process. The structure is ready. Hopefully, very soon we will be able to share the results of those studies with the audience across the globe. One more thing is there, as I told earlier also, that we are also taking up certain add-on therapies. That is also, it is not a cure for management. I mean, cure for COVID-19. We are not claiming for that. But we are coming for immunity enhancement as well as certain symptomatic management. We have some known drugs for such kind of symptoms. We are very important and trying to take care of that particular thing. We are getting very encouraging results by combining this, and this is a very wonderful form of integration as we are talking of the Ayush systems of medicine or Unani system of medicine with the modern system of medicine. These are the tertiary care hospitals. So a lot of activities in different sectors in Ayush are going on, including Unani system of medicine. Same with the different state governments in the government of India. They have also distributed lakhs in number in the medicines for immune enhancement in different parts of the country. And that is giving wonderful results. We have found out that in those areas where these medicines have been distributed, and this is now going on for last more than 6 months. So wonderful results we have seen, and very positive results we have seen in those areas. Thank you.
Thank you so much, Asim. Now, this question really goes for both. How does the future look for the Ayush integration in modern medicine today? And how can we guarantee a mixed access to both that is affordable to the universal patient? Sanjeev, now we have only 2 minutes left. This last question goes to Asim. So very briefly, do you find that there are subjects where the two schools of medicine are not compatible? So I believe this goes to Asim. Are there times when the two schools of medicine, I believe modern and traditional, are not compatible?
I don't find that way. Probably they are not that way, that they are not comfortable. In fact, as very rightly we discussed in our talk before, that by maintaining the individuality of both the systems, by respecting each other, probably we can go along. Right now, many models in Indian government, under Indian government governance we are seeing here, and we are practicing them. As very rightly Professor Sharma also told, that various committees are working on it. And while trying to understand, as I told, that while trying to understand each other, we need to respect each other. First, we need to understand each other. And that starts from the school level education. Probably at the school level education, we need to incorporate certain information about the Ayush systems to the modern science people, and the modern science students to the Ayush systems of the student people. We need to understand each other from that level, and the medical system courses, when they go to the graduation, post-graduation, there also be certain elements where we understand each other in a better way. Once we understand each other in a better way, and these models which are working with each other in the different hospitals, in tertiary care hospitals, in Government of India and allopathic hospitals, as well as the Unani hospitals, and in population-based studies and other many models Government of India has experimented and done, and very successful results are available with that. I don't find there is any confrontation between the systems up to the time that we respect each other and we understand each other better. But I feel very strongly that I think for the major benefit of the people, because that is beneficiary, I think all the systems should come together, and whatever the best in them they have, probably this is the need of the hour that we shall provide to the patients, instead of having these walls of not understanding each other. I think this is the high time we shall integrate.
Thank you so much, Asim. Well, this is a wrap for the session. Indeed, a fascinating one. Thank you so much to our speakers for participating, and thank you for watching.
कौन सेक्रेटरी नाम बताइए। अच्छा।
kindly be seated. All mobiles put onto silent mode. The Honorable Minister is joining us any moment now for the inaugural session. Ladies and gentlemen, once again requesting everybody to kindly take their seats, all mobile phones on silent mode. The Honorable Minister will be joining us any moment now. Ladies and gentlemen, once again requesting everybody to be seated, and we are waiting the arrival of the Honorable Minister. The Honorable Minister, along with other dignitaries, will be joining us any moment now. And ladies and gentlemen, please put your hands together to welcome our Honorable Chief Guest, Shri Kiran Rijiju, Honorable Minister of State, Independent Charge, Youth Affairs and Sports. Namaskar and good afternoon. Honorable Chief Guest, Shri Kiran Rijiju, Honorable Minister of State with Independent Charge, Youth Affairs and Sports, Honorable Minister of State, Minority Affairs and Additional Charge, Honorable Minister of State with Independent Charge, Ayush, Government of India. A guest of honor, Shri Pramod Kumar Pathak, Additional Secretary, Ministry of Ayush, Government of India. Distinguished dignitaries on the dais, special invitees, eminent experts and luminaries in the field of health sciences, distinguished officials from the ministries, distinguished participants from the industry, academia and research organizations engaged in the development of Unani medicine and related health sciences, distinguished delegates, respected members of the press and media, ladies and gentlemen. I have the proud privilege today in welcoming you all to the inaugural function of the Unani Day 2021 celebrations and the National Conference on Unani Medicine, which is being organized on the hybrid virtual platform this year. And the theme of the National Conference is Unani Medicine, Opportunity and Challenges in the Times of COVID-19, organized by the Central Council for Research in Unani Medicine under the aegis of Ministry of Ayush, Government of India. Ladies and gentlemen, Unani medicine has the potential to prevent infectious diseases, and Unani scholars have emphasized the use of certain drugs which are known to improve the host immunity during the outbreak of epidemics, endemics and pandemics. With its immunomodulating and prophylactic drugs and therapies, Unani medicine has the potential to play a role in the management of pandemic-like situation. The conference will have scientific sessions on issues related to the health challenges posed by the COVID-19 pandemic and role of Unani medicine in addressing them. And now, ladies and gentlemen, let's begin with paying our homage to our great nation, whom we all are committed to, and as a mark of respect for the national anthem, may I request everybody to kindly rise.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you very much indeed. Kindly take your seats. Ladies and gentlemen, the support of the honorable ministers and distinguished dignitaries present today is an inspiration for all of us. I would now request Professor Asim Ali Khan, DG CCRUM, to kindly welcome the honorable dignitaries with medicinal plants and present a memento as a token of gratitude. We would like to welcome our honorable chief guest, Shri Kiran Rijiju, the Honorable Minister of State, Youth Affairs and Sports, Honorable Minister of State, Minority Affairs, and Additional Charge, Honorable Minister of State, Ayush, Government of India. A very warm welcome to you, sir. Thank you for gracing this occasion. We now welcome our guest of honor, Shri Vaidya Rajesh Kotecha, Secretary, Ministry of Ayush, Government of India, with a medicinal plant and a memento as a token of gratitude. Thank you, sir. We now welcome Shri Pramod Kumar Pathak, Additional Secretary, Ministry of Ayush, Government of India. Thank you, Professor Khan, for doing the honors. I would now invite Shri K.K. Sapra, Assistant Director Admin, CCRUM, to kindly do the honors of welcoming Dr. Mukhtar Ahmed Kazmi, Joint Advisor, Ministry of Ayush. Thank you. I would request Shri K.K. Sapraji to welcome Professor Asim Ali Khan, DG CCRUM, with the medicinal plant and memento. Thank you, Mr. Sapra, for doing the honors. Ladies and gentlemen, established in 1978, the Central Council for Research in Unani Medicine is an apex autonomous organization under the Ministry of Ayush, Government of India, headquartered in New Delhi. The CCRUM develops, promotes, supports, implements, and disseminates scientific research in Unani medicine both nationally and internationally. Besides research-oriented health services, public health initiatives, information, education and communication activities are also undertaken. Over the years, the Council has made significant strides in its research programs and won appreciation from various quarters for its research outcomes. And may I now request Professor Asim Ali Khan, DG CCRUM, to kindly begin the proceedings with his introductory and welcome remarks. Over to you, sir.
Assalamu alaikum and a very good morning to all of you, rather good afternoon to all of you. Shri Kiran Rijiju Sahib, Honorable Minister of State, Independent Charge Youth Affairs and Sports, Ayush, and Minister of State, Minority Affairs. Shri Vaidya Rajesh Kotecha Sahib, Secretary, Ministry of Ayush, Government of India. Shri Pramod Kumar Pathak Sahib, Additional Secretary, Ministry of Ayush, Government of India. Dr. Mukhtar Ahmed Kazmi Sahib, Joint Advisor, Unani, Ministry of Ayush, Government of India. Distinguished delegates and participants, friends from media, ladies and gentlemen. On the occasion of Unani Day 2021 and One-Day National Conference on Unani Medicine, Opportunities and Challenges in times of COVID-19, I extend a warm welcome to honorable dignitaries on the dais and off the dais and all the participating delegates. Friends, Unani Day is an annual event which we observe every year 11th February on the birthday of Hakim Ajmal Khan Sahib. And this year, under the guidance of Ministry of Ayush, we are organizing One-Day National Conference. We have presence of esteemed experts from very premier institutions. CCRUM is an apex organization engaged in conducting research and development on scientific lines. During COVID-19 pandemic also, we played an active role by initiating 4 projects. 2 of them were population-based prophylactic studies. The first one was conducted on COVID-19 hotspots, quarantine areas, through the council centers in Lucknow, New Delhi, Mumbai, Aligarh, Srinagar, and National Institute of Unani Medicine, Bengaluru. The second study was conducted in a population at high or moderate risk of contracting COVID. 2 more case control studies were carried out to observe and assess the safety and efficacy of Unani regimen in preventing the progression of severity of the disease in hospitalized COVID-19 patients. The results of these studies open avenues for new prophylactic drugs. An important lesson learned during COVID-19 times is that immunomodulation is imperative for enhancing host defense responses. Immune modulation, the Unani medicine may play an important role in improving the quality of life and aiding in the process of recovery. We also developed SOPs for preparation and pharmacopoeia standards for Ayush Jushanda. The efficacy of 4 Unani formulations against SARS-CoV-19 viruses were also established through in silico studies. We had also initiated 3 extramural research projects on clinical evaluation of Unani formulation as add-on therapy in the management of COVID-19 patients. CCRUM is also actively engaged in collaborative studies with premier institutions of the country. 2 of our collaborative studies on cancer and pharmacokinetics, stability and quality control studies on Rakyat at MIT University, Noida and Jamia Hamdard, New Delhi, have been completed and the results are awaited. While 11 more studies in collaboration with Vallabhbhai Patel Chest Institute, All India Institute of Medical Sciences, New Delhi, Jamia Millia Islamia, Jamia Hamdard, Central Drug Research Institute, Lucknow, National Institute of Pharmaceutical Education Research, Hyderabad, and Interactive Research School for Health Affairs, Pune, are continuing. The drug standardization program of CCRUM has developed pharmacopoeia standards for single and compound Unani drugs for incorporation in the Unani Pharmacopoeia of India. Besides, standard operating procedures for methods of preparation and pharmacopoeia standards too are being developed. The increasing patronage of Government of India for multifaceted development of Unani system of medicine, along with other Indian systems of medicine, has resulted in Unani system of medicine today being an integral part of national healthcare delivery system. Council is also engaged in academic activities and offer courses at National Research Institute of Unani Medicine for Skin Disorders, Hyderabad, and Regional Research Institute of Unani Medicine, Srinagar. I am also pleased to inform that Regional Research Center Silchar is being upgraded as a Regional Research Institute of Unani Medicine, for which a new state-of-the-art building is under construction. Very soon we are going to have that building with us, maybe another 3-4 months. Similarly, a new composite building for Regional Research Institute of Homeopathy and Unani is nearing completion at Navi Mumbai, and these institutes would also be moving to this building. I may also add that we have initiated action to obtain certification of drug testing laboratories for DSRI Ghaziabad, from State Drug Licensing Authority, Lucknow, for testing of Ayurveda, Siddha, and Unani drugs. All this galore seems futile without the august physical presence of our Honorable Shri Shripad Yaso Nayak Sahib. He has been our torch bearer and has always guided and encouraged us to scale new heights. I deeply condole the untimely demise of his wife in the terrible accident. I also wish and pray for the Honorable Minister's speedy recovery, but it is heartening to inform that he has conveyed his greetings through a recorded video message for the event. We constantly strive to outperform ourselves each year and to set better benchmarks for us and those around us. This one-day conference is a step in the direction. We have eminent invited speakers and a robust panel discussion with selected panelists who will enlighten us in this endeavor. I am happy to inform that in today's conference, which is being organized in hybrid virtual mode, around 1,400 delegates registered online, and we have around 200 delegates participating in physical mode today with us here in this hall. I am sure that the deliberations by the eminent speakers and the brainstorming of our delegates and experts will surely give us an insight into opportunities and challenges we face during COVID-19 times. I once again welcome everyone on the dais and off the dais. Thank you, Namaskar, and Jai Hind.
Thank you very much indeed, sir, for your warm words of welcome and the introductory remarks. Ladies and gentlemen, the Ministry of Ayush envisions to position Ayush systems as the preferred system for healthy living. It aims to upgrade the standards of Ayush education and strengthen research institutions. It draws up schemes for promotion, cultivation, regeneration of medicinal plants used in the Ayush systems. The ministry also deals with the development of pharmacopoeial standards for the Ayush drugs. And I now have the proud privilege in requesting Shri Vaidya Rajesh Kotecha, Distinguished Secretary, Ministry of Ayush, Government of India, to kindly do the honors of addressing the distinguished audience. Let's put our hands together to welcome.
The chief guest of the Unani Day celebration and the seminar on opportunities and challenges in times of COVID-19, Sri Kiren Rijiju, Honorable Minister for Sports and Honorable Minister of Ayush, Sri Pathak ji, Additional Secretary, Ministry of Ayush, Director General of CCRUM, Professor Asim Ali Khan ji, Joint Advisor, Ministry of Ayush, Unani, Dr. Kasmi ji, the Director Generals of other research councils, CCRAS and CCH, Professor Dhiman and Professor Khurana ji, Dr. Manchanda ji, the Director of Delhi Government, Ayush, esteemed guests, dear participants, friends from the media, Namaskar. It is indeed a pleasure for me to address this August gathering on the inaugural session of the Unani Day 2021 and National Conference on Unani Medicine organized by Central Council for Research in Unani Medicine. At the outset, on behalf of Ayush Fraternity and Ministry of Ayush, I would like to offer my prayers and deep condolences for the untimely demise and sad demise of Srimati Vijayaji Naik, the wife of our Honorable Minister Sri Sripad Naik ji, and I also wish Sri Naik ji a speedy recovery. It is indeed an honor to be here, and this event actually is a platform, is not only a physical platform, but I am aware that virtually experts and participants have joined across the country and across the globe for this event. So because of the COVID-19, physical participation is visibly less, but it is because of the COVID. All over the country, different institutions and stakeholders and colleges are participating into this August gathering and event. Government of India is committed to promote and develop traditional systems of medicine, including Unani medicine. Considering the significant role of the traditional systems in healthcare delivery, organizing a national conference on Unani medicine, opportunities and challenges in times of COVID-19 is an apt topic. The Unani system has the capability to manage health problems through holistic approach. Our efforts are focused on enhancing better integration of Ayush systems within the healthcare delivery systems to successfully achieve the pluralistic healthcare goals. National Health Policy 2017 also is mentioning the mainstreaming of Ayush in public health delivery system. The CCRUM is an apex body for formulation, coordination, development and promotion of research on scientific lines in Unani medicine. The Council, through its research programs, has obtained significant leads in areas of clinical research, drug standardization, survey and cultivation of medicine plants, and literary research. Also, standardizing the pharmacopoeial standards of the different Unani drugs and medicine plants. I am happy to see that the delegates from all over the country are participating in the Unani Day and also expert and stakeholders. So it's not only academicians and researchers, but industries are also participating into this event. I'm also happy that during this conference there are expert talks and scientific sessions which focused on various themes. I was going through the themes, and I have seen that it is not overloaded, but very focused discussions and expert talks are arranged. For example, the panel discussion is also based on the outcome and activities undertaken for COVID-19. I'd like to mention that during COVID-19, entire Ayush sector under the leadership of Ministry of Ayush and was very active, and Unani medicine has contributed a significant role into the mitigation of COVID-19. Also, we have signed MOU with PHFI, Public Health Foundation of India, where also CCRUM have contributed, a leading role by arriving at a agreement with PHFI and facilitating other research council officers, research officers for capacity building and training through PHFI. So I must compliment CCRUM for taking this lead and leadership role. Apart from this, I want to mention that Government of India has signed MOU with WHO, and one of the benchmark activity is developing training and education standards for Unani medicine with the help of WHO. So Unani medicine is also one of the part of these terms of reference with WHO. There's another thing that I want to mention here is that with WHO we have another MOU to work with the leading to the publication of morbidity codes of Ayush into the traditional medicine chapter of ICD-11, which is a big step, and this ICD-11 morbidity codes is already ready, and CCRA has launched this portal, Namaste portal. Unani medicine also has standardized all the morbidity codes and then put it in this platform. And I am happy to share that under the leadership of CCRUM, this work is also very well professionally completed, and now we are working with WHO to standardize and to get this published into ICD-11. Also, the standardization of terminology and AHMIS is another key area where Unani medicine has contributed a lot. For example, under Ayush Grid project, Government of India has created and standardized this Ayush-based Hospital Management Information System, AHMIS. And in AHMIS, all the laboratories, hospitals of Unani Council, National Institute of Unani Medicine, they are onboarded and they have implemented this very successfully. And this is also contributing into developing huge data sets, huge evidences of using of Unani medicine in our country. So my compliments for that also. CCRUM has MOU with lot of different organizations, specifically NIPER, Raebareli for research collaborations that I want to mention. And in addition to that, CCRM was able to complete lot of different researches, randomized controlled trials or prophylactic trials or population-based studies for the COVID-19 mitigation. And now most of these studies are completed and they are in the form and the process of taking it to the publications. So for that wonderful task, I also want to compliment the leadership under the able leadership of Professor Khan, the DG CCRUM. At the end, this is a very good example how all Ayush systems are working together, and with the help of Unani fraternity, there is a good exercise going on. It is about education reform in the council's efforts. So Dr. Asim Ali Khan is also a member of the Board of Governors of CCIM, and I must inform that Unani education system is also being upgraded for quality education in the system, Unani systems of medicine. So this is another benchmark that is being achieved. And lastly, Unani system is now also open to the lot of new reforms. For example, last year, Government of India have requested all these Ayush systems that we should have at least integration with each other. So the Unani practitioner should know something about Ayurveda or yoga, or Ayurveda practitioner should know something about Unani. So inter-Ayush fraternity also there is a need of integration. And for that, sir, Honorable Minister, sir, for that what we have actually with the help of Unani experts and all other experts of councils, we are in the final stage of developing electives for each other graduates. So a Unani graduate can opt for elective of homeopathy to understand what is homeopathy, or a homeopathy or Ayurveda graduates can take elective of Unani and vice versa. And all these education systems of Ayush will have yoga as a part of their curricula. So yoga should be everywhere because it's a non-pharmacological interventions, and there are a lot of evidences available. So this is also happening under all these, very good effort and collective effort, I would use this word, by the fraternities of Ayush experts. Thank you so much for inviting me. My best wishes for the successful completion and successful conduct of this seminar, and I am sure that the deliberations and outcomes will be aptly recorded and then implemented in future. Thank you so much. Namaskar.
Thank you very much indeed, sir, for that wonderful address. And now, ladies and gentlemen, may I request our Honorable Chief Guest and other dignitaries to kindly do the honors of releasing the conference souvenir and CCRUM publications. We first release the conference souvenir. This publication is the compilation of messages from VVIPs, VIPs, Vice Chancellors, Directors of various departments, and biosketches and photograph of speakers. We are honored to have messages of Honorable President, Honorable Vice President, Honorable Prime Minister, Honorable Governor of Manipur, Honorable Home Minister, and Honorable Defense Minister. So once again, let's put our hands together on the release of the conference souvenir. We will now release the Handbook of Common Remedies in Unani's System of Medicine. This book is the 4th edition, which is enriched with prescriptions from classical text, and care has been taken to include only the ones that are easy to formulate and contain ingredients freely available in the market. The remedies and the types of diseases included in this handbook cover a wide range of day-to-day illnesses. And finally, we release the Fundamental Research Program Summary of Studies conducted by CCRUM. This book is an enthusiastic collection of many novel studies on the validation of fundamental principles in Unani philosophy, especially those which are of traditional value and biological relevance, spanning around 15 years. Thank you very much indeed, sir, for doing the honors. And now, ladies and gentlemen, we are honored to run a video message by Shri Shripad Yeso Naik ji. Let's welcome him virtually.
Namaskar. Ladies and gentlemen, a very warm welcome to all the distinguished delegates and participants in the Unani Day 2021 and one-day national conference on Unani medicine, opportunities and challenges in the times of COVID-19. I take this opportunity to thank everyone for the heartfelt prayer and message during my difficult time. By grace of Almighty, I am recovering very fast, and we will soon be able to join back to you. I have always been associated with Unani Day celebration. This year also, I convey my best wishes to the success of the deliberation which will take place throughout the day. I'm also happy to note that all the stakeholders from different fields have registered online for this hybrid virtual mode conference, and I'm sure they will be enlightened by the talk of the invited experts. I congratulate the Secretary Ayush, Vaidya Rajesh Koteja ji, and Director General CCRUM Professor Asim Ali Khan ji and his team for making all the efforts for advancement in the Unani system of medicine. And I also put on record commendable work carried out by the Ayush professionals in the times of COVID-19 pandemic. I wish this conference a great success. Thank you very much and Jai Hind. Thank you.
Thank you very much indeed, sir. And ladies and gentlemen, today we feel honored to have with us as the Honorable Chief Guest, Shri Kiran Rijiju ji. And sir, to motivate us with your inspiring ideas, we request you to kindly share your esteemed views with everyone present here today. And ladies and gentlemen, for the inaugural address, please put your hands together to welcome our Honorable Chief Guest.
Secretary in the Ministry of Ayush, Vaidya Rajesh Koteja ji, Additional Secretary Pramod Kumar Pathak ji, Joint Secretary Sri Roshan Jaggi ji, Professor Asim Ali Khan ji, Director General CCRUM, Dr. Mukhtar Ahmed Kasmi ji, Joint Advisor Unani, all the participating delegates, my friends from media, ladies and gentlemen. First of all, I would like to extend my hearty greetings to everyone, especially from the Unani fraternity, for this wonderful event on the occasion of Unani Day. And also for the important national conference titled as Unani Medicine, Opportunities and Challenges in Times of COVID-19, which is very, very appropriate. And let me congratulate also for coming out with these three important booklets just we have released. One is the souvenir, the Unani Day 2021 and National Conference. This is a very nice souvenir you have come out with. And then two very important, one is a handbook of common remedies in Unani medicine. I think this will be very, very handy for everyone, not only for those who are involved in Unani medicines, but for everyone. And the research on fundamentals of Unani medicine, a summary of studies conducted by CCRUM. So these are very important handbooks, and I think in the ministry, under the Ayush, and not only the Unani the sector, but every sector under Ayush ministry, and for everybody, these books are going to be very important. I was very sad when the then Minister Ayush Sripadji met with a tragic accident, and very happy to learn he is recovering very fast. I spoke to him that day, and we all convey our deep condolences for the sad demise of his loving wife, and we also hope that Sripadji will recover very fast and get back to the normal activities. I am not from medical profession, and I don't have much knowledge about this Unani system of medicines. इस यूनानी के बारे में अगर मैं ज़्यादा कहूँगा तो ऐसा लगेगा कि मैं सूरज के सामने में दिया जलाने का कोशिश कर रहा हूँ, इसलिए मुझे ज़्यादा कहने की आवश्यकता नहीं है। जो मेहनत, जो लगन के साथ आपने काम किए हैं, सेक्रेटरी साहब, पूरा ऑफिशियल्स और जो CCRA UM का पूरा टीम, साइंटिस्ट, रिसर्चर्स और जितना भी सपोर्टिंग स्टाफ, कई सालों से आप काम कर ही रहे हैं, लेकिन पिछले 6.5 सालों में खास करके आयुष जब मंत्रालय बने, आदरणीय प्रधानमंत्री नरेंद्र मोदी जी के दूरदृष्टा सोच और विचार के कारण से पूरे एक मंत्रालय का दर्जा देने का फैसला हुआ और मंत्रालय बनी। तब से पुराने रिसर्च, पुराने काम को और लगन के साथ और मेहनत के साथ एक रूपरेखा आपने खींचा और हमारे जीवन धारा में यूनानी मेडिसिन्स को फिर पूर्ण रूप से आपने बहुत महत्व दिया। इसलिए मैं सारा टीम, साइंटिस्ट खास करके जो फील्ड में एक्सपर्ट्स है, आपको मैं अभिनंदन करना चाहता हूँ। इसमें जो मैं यूनाइटेड नेशन की ओर से जो समय समय पे हेल्थ के बारे में गाइडलाइन देते हैं और उनका कंसेप्ट आते हैं, और WHO का जो डेफिनेशन है उसको मैं पढ़ना चाहता हूँ। वर्ल्ड हेल्थ ऑर्गेनाइजेशन का जो डेफिनेशन है हेल्थ एज ए स्टेट ऑफ कंप्लीट फिजिकल, मेंटल एंड सोशल वेलबींग एंड नॉट मेयरली द एब्सेंस ऑफ डिजीज और इन्फर्मिटी। ये मैं मानता हूँ कि बहुत खूबसूरत डेफिनेशन है और इसी को हम लोग बचपन से सुनते आए हैं और हम लोग मानते भी आए हैं कि स्वस्थ जीवन सिर्फ ये शारीरिक नहीं है, इससे आगे भी है, मेंटल है, खुशी और यहाँ तक एक स्पिरिचुअल हैप्पीनेस। इसका एक फाउंडेशन जो यूनानी सिस्टम ऑफ मेडिसिन दे सकता है, बहुत कम दे सकते हैं, मैं ऐसा मानता हूँ। क्योंकि इसका आप हिस्ट्री देखिए, यूनानी मेडिसिन सिस्टम का कितना ज्योग्राफिकल बैरियर क्रॉस करके और कितने अलग अलग समुदाय, अलग अलग ज्योग्राफी, अलग अलग कम्युनिटी के साथ ये मर्ज किया, क्रॉस ओवर किया, इंटरेक्शन किया, फिर कैसे इवॉल्व होकर के आए हैं आज, और आज इंडिया एक केंद्र बिंदु बन गया यूनानी सिस्टम ऑफ मेडिसिन का। तो ये आप लोगों को और आपसे पहले जिन्होंने इस सिस्टम को परखते हुए यहाँ तक लेके आए, इसको मैं याद करना चाहता हूँ और ये भी कहना चाहता हूँ कि जिम्मेदारी आज के लोगों के ऊपर है कि इसको भविष्य में नई पीढ़ी को किस तरह से सौंपा जाना चाहिए। क्योंकि जो एक्सपीरियंस, जो आपने अचीवमेंट प्राप्त किए हैं, उसको तो एक ट्रेजर के रूप में हम मानते ही हैं, लेकिन क्योंकि कोई भी साइंटिफिक हो या नॉन साइंटिफिक हो, रिसर्च बहुत इंपॉर्टेंट होता है। तो इसका बाद जो एडिशन होगा, जो आप नए नए चीज़ रिसर्च के माध्यम से, एक्सपीरियंस के माध्यम से आप इसमें वैल्यू एडिशन करते जाएंगे इस मेडिकल सिस्टम में, इस हमारे ये ट्रेडिशनल सिस्टम ऑफ मेडिसिन, यूनानी और बाकी जितना भी हमारा ट्रेडिशनल इंडियन सिस्टम ऑफ मेडिसिन है, उसमें ऐड करते जाएंगे तो उसका एक्सेप्टेबिलिटी बढ़ते जाएंगे। क्योंकि इसको सिस्टम ऑफ मेडिसिन जो सरकारी मान्यता मिली है, इससे पहले लोगों ने एक्सेप्ट कर चुके हैं, जब भी तो सरकार ने इसको आपको एक मान्यता दी है, रिकग्निशन दिया है। रिकग्निशन तो एक फॉर्मेलिटी है, लेकिन पब्लिक का एक्सेप्टेंस तो पहले हो चुकी है। तो इसका मतलब क्या है कि इसमें विश्वसनीय है, क्रेडिबिलिटी है। किसी भी सिस्टम में क्रेडिबिलिटी पैदा होते हैं पब्लिक एक्सेप्टेबिलिटी से। पब्लिक जब लोग एक्सेप्ट करते हैं तो ये ऑटोमेटिक ये हमारा एक पहचान बन जाते हैं। तो मैं मानता हूं कि जो WHO ने डिफाइन किया है, इसको बिल्कुल इसी डेफिनेशन पे खरा उतरता है यूनानी सिस्टम ऑफ मेडिसिन। और इसका एक खासियत है, ये एक्सेसिबल है, एक्सेसिबिलिटी, एफोर्डेबिलिटी और होलिस्टिक अप्रोच, ये इसका खासियत है। और इसका जो जो बेनिफिट्स है, इसके बारे में मुझे जो मेरे कम समय में जानकारी प्राप्त हुआ उसको आपको बताने का जरूरत नहीं, लेकिन ये कोई भी आम आदमी इसको लाभ उठा सकते हैं। इस सिस्टम ऑफ मेडिसिन का, यूनानी का लाभ उठा सकता है। ऐसे मैं मानता हूँ। ये यूनिवर्सल है और हर कोई इसका लाभ उठा सकते हैं। और इसके बाद में जो एपेक्स बॉडी है हमारे CCRUM, आपने जो काफ़ी सक्सेस जो प्राप्त किए हैं, हमारा सेक्रेटरी साहब जिसका जिक्र कर रहे थे, क्लिनिकल रिसर्च, ड्रग स्टैंडर्डाइजेशन, सर्वे एंड कल्टीवेशन ऑफ मेडिसिनल प्लांट्स, लिटरेरी रिसर्च, ये पिछले लगभग 40 साल में जो प्राप्त किए हैं, उसके बदौलत जो मैं अभी आपको कह रहा हूं कि जो क्रेडिबिलिटी एक्सेप्ट हुआ, इसमें ये CCRUM का बहुत बड़ा रोल है। इसको मैं आपके सामने में उजागर करना चाहता हूं और इसका मैं बधाई देना चाहता हूं पूरा टीम जो भी उस समय लीड किए हैं CCRUM का, और आज के जो हमारे वर्तमान के टीम है, DG साहब और उनके पूरा यूनिट को। और सेक्रेटरी साहब ने जो कोलैबोरेशन के बारे में भी कहा, मुझे बताया गया है, एक तो अपने जो आयुष के अंदर में आयुर्वेद है, योगा, नेचुरोपैथी का, उसके साथ साथ यूनानी, फिर सिद्धा और सवारिकपा, फिर होम्योपैथी, इसके अंदर में जो कोलैबोरेटिव एफर्ट है ये भी बहुत प्रशंसनीय है। और दूसरे जो संस्था है, दूसरे ऑर्गेनाइजेशन है, उनसे भी जो कोलैबोरेशन कर रहा है उससे भी बहुत लाभ मिल रहा है, बहुत ही पॉजिटिव रिजल्ट उससे भी प्राप्त हो रहा है। मैं ये चाहता हूं कि इस कोलैबोरेशन का जो एफर्ट है उसको और बल देने की आवश्यकता है। हमारे आज जो इस कॉन्फ्रेंस में जुड़े हुए जो यंग रिसर्चर्स हैं, यंग स्टूडेंट्स हैं, कुछ यहाँ आए हैं और कुछ वर्चुअल मोड में, इस हाइब्रिड मोड में हम लोग काम कर रहे हैं, उनको मैं कहना चाहता हूँ कि आपके लिए रास्ता खुला है, बहुत बड़ा रास्ता है और ये आपके लिए बहुत बड़ा अपॉर्चुनिटी भी है। तो एक दिन का जो कॉन्फ्रेंस है उसमें तो बहुत आपको सीख मिलेगा ही, लेकिन आपके अपॉर्चुनिटी के लिए, आपके रिसर्च के माध्यम से आगे तरह तरह के अलग अलग क्षेत्र में आप जाएंगे और यूनानी सिस्टम ऑफ मेडिसिन को आप स्प्रेड करेंगे, अवेयरनेस क्रिएट करेंगे। उसके लिए जो भी समर्थन सरकार की ओर से देना चाहिए, हम लोग पूरा प्रतिबद्ध है, आपको समर्थन देते रहेंगे। एक चीज मैं जैसे कहा शुरू में, बहुत लंबा मैं नहीं कहना चाहता हूं, लेकिन एक चीज मैंने अनुभव किया है। प्रधानमंत्री जी जब भी कुछ एक पब्लिक फंक्शन या पब्लिक इवेंट होते हैं, स्पेशली जो हेल्थ एंड वेलबींग से रिलेटेड, तो उसमें जो अपने इंडियन या अपना जो ट्रेडिशनल सिस्टम ऑफ मेडिसिन को वो जिक्र जरूर करते हैं। और कोविड के समय जब हम सब ने ये देखा कि क्या करेंगे किसी को पता नहीं, उस समय भी प्रधानमंत्री जी ने कहा कि जो इम्यून बूस्टर के लिए अलग अलग आपने क्लिनिकल ट्रायल के बाद में जो निकले हैं और इम्यूनिटी को जो और बढ़ावा देने के लिए आयुष मंत्रालय का प्रयास और हमारे सिस्टम ऑफ मेडिसिन ने जो अलग अलग यूनिट ने जो सामने में आया, उसको लोगों तक ले जाने के लिए प्रधानमंत्री जी ने लगातार अवेयरनेस क्रिएट करने का कोशिश किया। और बाद में मुझे जब ये मंत्रालय का अतिरिक्त पदभार दिया था, तो मैंने उस समय भी ये कहा था, सेक्रेटरी साहब, हमारे स्टाफ को, मैंने सारा ऑफिसर्स को भी कहा कि जितना प्रचार और जितना लोगों को जानकारी होना चाहिए उतना नहीं हुआ। बाद में मुझे पता चला कि सबसे ज़्यादा लोगों को लाभ इस कठिन कोविड-19 के समय और सबसे ज़्यादा मदद मिला है तो ये हमारे आयुष मंत्रालय का एफर्ट का लाभ मिला है। बहुत लोगों को इसका अंदाजा नहीं है, क्योंकि क्या दवाई खाना चाहिए, क्या इलाज है, कोई वैक्सीन तो था नहीं। तो अपना शरीर को, अपना जो पूरा सिस्टम को ठीक करने के लिए यूनानी और हमारे जितने भी ट्रेडिशनल सिस्टम ऑफ मेडिसिन है, इसने एक तरफ से देश को बचाने का सबसे बड़ा योगदान दिया है। इसको मैं अभी आपके सामने में कह रहा हूं और जिस प्लेटफॉर्म में भी जाऊंगा, जहां भी जाऊंगा, और खास करके हमारे युवा वर्ग को, क्योंकि मैं देश का खेल और युवा मामले का मंत्री भी है, तो उसको मैं बताते रहूंगा और ये भी कहूंगा कि ज़्यादा से ज़्यादा आप आयुष का जो प्रोडक्ट है यही इस्तेमाल करें। ये खिलाड़ियों के लिए भी बहुत अच्छा रहेगा, देश के युवाओं के लिए, भविष्य के लिए भी बहुत अच्छा रहेगा। ये
मैं आपको आपके माध्यम से ये मुझे जब खबर मिला कि आपने इतना काम कर चुका है तो देशवासियों को इसका जानकारी होना बहुत आवश्यकता है कि आपका कितना बड़ा कंट्रीब्यूशन है। आज दुनिया में देखा जा रहा है कि हमारा हिंदुस्तान कोविड-19 को हराने का जो हर देश ने प्रयास किया है उसमें प्रथम स्थान पर भारत खड़ा है। तो वो प्रधानमंत्री जी का दूरदृष्टि और हमारा जो पूरा टीम हेल्थ सेक्टर में हमारा आयुष के जितने टीम है आपके बदौलत ये हमारा देश ने प्राप्त किया है। तो इसलिए आज फिर से इस बहुत ही महत्वपूर्ण यूनानी दिवस के अवसर पर सबको पूरा मिनिस्ट्री के टीम हमारे जितने भी जो ऑर्गेनाइजेशंस है साइंटिस्ट रिसर्चर्स जितने भी एक्सपर्ट्स हैं इसके साथ साथ हमारे देश की जनता और पूरे दुनिया में जहाँ जहाँ यूनानी सिस्टम को मानते हैं जानते हैं पूरे को मैं शुभकामनाएं देता हूँ बधाई देता हूँ। और आज के बहुत खूबसूरत कार्यक्रम आपने रचना की और मुझे मुख्य अतिथि के रूप में बुलाया इसके लिए आप सबको मैं धन्यवाद देता हूँ और आपको आपका सक्सेस के लिए मैं मुबारकबाद देता हूँ और भविष्य के लिए शुभकामनाएं देता हूँ। जय हिंद।
हार्दिक धन्यवाद सर। Sir, it is your support that we have been able to promote Unani medicine effectively, and we thank you very much indeed, sir, for the words of encouragement, and we look forward to your continued support and are grateful to have an inspiring personality like yours to address the gathering and the issue of the Unani medicine in the country today. And now, ladies and gentlemen, may I invite Dr. Mukhtar Ahmed Kazmi, Joint Advisor, Ministry of Ayush, to kindly propose the vote of thanks.
Good afternoon. Shri Kiran Rijiju ji, Honorable Minister of State, Independent Charge, Youth Affairs and Sports, Ayush, and Minister of State, Minority Affairs, Honorable Shri Ved Rajesh Kutecha ji, Secretary, Ministry of Ayush, Government of India, Shri Pramod Kumar Pathak ji, Additional Secretary, Ministry of Ayush, Professor Asim Ali Khan Sahab, Director General CCRUM, Professor Khurana DG CCRS, Professor Dhiman, Professor Dr. Manchanda ji, Advisor Homeopathy Dr. Dugal ji, और फार्मर एडवाइज़र डॉक्टर मोहम्मद ताहिर साहब, प्रोफेसर जिलुर रहमान साहब, प्रोफेसर जाफरी वाइस चांसलर जामिया हमदर्द, डेलीगेट्स, distinguished guests, officers and officials from the Ministry of Ayush, Research Councils, friends from the media, ladies and gentlemen, it is great honor and privilege for me to propose the vote of thanks in the inaugural function of National Conference of Unani Medicine being organized by the CCRUM as a part of Unani Day 2021. We express our sincere gratitude to Sri Shripad S. Nayak ji for providing his blessing in the form of recorded message for this event. I pray for his speedy recovery. I express my heartfelt gratitude to Shri Kiran Rijiju ji, Honorable Minister of State, Independent Charge, Youth Affairs, Sports, Ayush, and Minister of State, Minority Affairs. Sir, it is an honor to have you here today. We are all inspired by your great words. I must express my heartfelt gratitude to Vaidya Rajesh Kutecha ji, Secretary, Ministry of Ayush, Government of India, for his gracious presence and giving the blessing to the function and continuous support and encouragement to the Unani system of medicine. I am deeply obliged to Sri Pramod Kumar Pathak ji, Additional Secretary, Ministry of Ayush, Government of India, for his guidance, support and encouragement. We are thankful to Professor Asim Ali Khan, Director General CCRUM, for taking his initiative of observing Unani Day by organizing the national conference on the theme Unani Medicine Opportunities and Challenges in the time of COVID-19. We are also thankful to all Unani stakeholders for their enthusiastic participation in this national conference. We would like to thank all our honored guests, delegates, participants, officers and officials of Ministry of Ayush for their presence and participation. We thank you all for being with us today physically and online in our endeavor for promotion of Unani medicine. Last but not least, we would like to thank the esteemed members of the media for their kind presence for covering this event. Thank you. Jai Hind.
Thank you very much indeed, sir, for kindly proposing the vote of thanks. And may I now request everybody to kindly rise once again for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे.
Thank you very much indeed. And ladies and gentlemen, once again we thank our Honorable Chief Guest and other distinguished dignitaries for gracing this occasion. And I invite all our delegates to kindly join us for lunch served outside in the atrium. And we will commence the next session at 2 o'clock sharp, requesting everybody to be back and seated by 5 minutes to 2 for the next session. Thank you. Ladies and gentlemen, we are ready to commence with the next session. We have to be in time as we are also on virtually, and there are more than 1,000 people logged in on the virtual platform who are waiting in time for this session to begin. And we are inviting our distinguished moderators on the stage. Professor Syed Mehtab Ali, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. We have with us our distinguished moderator, Dr. Muhammad Khalik. He is Assistant Drug Controller, Directorate of Ayush, Delhi Government. Our co-moderators are Dr. Ghulam Nasir, State Ayush Coordinator, Government of Haryana, and our co-moderator, Dr. Khurshid Ahmed Ansari, Associate Professor, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. And I would like to invite our eminent speakers, Professor A. Venkatraman, he is from Faculty of Management Studies, University of Delhi, New Delhi, and Dr. R.K. Manchanda, Director of Ayush, NCT of Delhi, Health and Family Welfare Department. And the rapporteurs for this session are Dr. Farah Ahmed, Research Officer, Unani, and Dr. Anju, Research Associate, Unani. So, ladies and gentlemen, the time duration for this session is approximately 40 minutes, which gives us about 15 minutes for each presentation and closing remarks by the moderator. Our first eminent speaker, Professor A. Venkatraman, is Faculty of Management Studies, University of Delhi, South Campus, New Delhi. Teaches Human Resource Management and Health Policy at the Faculty of Management Studies. His research interest is focused on exploring and leveraging public-private partnership, options to improve equitable access to healthcare services for the poor. And today he is going to present on engaging the stakeholders in combating COVID-19 pandemic. Over to you, sir, for your presentation. A very warm welcome to you. And may I remind you, sir, you have 15 minutes for your presentation. Sir, over here, sir. I'm sorry, sir, the pointer is that side, if you could kindly go there.
Good afternoon, and warm greetings from my university, my faculty, and myself. First of all, let me thank the organizers of this conference, National Conference on Unani Medicine, and also Unani Day. Compliments to all those people who work in this particular system, and you are doing human service, and we perhaps continue to look forward to more and more services from this alternate systems of medicine. My brief talk is going to be on who are the stakeholders and how did the government of India engage the stakeholders during the past 1 year, and what lessons we learned and what lessons are still to be learned is something that is the focus of my talk today. What I plan to do is, can we go to the next slide please? What I plan to do is this, that I would be elaborating on a document that I wrote for the WHO Geneva. This is a paper that was rather a note that was circulated for all the countries. This particular document was prepared on the basis of our thoughts about how to engage the private sector, but I will be speaking more on greater number of stakeholders, not just the private sector alone. But to really think about who are the stakeholders in a healthcare system and who are the stakeholders in a pandemic is the simplest answer. Each one of us are stakeholders in a health system, and particularly in a pandemic, our stakes, our responsibilities, and our accountabilities increase manifold. As a citizen, as a healthcare provider, as a private sector person, or as a public sector person, all of us have a greater responsibility in our hands. And therefore, the stakeholders is a very loose term, but all of us are important players in preventing, controlling, and mitigating this disaster in the form of a pandemic. But having said that, India had done remarkably well in terms of how it handled the COVID situation. I think the first 3 months had been kind of dithering fear psychosis, what you might like to say. But over a period of time, we have overcome those, and today we are talking about how many people got vaccinated. So we have come a long way in actually moving forward in our own ability to fight this particular pandemic. What I plan to do is to talk about broadly 8 major areas of our thought process in terms of how did the government of India engage various stakeholders in curtailing or combating or controlling this pandemic. This figure is drawn for the purposes of the note that I have prepared, but then I will simplify this, and I would like to really mention that we have broadly 8 strategies and a number of stakeholders within these strategies to be thinking through. Strategy number 1 is about, I'll go by one because this is the last slide and I will focus most of my presentation on this. The first stage or first strategy that Government of India did was to constitute task force and empowered advisory groups. Government of India did 12 task forces, constitute 12 task forces, and they ranged from civil society, academicians, scientific community, private sector industry, hospitals, all of them in different kind of task force. And they were reporting directly to the Prime Minister. The task force also did a quick mapping of all the health sector resources in this country in terms of number of ICU beds, number of ventilators, number of COVID care facilities that could be created. Their capacity was also assessed in terms of whether they are capable of handling any kind of hospital admissions. And during that period, we realized that the number of ventilators in this country and the number of ventilators which are dysfunctional in this country is close to 65% of dysfunctional ventilators in this country in the public sector alone. That was a kind of a revelation in terms of number of ICU beds in this country and the number of ventilators that are available. If you listen to the finance minister in this budget, you realize that she mentioned about district level critical care units. And the district level critical care unit comes from this evidence that we do not have sufficient number of ICU beds in the public sector. And that's the plan, that's a strategy, that's a task force, that is the way that we are moving forward. The second strategy was to do with the screening, diagnosing and referring the patients. Till yesterday, India had tested 20 crore population, 20.3 crore population, or 20.3 crore tests have been carried out. There have been 2,373 laboratories for COVID tests that have been empaneled. 70 lakh people have been vaccinated. States like Andhra Pradesh, Bihar used telehealth call centers, sample collection centers as a kind of integrated service provision to screen the potential COVID cases and refer them. Most states included the tests and the treatment in the private sector laboratories and the hospitals under PMJY or Ayushman Bharat scheme. There have been some controversies related to the pricing of the testing, but the Supreme Court stepped in and made a resolution out of it. What could have been possible, which I think Dr. Manchanda will also talk about what could be possible, is this. We perhaps had lost an opportunity to augment our public sector infrastructure For example, there are many district hospitals where the laboratories are dysfunctional. Could we have used this opportunity to get the private sector to work together, or NGO hospitals, to develop laboratory advanced diagnostic centers? Strategy number 3. This is in terms of hospital treatment, hospitals to be empaneled for treating the COVID cases in ICU facility. If you remember, many of you realize that Government of India categorized the COVID cases into 3 levels of treatment centers. The first level was called as isolation and quarantine facilities. The second was called as COVID centers, and the third was called as COVID hospitals. This was both in the public, private, NGO, and any other hospitals which are run or facilities run by the community-based organization. If you remember, Indian Railways set out 5,000 compartments or coaches, and in each coach 12 beds for isolation facilities were created. That in a matter of few weeks, we were having almost 40,000 to 60,000 capacity for isolation wards or isolation facility. There were a large number of protocols and the guidelines were developed. If you visit any of the ICMR website, you will realize that a very large number of protocols were developed. Many states developed large and small COVID care facilities. The PMJY temporarily accredited a large number of private hospitals to provide emergency care and treatment of non-COVID cases. This was what we call it as normally insurance scheme empanels a hospital, accredits an hospital after thorough checkup. But during the COVID time, Ayushman Bharat scheme, that is your NHA National Health Authority, had on an emergency purposes accredited a very large number of hospitals for treatment of COVID cases as well as non-COVID cases. In many countries, I don't know whether you heard about this, in Italy, Portugal, Spain, etc., a large number of private hospitals were nationalized to look after the COVID cases on an emergency basis. Temporarily nationalized. We are not saying that we tend to use the phrase in India in a reverse order. We are privatizing the facilities. Whereas in most of the European countries, they nationalize the private facilities for temporary relief. But also please remember that a very large number of private hospitals in India are bleeding right now. They are at the verge of closure. They are at the verge of either the revenue had dried up for the last 6 months. The strategy number 4 was about supplies and procurement. If you remember, suddenly the spike for PPEs went up enormously. Till that point of time, India was manufacturing, till May 2020, India was perhaps manufacturing not more than 30,000 to 60,000 pieces of PPE. But within a matter of few months, 3 months, India was able to manufacture close to 1 million pieces of PPEs. And we became, instead of gross importers or net importers, we became exporters. That's the capacity that we have within our own industry, our own, the stakeholders that we might loosely call them as. If you remember the sanitizers, if you remember the ventilators, if you remember the PPE kits, if you remember the oxygenators, all of them at some point of time were imported, and today we have everything on a self-sufficient mode. For example, CB-NAT machines which were used for tuberculosis was redeployed for the purposes of COVID testing. Car manufacturers like Maruti and Mahindra were willing to manufacture ventilators. Alcohol companies, the distilleries were willing to manufacture the hand sanitizers. That is the way repurposing was done in this country. Besides this, government also extended short-term and long-term credits, rapid research grants, buyback guarantees, and regulatory facilitation like quick licensing for production of PPE kits, etc. India, all of us would know that by now, is a success story as far as the vaccine is concerned. That couldn't have been possible without the active support of the government. Strategy number 5 was about human resources. In terms of human resources, government had done a number of steps. For example, getting the private individual practitioner chest clinicians into the government hospital, re-employment of retired staff, redeployment of people who were working in other specialties into respiratory infection units. We also looked at how interns and students, PG students, can also help us in looking after the COVID cases. Strategy number 6, which is about ICT, information communication technology, and deploying them. Besides the telemedicine and telehealth consultation, you know that Arogya Setu was quite popular, and it continues to be very popular. Tele-monitoring of patients, training of healthcare staff through teletechnology was also deployed on an urgent basis here. Centralized data centers were established both at the state level as well as at the central level. Chat bots were created for the purposes of question and answers. You would also remember drones at some point of time was used for monitoring the social distancing. But drones in many countries were used to pick up samples, deliver drugs into remote parts. Strategy number 7. This is related to social safety, community mobilization, and behavioral change. During the pandemic, somewhere around the month of April, May, June, we had seen a very large proportion of people on the roads moving to their villages, which was a global, within quote, an embarrassment for India. But at the same time, Government of India invited, this is something that is not very well known, 90,000 civil society organizations to pick up food grains from Food Corporation of India, godowns, and provide food and shelter to this migrant population. But it's a different story that we didn't get to see that kind of an effort pacifying the crowd. But we did try to put in our best foot forward as far as the relief to these people were concerned. Strategy number 8, and the last one, we also used private sector and donor resources. If you remember, during the month of April, a very large number of Indian companies donated CSR funds running into about 3,000 crores and above. And this went into a Prime Minister's Relief Fund specifically for the COVID care. Besides this kind of a CSR funding, we also had Rockefeller Foundation, Bill and Melinda Gates Foundation providing seed money for vaccine development in India. And that's how the resources was also mobilized. I'm not getting into the more details about this, but since time is up, therefore I would mention the last point here. One of the most important lessons that we learned during this particular pandemic is engaging a wider network of stakeholders is critical, not only for the purposes of controlling this pandemic, but today, with an awakened sensitivity towards public health, we, the stakeholders, have to play a role in strengthening our health system. We cannot let our health system to continue to be neglected forever. We have neglected it for so long till now, and we need to now consider this as our wake-up call. Thank you so much for your patience.
much indeed, sir. That was a very informative presentation on engaging the stakeholders in combating the COVID-19 pandemic. And now I have the proud privilege in inviting our eminent speaker, Dr. R.K. Manchanda. He is Director Ayush, Government of NCT of Delhi, ex-Director General CCRH, Ministry of Ayush. He has also served as co-chairman, subcommittee of Drug Technical Advisory Board, Homeopathy, Government of India. And prior to his role, he has had 33 years of professional experience in the field of homeopathy, including about 20 years as Deputy Director, Assistant Director, Homeopathy in Department of Health and Family Welfare, Directorate of Ayush, Government of Delhi. He has contributed significantly in the development of homeopathy and was instrumental in the opening of 66 new clinics, strengthening of homeopathic education and research in Delhi government institutions. And today he is going to present on role of Unani and other Ayush systems during COVID-19 pandemic, sharing experiences. And ladies and gentlemen, let's put our hands together to welcome Dr. R.K. Manchanda. And may I request you, sir, 15 minutes for the presentation.
Good afternoon to all of you. At the outset, I would like to convey congratulations on Unani Day 2021. Today I'll be just sharing with you during COVID-19 pandemic what experiences we had with Ayush systems in Delhi. So we all know about this report that was released by WHO in May 2019. This report laid the foundation that what is happening in traditional and complementary medicines across the world. And this report contains information about 179 member states. This is very important graph where we see that Unani system is practiced in about 82 countries of the world. And among these 82 countries, if you look at Indian situation, Unani system has been nicely embedded and integrated into the system as Ayush system. We have ministry to give focused attention. We have proper recognition, equal status to the physicians, autonomous councils for the research, statutory councils and now commissions for education, monitoring the standard of education, and national institutes. They are working as model institutes, and we have provisions in Drug and Cosmetic Act for drug standard, availability of the standard drugs in the market. So with this, India has a strategic advantage in terms of manpower, infrastructure, legislature, acceptance, institutionalization, and standardization as regard the institutionalization is concerned. But where we are, despite having these strengths, we have certain weaknesses in the system. And these systems are inadequate research base to complement the clinical successes. So we have very limited documentation. There's a less interaction among stakeholders. There's a lack of critical thinking within the institutions. And there is lack of international exposure. But we have opportunities. With this strength, we can be the world leader, and we are otherwise. But in qualitatively also, we can be the world leader in Unani systems of medicine. So we need to utilize this potential abundant human resource for the development of the system. But remember, there is a threat. There are repeated attempts to defame Ayush systems and questioning its usage by public. And the focus of these attempts is to distort the image in the public. If we look at what kind of practice what we are doing, our practice is mostly based on traditional knowledge, whatever authorities have written, and very less we rely our practice very minuscule as regard the research base is concerned. But what is required is we need to build research projects in the form of high quality case reports, cohort studies, randomized control trials, and ultimately systematic reviews. and our practice has to be evidence-based. Only then we can be the world leader. But why we have limited research? Because our infrastructure in these colleges and our manpower teaching in these colleges have very less knowledge about research, and lot of scarcity of infrastructure, manpower in terms of research is there. But what is needed is we need to link education with research. There are national and international challenges as well as opportunities. So with this brief introduction, I would just like to share what we did in COVID-19. Delhi government is working with a vision to provide promotive, preventive, curative and rehabilitative care to the people of Delhi by integrated Ayush facilities and utilizing their potential for creating healthy society that uses drug optimally. We have a mission. We are working in a mission mode where our focus is on improving the quality of education. Our focus is on building up research acumen of Ayush practitioners as well as Ayush teachers. And we are promoting Ayush globally. So with this sustained and free of cost availability of Ayush services to Delhiite is ultimate mission. We are thankful to Government of India that they laid the policy foundation for all the Ayush system, what they are required to do as regard COVID-19 pandemic is concerned. And Delhi government followed this. In all 173 dispensaries and all the medical colleges were put into services. Their services were strengthened, and even the other institutions, those who are providing Ayush care like MCD, NDMC, they were taken on board for providing care during this time. First, we issued advisory wherein specific mentions were given about the self-care measures, Ayurvedic measures, homeopathic measures, and Unani system measures. And all this advisory in all the languages were widely circulated among Delhiites. Then preventive and prophylactic medicines were stored in all our clinics, and these were distributed not only through our centers but by public outreach. Strategies that were given by Government of India were further discussed within the system, and treatment facilities even to the convalescent patient, mild to moderate patient, even to the people, those who were admitted in allopathic hospitals of the government, they were all given this option of using Ayush systems. Ayush medical infrastructure was converted into dedicated COVID care centers, and all the doctors were given opportunity to treat these patients based on their traditional knowledge and the directions of the authority, that is Government of India, and develop further evidence in COVID-19. So all our hospitals, even allopathic hospitals where we have our integrated Ayush units, they were asked to distribute Kada, Jushanda, whatever was available in those institutions, and depending upon the specialty of the medical officer in those institutions. So all GTB hospital, LN hospital, their Ayush systems medicines were also used even for IPD patients. All the Ayush doctors were given specific training and were posted in these centers. Even all private practitioners, about 5,000 private practitioners, including about 1,500 Unani doctors, were given online training on COVID-19. Ayush immunoboosters were distributed in containment zone to the captive people, those who are the frontline warriors like police. It was distributed in containment zone, and this work we did in collaboration with all the council. I'm thankful to the council, especially Central Council for Research in Unani Medicine also, because they helped us in doing this in certain areas. Dietary modifications were the norm in all allopathic hospitals based on Ayush recommendations. Even yoga instructors were deployed in collaboration with Morarji Desai Institution and Central Council for Research in Yoga and Naturopathy in all these hospitals, as well as home-based people were also given regular virtual yoga classes. Not only this, we tried to capture as much data as possible. We participated in clinical trials of Unani regimen in preventing the progression of severity of the disease in hospitalized COVID-19 at Ayurvedic and Unani Tibia College. We participated in Ayush 64 trial, in retrospective analysis of clinical presentation and Ayush treatment of patients. So, lot of data collection was done during this period. Prakriti analysis, Mizaj analysis, all this thing was done. And fortunately, I'm happy to tell you that we have been able to complete all these projects as well. Even the data in the target that were assigned by Central Council for Research in Unani Medicine, that was completed at ANU Tibia College. And the outcome has shown that wherever Unani medicine was given, the recovery within 7 days was much more than the control group. Is there? The data will be published by CCRUM in due course of time. So this is just one data from our center at ANU Tibia College. In addition to that, retrospective data has been, all these data has been placed now in public domain, and some of the papers are being peer reviewed and some have been published. Like this on Prakriti has been published in peer reviewed journal, PubMed Index journal recently in last week. Similarly, even in homeopathy, we did this data capturing, and a large scale pragmatic placebo controlled trial is already going on in Delhi for the prevention potential of homeopathic medicines. So this is also another paper that has been published in respect of homeopathy and in PubMed Index journal, and this is how to use this prognostic factor model for doing further randomized controlled trial. So what I could see in an overall picture, that based on the information in tradition, based on the directions of the authority, we have been able to complete cohort studies. Now the next step is we have to move for the randomized controlled trials and thereafter systematic review. So, friends, what strategies we need to follow? Existing Ayush medical institutions are required to be converted to the centers of excellence and hubs of research. These institutions should focus on high-quality research-oriented education, evidence-based patient care. The subject of community medicine should be taught in greater details in these colleges, and curriculum should focus on critical thinking, modern research, and biostatistics tools. Industry should consider adopting colleges of India and strengthen research infrastructure, support independent researchers. This hand-holding will ensure infrastructure and improvement in quality of human resource from India for better future of Ayush system. Most importantly, multidisciplinary team of government representatives, medical colleges, research council, pharmaceutical institutes should focus on modernizing the Ayush drug development processes. Those are very, very specific to COVID-19. So this type of situation, this type of strategy we need to follow. So with these words, thank you very much for giving me this opportunity to be with you.
Thank you very much indeed, sir. I would now request Dr. Khurshid Ahmed Ansari, our co-moderator, to kindly sum up and give his closing remarks.
Thank you very much. इससे पहले कि मैं अपनी बात हमारे जो एक्सपर्ट्स हैं, हमारे जो आज के गेस्ट स्पीकर्स थे, उनके बारे में कहूं, मैं सबसे पहले उस महामानव, स्कॉलर, फिजिशियन, फ्रीडम फाइटर, मसीहुल मुल्क हकीम अजमल ख़ान साहब को खिराज अक़ीदत पेश करता हूँ, उनको श्रद्धांजलि देता हूँ. बिकॉज ऑफ हिम ओनली वी आर हियर टुडे. सो आई पे माई डीप ट्रिब्यूट. एंड yesteryears when he was thinking and rationalizing the system, then he asked Salimuzzaman Siddiqui Sahab to come and try to make a document available which can prove that these traditional systems of medicine like Ayurveda, Unani, they have got not only potential for treating and curing the patients since millennia, but they have got scientific basis for their treatment. So I would request you all to please pray for him, and I congratulate Director General Professor Asim Ali Khan Sahib and his team for organizing this World Unani Day or Unani Day, and I'm honored to get this privilege and opportunity to speak as a moderator for the session in which we witnessed the expertise of Professor Venkat Raman sir and Dr. Raj K. Manchanda ji. जैसा आपने देखा कि engaging stakeholders and combating COVID-19, ये एक ऐसा टॉपिक था जिसने हमें ये बताने की कोशिश की कि 16 मार्च 2020 से पहले की दुनिया और उसके बाद की दुनिया आज तक बिल्कुल अलग है, और आगे आने वाले भविष्य में भी, मुस्तकबिल में भी वो बिल्कुल अलग होगी. और दिस वाज एन अपॉर्चुनिटी फॉर अस टू लर्न हाउ टू यूज ऑल ICT एंड communication technologies and the techniques which can be available to us and that can be helpful in treatment of the disease or alleviating from the pains of the patients and the humankind. And also it gave us many challenges, showing us path, showing a light that these traditional system of medicine, complementary system of medicine, they have got their very important role. And I'm asked to conclude it. So engagement strategies as by the speaker one can be summarized as: you have to have the staff, you have to have the stuff, you have to have the resources, and private players, especially the manufacturing industry, has to come and pump up with the research and development activities financially. And you have to develop some systems where we can be more useful in coming days if God wish do not face such kind of challenge as SARS-2 COVID-19. And the second speaker, डॉक्टर मंचंदा जी, जैसा उन्होंने दिल्ली सरकार में रहते हुए कोविड-19 के दौरान किस तरह से आयुष सिस्टम के हेल्थ प्रोफेशनल्स ने और हेल्थ वॉरियर्स ने अपना योगदान दिया, अपने कंट्रीब्यूशंस दिए, उसको उन्होंने शेयर किया. और ये बहुत ही इत्मीनान की बात है कि हम लोगों ने प्रधानमंत्री जी के आपदा में अवसर के इस जुमले को चरितार्थ किया. हम लोगों ने कोशिश की कि हम उनके इस ख्वाब को कि हमें चैलेंजेस में अपॉर्चुनिटीज़ तलाश करनी चाहिए. आयुष सिस्टम, ख़ास तौर से यूनानी सिस्टम ने भी अपना बहुत ही महत्वपूर्ण और बहुत ही कारआमद रोल अंजाम दिया. बहुत बहुत धन्यवाद. थैंक यू. जय हिंद.
Thank you very much indeed. And may I once again request Professor Asim Ali Khan, DGCCRUM, to kindly do the honors of presenting mementos as a token of gratitude and appreciation. First to our moderators, Professor Syed Mehtab Ali. He's not here. To Dr. Mohammad Khalid, Assistant Drug Controller, Directorate of Ayush, Delhi Government. Dr. Mohammad Khalid, Assistant Drug Controller. To our co-moderators, Dr. Ghulam Nasir, Dr. Muhammad Khalid, Dr. Ghulam Nasir. And we now present to our distinguished co-moderator, Dr. Ghulam Nasir. And to our co-moderator, Dr. Khurshid Ahmed Ansari. And to eminent speakers, Professor A. Venkatraman, and to our eminent speaker, Dr. R.K. Manchanda. Thank you, Professor Khan, for doing the honors. May I request the distinguished panel to kindly step forward for a group photograph. Kindly step forward for a group photograph. And ladies and gentlemen, kindly remain seated as we straight away move into technical session 4. Just give us a moment to do up the top table. Ladies and gentlemen, the next topic is also a keynote addresses session. And we have two very interesting presentations on medicinal plants, current scenario in Ayush sector, and planning for the new drug development in times of COVID-19 pandemic. And may I invite our eminent speakers for the session, Dr. J.L.N. Shastri, Chief Executive Officer, National Medicinal Plants Board, Ministry of Ayush, Government of India, New Delhi, and Dr. Ram Vishwakarma, Chairman, Scientific Advisory Committee, CCRUM, New Delhi. Okay. And we would also like to invite our distinguished moderators, Dr. Abdul Kabir Dar, Director General Office Supplies and Stationery, Jammu and Kashmir, and Professor Arif Zaidi, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. A very warm welcome to you. I would like to invite our distinguished co-moderators, Dr. Anwar Saeed, Secretary, Jamia Tibia, Deoband, and Dr. Azhar Jabin, Assistant Professor, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. And our rapporteurs for the session are Dr. Jamal Akhtar, Research Officer, Unani, Scientist 3, and Dr. Fauzia Bashir, Research Associate, Unani. So, ladies and gentlemen, Dr. J.L.N. Shastri, our first speaker, would be joining us on a virtual platform. He hails from traditional Ayurvedic family from South India, Kakinada, Andhra Pradesh, and is currently working as CEO, NMPB, National Medicinal Plants Board, Ministry of Ayush, Government of India, New Delhi, since 8th of January 2020. He was Head and Vice President, Healthcare Research, Dabur India Limited, and 8 years before joining NMPB. And ladies and gentlemen, his topic of presentation is medicinal plants, current scenario in the Ayush sector. And sir, is he live? Yes, sir. Can you hear us, sir? Sir, kindly unmute yourself.
Yeah. Very good afternoon. Dr.
Yes.
Shastri here. First of all, I congratulate the Center for Unani Medicine and the team on the Unani Day. And I still remember last year also they celebrated really well, and I enjoyed the company. At the outset, I will be giving you the overall picture of the National Medicinal Plant Board, its activities, and then related to Unani, I will give my perspective as what I understand. National Medicinal Plant Board, as we all are aware, is about 20 years old. This year we are celebrating the 20th anniversary, and we are present in almost all the states today. 28 states and 9 union territories we have our offices as state medicinal plant board. And we have about RCFCs, which are regional facilitation centers, which are working across the country, which will facilitate the activities related to the medicinal plant boards. Rather, we can say that the connection between the national and state medicinal plant. And most of them are in the academic institutes. That's one advantage. So there will be no bureaucracy, there will be full academics, and they will connect the national medicinal plant institutes with the end users, the farmers, and the communities. And we also established this year about 4 larger depositories, one at national level and 2 at regional level. Total 9 are proposed by government, and this year we will be completing the 5th one also in March. So that's how we have structured medicinal plant board. And if you look at the overall activity of medicinal plant board, we have more than 104,000 hectares of inside conservation in 103 sites spreading about 18 states. And we have more than 23,000 hectares of resource augmentation in our belt. And this will be covering about roughly somewhere between 500 and 550 species, going up to about 700 species. But definitely the top 500 commonly medicinal plants are well conserved. That one point I want to convey to the audience. Many times we consider that the expansion from wild will be resulting in mass destruction and loss of some species. But I can ensure that all of the measures have been taken by the Government of India, and the activity is on. Apart from that, we have roughly about 272,000 hectares of total medicinal plant cultivation covering about 80 odd species across the country. The volume may appear low when you look at the hectares of 2.72 lakhs in about 18-19 years. But I would like to say that this is the area which is directly sponsored by NLDB to subsidy states. Otherwise, the training programs and all that together is multiple fold higher than what the area which is sponsored on one side. And apart from that, more than 1,200 different R&D projects have been sponsored so far by our NLDB. Out of which I am proud to say, recently with the help of the Ministry of Plant and Research there in Coimbatore, we could file 2 patents. This is the first time where the NLDB could get into IPR kind of activity. That's because of our R&D activity. And this is a major achievement when you look from the science forum. So that's one thing which always we wanted to do. So just we always said the contribution should be resulting in some kind of IPR or commercial outcome. That's what exactly we are able to achieve. And I'm here to just share with you that we have a lot of IUC programs we are all aware. And some of our R&D programs are all on the key species, like on Astiwad we have, on Block Panchmol we have, and so many other key herbal resources we have our ongoing program. During the COVID times, today if at all we are not feeling the heat of excessive usage of Pinospora, we should thank our team which was working on below 2019, which is working on the species under the Amrita project, Amrita for Life, the campaign on Amrita, which is below. This has prompted multiplication of this source at various places, and today there is no dearth of the Pinospora, mainly because we have taken those measures which are helping us to have the cultivation program taken up across the country, and below, as you know, has given a lot of boost for the people who are associated with preventive programs in the COVID times, and the exports, especially on Pinospora cardicea and Unani filmifera, which won multiple times. When I'm speaking to the exporters and the herbs cultivators, multiple fold from Benares University, one team under this young business party is seriously working on this video, and I'm amazed the kind of work they have done during the COVID time, and that's another important project which I have seen. So apart from that, in the coming times, we promise that further we will see the new species like Ashoka, Guguru, and all alpine species, right from your Jeta Mansu, Kirti, your Atish, and Vasna. Those kind of species will be conserved and simultaneously will be cultivated. And these are some of the programs which we have with NLBD. And in the context of the Unani system of medicine, already I discussed several times with the DG there, Dr. Asim Khan. We have a concept of creating a hub. Already I visited the Unani research facility at Chennai. I'm glad to mention that the regional broadband repository in Chennai is strongly supported by, heavily supported by the Unani Research Center. One good advantage is they have a clinical research facility also there, along with the repository, and the kind of aquarium and the kind of quality they have managed about 2 weeks back is there. And maybe if we specifically focus on the high volume, high value species of Unani organically in the Northeast, we can create a hub, and that's what exactly we are now planning in the coming financial year, to give a hub of Unani herbs in some of the key states like Mizoram, Arunachal, Sikkim, and Manipur kind of states, and focus on about 23-24 species. I think we can give a good livelihood to the local community. We can generate quality raw material for the industry, and we can also help in boosting the immunity, like your Vashinda was doing during the COVID time. And I'm amazed the kind of work the Unani team has done in association with other Ayush partners, and I wish all very success and bright research future for the Unani team, and I'm looking forward for collaboration contribution from all the Unani fraternity, so that we will take the standards of Unani drugs to the next level, giving a global impact not only to the system but the entire country, and we can create impetus of our own. With this, I once again congratulate the organizers for giving the opportunity and having a wonderful program. Thank you very much.
Thank you very much indeed, sir. And ladies and gentlemen, that was Dr. J.L.N. Shastri on the virtual mode connecting to us and giving his presentation. May I now invite our next eminent speaker, Dr. Ram Vishwakarma, Chairman, Advisory Board, Advisory Committee, CCRUM, New Delhi, is the advisor, CSIR, New Delhi, and he has held 2 terms as the Director of CSIR, Indian Institute of Integrative Medicine, Jammu. He has also been head of IP Directorate of CSIR at New Delhi. The primary focus of his research has been on the new drug discovery from natural products, which are medicinal plants and microorganisms, for cancer, infections, and CNS diseases. And ladies and gentlemen, today he is going to present on planning for new drug development in times of COVID-19 pandemic. So let's invite Dr. Ram Vishwakarma for his presentation. And may I request you, sir, to kindly conclude in 15 minutes. Thank you, sir.
Can you hear me? Yeah. Thank you for the introduction. I will begin by paying my homage to Hakim Saab, and that's the primary reason that I came today in this event. और जब हकीम साहब को याद करते हैं तो एक और शख्सियत को हम याद करते हैं जिसको पर्टिकुलरली मैं मेंशन करता हूँ, सलीम-उज़-ज़मा सिद्दीकी। ये दोनों कॉम्प्लीमेंट्री हैं और जिनको इंडिया में ड्रग डिस्कवरी की हिस्ट्री के बारे में थोड़ा मालूम है, उनको phenomenal contribution of both of them, which are not only Unani or Ayurveda, the global science, discovery of I don't think any group ever in the world discovered 5 or 6 molecules which eventually became drug. The first blood pressure lowering drug in modern medicine was discovered by these 2 gentlemen right here in Delhi. So it's a special privilege to be here on this day. What I will do is today to very briefly tell you about drug development pathways for this unprecedented pandemic. And if you put this in historical sense, these kind of pandemic periodically happens every 250 or 300 years. I have done this calculation, and humanity has suffered these pandemic. What's the logic of nature bringing message to humanity so sort of distance of this much of time spent? We have to understand that. And by giving you some idea about how world over, and particularly how we in our own country, and particularly the Council of Scientific and Industrial Research, is dealing with this problem for last 1 year. And when we look back, it's really a phenomenon that how much new knowledge about the virus, about the opportunities to tackle this virus, both from therapeutically or from immunologically, I mean through vaccines, and also about different modalities have come together from diverse disciplines, and how many modalities have straight away come from various old systems of medicine across the world. So I'll give you a flair of some of that. A little bit about the virus. And this is a very humble, tiny organism. Just to give you perspective, these viruses, particularly RNA virus is the one from which life started on this earth. So if you study the evolution of life itself, these viruses were the first which evolved at the interface of membranes and inorganic interfaces. So this is nothing new. And that is why if you look at human body, we have hundreds and hundreds of viruses living inside us the day we are born and we die. And large number of these viruses, like I tell you, 96%, 97% Indian population will have CMV virus in their body. There are several viruses that are living, and many of them are actually helping us in certain processes. Particularly, there are large viruses living in our oral cavity which are protecting us from bacteria, very surprisingly. So don't be alarmed by these viruses are new to us. They've been living with us, but this this gentleman somehow acquired a property which we never encountered. So it's a very small virus, 30,000 base pair virus, and you can compare with the human genome, the 3 billion base pair human genome. So you can imagine the capacity of this tiny creature to bring you on your knees. The greatest power on the earth are virtually on the knees today because of this particular virus. So that, I think, is a humbling feature for us as a human being, that we are not only alone in this universe. There are a whole lot of species, and I think we have to be kind to those when we are destroying climate, destroying species, and I'll come to that point a little later. It's a very small 14 open reading frames, total 27 proteins it coat. So compared your own body, millions of proteins producing, so it's a very small number, but it's very smart that everything that it produces from your own body. So it just goes inside you, releases the small piece of that RNA, and then use all your machinery to produce everything that it needs to replicate and then infect other species. So it's a very smart machinery. And when it is outside the living system, it is dead. So it's basically a creature which lives between dead and living. When it's outside, sitting on these surfaces, it's not live, it's not replicating. Only when it comes in contact with living species, then it will multiply. So it makes sure that it ideally should not allow the host to die, but most of the hosts are dying because of comorbidities, not primarily because of the virus. So that's also important message that is coming out. It is basically a double-layered lipid envelope, including 3 or 4 major proteins. Spike protein, I'm sure you must be hearing this on the newspaper. This is the protein where almost 90% vaccine that we are using today, including the one that we are using in this country, they are based on this protein. Then there is an envelope protein, there is a membrane protein, and the nucleocapsid protein. There are 4 or 5 very simple proteins, and a very simple lipid coat, which essentially to protect RNA, because RNA is the most labile molecule in nature. So on its own, it will simply degrade. So this lipid actually protects, and that concept we have used to design our mRNA-based vaccine of Pfizer and Moderna, where we are using this same kind of lipid to pack mRNA gene, and then we using this as a vaccine. And then the key player here is, which is basically start infection, is this S-glycoprotein, which is, you can see different color coated on this. This is all spike protein, heavily glycosylated spike protein. So it goes into your aerial airways and then bind to a ACE2 receptor, and it stays there 5 or 6 days in your oral area. So if you are careful, taking care of steaming or using some proper care, you have 5 days window to protect yourself before it ended up in and basically lungs. So this is the cycle, 1 week and another week. And of course, this several other component, I will not go into detail. This is simply a picture through which you can see that how these spike protein, nucleocapsid protein, envelope, they are all sort of decorated. And this single strand RNA which is packed in this liver, that's all this organism is. It has no nucleus of its own, no mitochondria of its own, no organism. It's simply a piece of lipid. So it's somebody very eminent in biology called these viruses the bad news wrapped in fat. So that's all it's about. And these are the basically genome organization. So you can see on the other side, these last 4 are the most critical for the infectivity of this virus. Now, it's amazing that in last 1 year, I think in the history of science, progress not has happened so rapidly in this one field which has happened in this virus. It's amazing how best of the brains in the world came together from all over the world, and really literally we had to understand bit by bit of this virus from the first genome which came out of China when this virus was detected, I think exactly 1 year ago, then onward. And within 1 year, you have now number of therapeutics, you have number of vaccine. I think that's a power of the science that was sort of full force of science was applied to this particular thing. And what we understand after 1 year is that so many targets of this virus entry, virus replication, and then resynthesis of the virus, and then infecting the other cells. I think that is all pretty clear. And it's clear in terms of the players. Players, when I say proteins, their ligands. Also, it is clear that most of these structural are now three-dimensional structure, either by X-ray crystallography or cryo-EM. They are available today, so you can, any student who want to look at ligand for some of these protein, you can actually download this structure and start playing with that and use in silico screening. And in fact, we are doing a large program in CSR along with other scientific agencies to look at precisely that. So it's all these, and I have listed here some of the drugs which interact with these things. These all molecules have been discovered in last 1 year, and majority of them were molecules which were used for other diseases, and they were repositioned for this virus. And when I am showing this slide, hundreds of millions of lives have been saved in last 1 year because of these tiny molecules that have been repositioned, because we had no opportunity to discover new molecule in 1 year. As you know, it's a long time to discover and develop a new drug. So repositioning of these molecules from existing sort of resource it really has provided this. And some of these molecules are coming from diseases which have no connection with this virus. That's an indication that a single molecule can harbor or hide multiple pharmacological activities. Because normally conventional wisdom is that you have particular molecule for particular disease and you are stuck with that. I think we have to go beyond that. These molecules or preparations that use in traditional system of medicine, they can be easily repositioned provided that you have good biological ways to reproducibly test those substances and then move forward to their development. Now, here we are today that a set of virus-based targets are available for people to reposition molecules. You can take your materials from Unani system or Ayurvedic system or Chinese system, no matter what system is. Essentially, systems provide you material. Whether you have a single molecule, you have an extract, you have an antibody, or whatever it is. It should work for the basically purpose that you want to position for it. And for that, you need to have biology to evaluate those. You cannot just make fictional ideas in your mind that I have something in my hand which will cure this virus. I'm sorry, that's not going to work. Without state-of-the-art biology in your hand, no system of medicine can make any contribution whatsoever. It's very clear. So this hypothesis must be based on solid scientific data in terms of the biology. Material can come from, it can be single molecule, it can be whatever. So I think this is what we are today. And we can see there are 3 structural proteins which have been validated now. There are molecules available, those. There are non-structural protein. There are 2 proteases which can now be produced in the lab. In fact, our labs, 4 or 5 CSR labs, are making these 2 recombinant technologies. And then the most important target that people have followed in last 1 year, and which is RNA-dependent RNA polymerase, and the drug that is written in the red called remdesivir. That was the first drug. I'm sure many of you, almost all of you will know the name of this drug. This drug has literally saved lives in ICUs and bringing them back to normal situations. So I think this is a gift of last 1 year of all the biological advances that have happened. And we also played some role in bringing this drug to India at the right time. I think in the month of, I think it was approved sometime in May or June, and within 1 month this was brought to India for our population. And this is now a standard of care. In any hospital you go, you get admitted, remdesivir has to be given. And interestingly, what we learned about this virus, and which applies to other viruses, that you cannot deal with the virus alone targeting viral biology. Simultaneously, you have to target host biology also, because ultimately what virus is doing, virus is trying to survive in your system by hijacking your machinery. And it also wants the host machinery to survive also so that it survives. It's simple, it's a life-life interaction. So then if you can prime your host pathways, along with the viral pathways, you can deal with this virus and actually protect it from mutating or developing variants. So host side, we have some interesting target. We have ACE2 receptor. There are a lot of, in fact, structure of this is also available, which was published in Science, I think 6-7 months ago. Then there is a TMPRSS2, furin, which is a very critical molecule for the viral entry, because it has to cleave a particular protein on the surface of virus and gets inside. Lysosomal cathepsin L. There are 3 kinases now people are looking at. And of course, there are targets associated with the host of immune system. And here I want to highlight one molecule which will resonate with, I think, the Unani deep history. There is a plant which has been used for almost 3,000 years, right from time of, in fact, from Egyptians, it was borrowed by Greek medicine, what we call Unani medicine here, plant called Colchicum autumnale. This plant was used for thousands of years to curing gout in people. And this is 3,000 years, and modern science then discovered 150 years ago a molecule called colchicine, which will, I think now you recognize. This molecule is, for 150 years, has been a state-of-the-art treatment for gout, approved by all world over. And what we found with a large trial, a trial done in Stanford, Madrid, New York, and it's published now in New England Journal of Medicine, I think recently, that it is protecting basically cardiomyocyte of the patient which are in ICU. So basically the ultimate protection for heart failure that is happening in many of these patients. So we have very recently, in fact, day before yesterday, we have received DCGI approval to initiate a trial in India for this medicine. So that is how these deep roots of these molecules go. Within the CSIR, I think 1 year ago, we created our strategy that we will look into this particular problem comprehensively. At that time, we did not know what the problem is going to be. So basically, the whole effort was divided into these 5 verticals: digital and molecular surveillance, which is our lab in Delhi, IGIB, and CCMB, IMTech Chandigarh, they are contributing. Rapid economical diagnostic, CCMB, Hyderabad, and other labs are working. And I will focus here on new and repurposed drugs in this particular presentation. Here, the first contribution that we made, I'm sure you must have heard this drug also called favipiravir. This drug was available and it was used as a cold drug for last 40 years in China and Russia. And very quickly we organized ourselves, developed a process of synthesis in the lab, gave that technology to Cipla, which is one of the largest company manufacturing this drug, and got it approved by Drug Controller of India. And today it is one of the frontline drug. When you have mild to severe infection of the virus, you get 2 grams of this molecule every day for 14 days. So anybody who got infection must have taken this medicine. And that was still this molecule is not available in large number of countries, and that was advantage of our capabilities in this country. The investment this country has made in last 70 plus years in science, which I always call it investment in future, that paid off, and we had this molecule available to us. And, the second molecule I talked about, this remdesivir. This was very quickly, I think it was initially developed for another virus called Zika virus, where it failed. And then this same company, Gilead, then started clinical trial on this. So initially, he got emergency use authorization in the United States. And at the same very time, we then started manufacturing this molecule here, gave technology to our lab from IICT Hyderabad, from several companies. And today, India is producing remdesivir for itself and exporting remdesivir to all over the world. And this is the really life-saving, only medicine which is life-saving other than dexamethasone. There is nothing else which is, if you are in ICU, if you are in a severe situation. If you are in mild and moderate, the other molecule that I talked about will help you. So this is another contribution. So I don't want to give you a kind of a pathway through which I'm giving you example that how we have done in our own country. And these are not fictional stories. These are, you go to next hospital, you will find doctors giving this medicine to the patient. So these are the real contribution that we have made in this disease. And these are the drugs that are currently in pipeline, supported by CSIR and several industry. Large number of industries are working with us. Most of the pharmaceutical companies are working. And these are all basically repositioning trial that we are planning. Some of them have got approval, like I gave you example of colchicine. Hopefully this week we'll get approval on another molecule called niclosamide. This is another very interesting molecule that we found, that people who are going to hospital, And once they are released from the hospital for 14 days, and you look at their x-rays, you will find their part of the lung capacity is destroyed. And it is destroyed irreversibly. There are glasses you can see actually in x-ray system of these patients. And why that is happening? Because when you have this infection, the chloride channel in your lung, they get activated, and you have fluid accommodation in your lung. So that is how you see the doctors, most of the experienced doctors, they don't do the test, they simply get the x-ray. And if you have these what they call glasses appearing in your lung, you can see pretty much you are infected by the virus. So I think this drug, we have collaborated with a very senior person in King's College London, and he has discovered this pathway, and now we are going to regulator very soon, and we will start this trial in India. So other than this, the 3 advanced trials that we have completed, we have been working on this a biological called MW. You must have heard the name of this Sepsivac. This is a heat-killed Mycobacterium W, a microorganism, which basically activate innate immunity and T-cell based immunity of the body. And it is already been approved several years ago by drug controller for gram-negative sepsis. You have septic shocks in gram-negative infections. It was approved. So very quickly in month of February, we sat with the company called Cadila Pharmaceutical and our team, and we analyzed that this could be a very interesting molecule to protect us, boosting innate immunity of toll-like receptors or dendritic cells and all this boosting and then basically slowing down your virus infection. And this has successfully completed phase 2 trial, and we are just going to complete phase 3 trial in 300 patients in severe patients, and hopefully this could be a new contribution from India for the management of this particular disease. The middle that you see is a phytopharmaceutical drug. For last 5-6 years, we were working on a plant-based preparation for dengue virus in collaboration with ICGB here in Delhi, my institute in Jammu, and Sun Pharma. And then we realized the dengue virus is also a RNA virus basically. So we realized, why don't we test this for this? Because when situation is difficult, you can, So I think that is how it has also completed phase 2 trial. Now it's into phase 3 trial. The third one is plasma therapy, convalescent plasma, that this was done by our lab in Calcutta. And these are the trials that we are currently ongoing, which I mentioned, colchicine and host-directed therapies. Vaccine development, we are working with 2 companies, the Arbando Pharma, where we have 2 new vaccines, because as you must be hearing, many of these vaccines may not actually work because of the new mutant that are appearing, the British mutant, South African mutant, and day before yesterday there is a mutant which has appeared in California, which is 10 times more virulent than the normal virus. So I think we are working on new platforms, and we are also working with Bharat Biotech onto another platform, and then we have a horse serum monoclonal antibodies from basically horse, and that also is going to clinical trial. This is our drug discovery initiative pipeline, which is working with several government departments. And this is the, when you start working on this, during this work we made this breakthrough here in India. We discovered a pathway how this virus is actually entering the cell. This is a new pathway. This paper has just been put on the bioarchive, and this is a phenomenal contribution from collaboration from my lab in Jammu and NCBS Bangalore, which is Tata Institute of Fundamental Research, where we have found a new pathway through which this virus is getting entry, which is very different than the related viruses. So this is I think, is the hypothesis we are building on niclosamide, and that will go into clinical trial. What lesson that we have learned, very important lesson we have learned during this period, is that much of our supply chain in this country is broken. Last 20-30 years we have dependent on China for supply of drugs and intermediates, so I think we have to rebuild that, which we have lost. And lesson for humanity, I will conclude here, lesson for all of us is, this is my thinking, I give you 3 examples why it is important for us. The first one is, the vaccine that many of you may have taken and going to take is based on adenovirus platform, and you know where that vector come from? That come from chimpanzee. So poor chimpanzee has helped humanity, because that virus does not replicate in human body. Example number 1, the adjuvant that we are using in this vaccine is coming from a shark liver oil, a molecule called squalene, which is what is the most of these vaccines that you are using, this adjuvant is being used. The third is another adjuvant which is used, which is from a plant called Collaja saponaria from Chile. This is the hottest commodity right now in the market because most of the vaccines are using this material as adjuvant. Why I'm making this point? A chimpanzee, a fish, a plant is providing material to help you. So it's incumbent on us to protect our biodiversity, allow other people, other species also to live. Otherwise, if we keep on destroying these species, time may come that there should be no material available for us to survive. So I think these are the clear example, and these are for the viral vaccines. So I will conclude here, and thank you very much for your patience.
Thank you very much indeed, sir. And may I once again invite Professor Asim Ali Khan, DG CCRUM, to kindly do the honors of presenting mementos as a token of gratitude and appreciation to our eminent panel on the stage. We begin with presenting to our distinguished moderators, Dr. Abdul Kabir Dar. Dr. Abdul Kabir Dar is Director General Office Supplies and Stationery, Jammu and Kashmir. Thank you very much indeed, sir. And our moderator, Professor Arif Zaidi, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. And to a co-moderator, Dr. Azhar Jabi, Assistant Professor, School of Unani Medical Education and Research, Jamia Hamdard, New Delhi. And to eminent speaker, Dr. Ram Vishwakarma, Chairman, Scientific Advisory Committee, CCRUM, New Delhi. And may I invite Dr. Murugusevran to kindly receive the memento on behalf of our speaker, Dr. J.L.N. Shastri. Dr. Murugusevran receiving the memento on behalf of Dr. J.L.N. Shastri. Thank you, Professor Khan. And may I request the panel to kindly step forward for a group photograph, sir. And ladies and gentlemen, kindly remain seated. This session is followed by a very interesting and important panel discussion session, which will be chaired by Dr. Ram Vishwakarma and Professor Asim Ali Khan. Kindly give us a few minutes while we arrange the top table for the panel discussion. Yes, sir. So we are arranging the chairs also. ladies and gentlemen, we are ready with the panel discussion session. The discussion is on the topic of this conference, Unani Medicine, Opportunities and Challenges in the Times of COVID-19. And may I invite our moderators for this panel discussion, Dr. Ram Vishwakarma, Chairman, Scientific Advisory Committee, CCRUM, New Delhi, and Professor Asim Ali Khan, Director General, Central Council for Research in Unani Medicine, Ministry of Ayush, Government of India. May I request our moderators to kindly grace the stage with their presence. And ladies and gentlemen, inviting our eminent panelists, Sri Vaidya Devendra Triguna, President, Association of Manufacturers of Ayurvedic Medicine, New Delhi. May I invite you, sir, to kindly join us on the stage. Professor K.M.Y. Amin, Department of Ilm-ul Adwiya, Faculty of Unani Medicine, Ajmal Khan, Tibbiya College, Aligarh Muslim University. Inviting Dr. Vishwa Janani J. Sattigeri, Head Traditional Knowledge Digital Library Unit, CSIR, New Delhi. Inviting Dr. Atul Mohan Kochar, Chief Executive Officer, NABH, New Delhi. Inviting Dr. S. Farooq, President, Himalaya Drug Company, New Delhi. Inviting Professor Mohammad Idris, Head of Department, Idmul Saida, Ayurvedic and Unani Tibbiya College, New Delhi. Inviting Shri Pradeep Multani, Vice President, PhD Chamber of Commerce and Industry, New Delhi. Inviting Hakim Mohsin Delvi, General Secretary, Unani Drug Manufacturers Association, New Delhi. Inviting Dr. Santosh Kumar Joshi, Member, Association of Manufacturers, Ayurvedic Medicine, New Delhi. And joining us online is Dr. W. Selvamurthy, President, Amity Science, Technology and Innovation Foundation, Director General, Amity, Directorate of Science and Innovation, Noida. A very warm welcome to you, sir. Joining us online, Dr. Geeta Krishnan, Traditional Complementary and Integrative Medicine Unit, World Health Organization. A warm welcome to you. Joining us online is Professor Ritupriya, Center of Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi. A very warm welcome to you. And joining us online is Sri Arvind Vachasvi, Managing Director, Sri Sri Tattva, Bengaluru. A very warm welcome to you, sir. And ladies and gentlemen, for the moderation of the panel discussion session, I hand over to our distinguished moderators, Dr. Ram Vishwakarma and Professor Asim Ali Khan. Over to you, sir. And ladies and gentlemen, to carry forward the proceedings of this session, I hand over to Professor Asim Ali Khan, DG CCRUM. Over to you, sir.
Laboratory Unit, CSIR, New Delhi. We also have with us Dr. S. Farooq Sahib, the President, Himalaya Drug Company, New Delhi. Thank you very much, sir. Online, some of our member panelists are there. One very senior person, Dr. W. Silva Murthy Sahib is there. He is the President, Amity Science, Technology and Innovation Foundation and Director General, Amity Directorate of Science and Innovation, Noida. He is also the former Director General of DRDO. We have Professor K.M.Y. Abeen, Department of Ilm Ladhiya, Faculty of Unani Medicine, Ajmal Khan Tibia College, Aligarh Muslim University, Aligarh. Dr. Atul Mohan Kochar Sahib is there. He is the Chief Executive Officer, NABH, New Delhi. Professor Ritu Priyaji is there, Center for Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi. Dr. Geeta Krishnan Sahib, one of our colleagues, a very dynamic personality. He is in WHO and he is joining us online. He is a traditional complementary integrative medicine unit from World Health Organization. Professor Muhammad Idris Sahib is there. He is the head department of Ilmul Saidla, Ayurvedic and Unani Tibia College, New Delhi, and he is also the former principal of the institution. Hakim Mohsin Dehlvi Sahib is there. He is the General Secretary, Unani Drug Manufacturers Association, UDMA, New Delhi. Shri Arvind Varchasvi Sahib has joined us. He is the Managing Director, Sri Sri Tattva, Bengaluru, and he is also the Senior Member in PhD Chamber of Commerce and Industry. Dr. Santosh Kumar Joshi, he is also the Member Association of Manufacturers of Ayurvedic Medicine, New Delhi. A very distinguished panel. Very hearty welcome to all the members, panelists. Thank you very much for being with us and joining here. I think I'll not take much time because we have very distinguished panelists with us. Only 2-3 things I would love to speak about. One is that the topic which we have to apprise all the audience, the topic for this panel discussion is the Unani medicine, opportunities and challenges in times of COVID-19. I think we all have the learned audience also because all are technocrats and technical people, professors, students, and practitioners. 3 things probably we have to be looking into now, in the past also, in the future also. Probably we have to focus on those 2 or 3 things. One is that, and when industry is sitting here, academia is sitting here, and it has been a question that many people have been raising time and again, that there shall be, the ASU drugs have to have the standardization and quality standards. That is a question that has been raised many times these days. We at Ayush and many institutions through Ayush, we have already been working on the drug standardization part of it. We are developing the standards. We have wonderful state-of-the-art laboratories. And I understand that in industry also, many of our industry partners and colleagues, they have developed wonderful R&D divisions in their respective units. They have taken up the good manufacturing practices. They are collecting the herbs by using the good cultivation practices. So many things are happening, but I think some more focus need to be given on these particular issues. They're pharmacognostical, they're physiochemical, and pharmacological.
Hello? Yeah, it's working. Yeah, thank you, Dr. Khan. I will not take much time. I think topic is very interesting. I will only request the panelists to stick to time so that everybody get opportunity to speak, because if you take more time, you know, cutting somebody else's time. And the topic is very interesting. And I think as a chairperson of Scientific Advisory Board of CCRU, my concern is only the scientific growth of traditional system of medicine of India, because ultimately you are celebrating somebody who spent his whole life dabbling with science.
Founder President has given a lot of focus and emphasis on Indian systems, yoga, Ayurveda, and also the Unani system of medicine. So thank you very much for this MOU, and we would like to deepen our relationship with the Central Council for Research in Unani Medicine, and we are executing 3 projects under the CCRU, which I will be talking about. In fact, the Arabs and Persians were the ones who introduced the system to India. The whole system came to India through them. And 13th and 17th century was the most glorious period when Unani medicine in India was very, very popular among the practitioners and the people's acceptance. So it was almost a heyday for Unani in India, that is 13th and 17th century. But once the Britishers came in, the whole system, Indian systems got shaken up and broke. Their root, they were trying to uproot, but then it still survived. All the systems survived, including Unani. And then we should say Sharafi family in Delhi, then Asasi in Lucknow, Nizam of Hyderabad, all these people, they gave patronage in different regions of our country. That is how the Unani medicine survived the assault of the allopathic system. Then came the revival by the Dr. Hakim Ajmal Khan, which was mentioned by the chairperson as well. So he is the one who brought in a college, Tibia College, Unani Tibia College, and then the Hindustani Dawakhana. This he started to as an industry to produce standardized Unani medicine. So the history is important so that we should know the root as well. So in the COVID-19, when this situation came in, all the systems of Indian systems of medicine, Ayush system, got a boost. In fact, the prophylactic, promotive, curative aspects came into prominence as soon as the situation came in. Ayush Ministry issued guidelines through all the councils, including CCREM, and many people adopted the Unani medicine system, and they were prevented. There was a prophylactic protection against this COVID-19. So this was a proven system during this period, and a lot of data is being collected by Dr. Hasim Ali Khan, who is the DG of CCREM. And Amity University, we carried out some research in the anti-cancer activity of Dawaul Kurkum. This is we are doing two projects. One on the anti-cancer properties of Dawaul Kurkum, and the other one is redesigning a traditional form of Unani formulation. And by docking, looking at how does these the docking occurs with various cells. So we were looking at and formulating a new Unani formulation. And if you really look at the COVID-19, the aromatic, the compounds which was used for sanitization, and this has a prophylactic effect, sanitizing effect, and also the masking. All the system existed in Unani, even though we talk about it now. It existed several years ago. This kind of concept, which is now being adopted in the modern system as well. And when I talk about this Dawaul Kurkum, it's an anti-cancer polyherbal saffron drug. This drug, and we are doing the in vitro studies on this particular drug, wherein the major constituent is Crocus sativus. This is the major constituent. It's a polyherbal, so this is the major constituent. And then you also have the 6 other herbs. Then we prepared a hydroethanolic extract from this compound, the polyherbal preparation. Then we found it has antioxidant property. And then what we did MTT assay. MTT assay will indicate that how does this malignant cell behave when you put this drug on. So we had a control cell lines as well as the cell lines which are cancerous cell lines, and we use particularly the hepatocellular carcinoma we studied. So we brought in the control cell was HEC293, and then the malignant cell we used HEP-G2 as well as HEP-3B. So these are the two or three types of cancerous cell in the liver. So we picked up the cell lines, and then we studied the comparison. How does it behave, this particular drug, at that level? So we looked at the molecular level, and we established through MTT assay that the cell viability is reduced in malignant cells. So this particular drug, the polyherbal preparation of Unani, is more toxic to the cancer cell as compared to the control cell. So this is how we need to carry out a very, very streamlined studies to put Unani medicine on a scientific pedestal. Then we also found the wound healing property by using cell migration studies. We call it a scratch assay. We carried out scratch assay and found that wound healing, the cell migration from 0 hour to 24 hours was slowed down, particularly by this drug. Then we also looked at the expression of P53 gene by using this polyherbal preparation of Unani. Then we found P53 gene, which is very, very important in hepatocarcinoma, and which is protective. So we found a higher expression. So this was also studied at the genetic level. And we also found the DNA repair is much better. So having done it, we took another study, another project of Unani from CCREM, in which we were looking at, again, the hepatocellular carcinoma. If you look at the current therapy, it is highly toxic, and it has a lot of adverse side effects, particularly if you look at drugs like sorafenib is the drug which is used, and it also causes multi-drug resistance. So a lot of side effects is there in the conventional therapy. So we looked at, again, Dawawul Kurkum as one of the remedies, and we found the antioxidant, anti-inflammatory, anti-nociceptive. Even it takes care of the pain due to cancer. Then we also looked at the proteins. There are 32 proteins which is responsible in these hepatocellular carcinoma. And we looked at the docking of this particular drug, the Unani medicine drug. So this we carried out in Amity University, and Dr. Mariam Sarawat has done this study in Amity University. And we also looked at how does the docking occurs with the specific proteins. And then we have we did a MD simulation studies as well for binding stability, and ultimately found that this drug will certainly be very useful for cancer treatment. And we also looked at some of the components which are there, like guggensteron, quercetin, lactone, crocin. So these are the promising agents and in this particular drug. So why I wanted to say this case study which Amity University has done, that what we need today is this type of the studies where we have to go into man to molecule. Even though you may see some symptoms disappearing, how does this drug work? What is the mechanism of action? So these are very, very vital to be studied. So in that context, I think many institutions in India are doing, and we also need to standardize the education, the therapy. So the accreditation which Ministry of Ayush has started today is doing a great job for everything, like yoga. There is a yoga certification board. Similarly, the Ayurveda. So and Unani, and Unani pharmacopoeia. When I went to CCREM, Dr. Asim Ali Khan showed that how the pharmacopoeia is preserved and then adopted. Then, so such kind of initiatives will bring many, many new molecules and new polyherbal preparations. And Amity has given a special focus, Amity University, in the Indian systems. We are running a BSc honors in yoga, and we have established in US campus. We have a campus in Long Island of New York, Amity Ayurveda Research Center, and now we are carrying out projects in all this domain. So we would be happy to expand Dr. Asim Ali Khan, our relationship. Dr. Ashok Chauhan has sent greetings to you and all the participants, and he will contribute to Unani medicine through academic and scientific profile through our Amity Institute of Indian Systems Medicine. So best wishes again to CCREM and the done, particularly Dr. Asim Ali Khan, who is spearheading this mission. Thank you so much.
Their time, they will not get time to speak. So I think in the interest of the other speakers, please stick to your time. And now I will invite Professor Amin to make his remarks. He has not joined, so I will go to my colleague, Dr. Janani.
convey associated. So let me begin with my observations with the trials of COVID-19, especially that have been registered with the CTRI. So all of us know that the COVID-19 is indeed a pandemic and an unprecedented has actually given us an unprecedented opportunity when we consider the traditional systems of medicine. While we have all been, kind of scurrying around and trying to find scope where we could actually fit in the traditional systems of medicine and prove their worth, I think that COVID-19 actually presented us an opportunity on a platter, and we did seize it. And how? If I go back to the CTRI, I'm very proud to say that, as of 2 days ago, we were almost close to about 886 trials registered for COVID-19. And of them, 25 were from the Indian systems of medicine, herbal formulations. I think I'm loud enough. Okay. So they were close to about 225 trials from the Indian systems of medicine, including the herbal preparations. And that comes to close to about 25% of all trials that have been registered for COVID-19. Of course, the Ayurveda led the path with about 133 trials. And Unani has about, I think, 8 trials registered on the CTRI. If I now draw a parallel with, the traditional Chinese medicine, which is, largely talked about across the globe, a few months ago when I looked at the Chinese clinical trial site, they were close to about 606 trials registered for COVID-19, and of them, 131 were for the traditional Chinese medicine. That comes close to about 22% of the trials that have been registered for COVID-19. And if you look at, the large scope of things that are there, and my interest coming from the medicinal plants and plant-based products that are associated, I looked up the traditional Chinese medicine and I understood, what kind of formulations were there and how many plants are associated with these 131 trials. And very encouraging, it was to see that 86 unique plants were associated with different formulations that have been associated with the traditional Chinese medicine. Now coming back and drawing a parallel with the Unani medications that have been registered for trial under the CTRI, as I mentioned, there were about 8 trials. There were 9 different formulations that have been mentioned that were under clinical trials. I went back to look at, what the formulations do look into. And it was very encouraging to see, just out of 9 formulations, there were about 46 to 47 plants that were used in all these formulations. So India has actually used its rich resource, natural resource, for alleviating COVID-19, maybe by way of immunity boosting or way of symptoms treating for the COVID-19, but we did use our traditional systems of medicine. And what does it actually mean when we move forward? As many of the speakers before me, including the chair and Professor Khan, emphasized, that we are largely looking at evidence-based medicine today. We want to create the data that is required for somebody to have confidence in the medications that we are providing them. So I went back again to literature to see, what kind of actually drugs, especially following the modern systems of medicine, do contain. If you look at a recent report in the Journal of Natural Products, it says close to about 1,880 drugs have been approved in the last 44 years under the new medicines, modern medicine regulatory pathways across the world. And out of this 1,880 drugs, there were less than 1% of the drugs that were actually botanicals, just 14 of them across the world, by different regulatory paths. And a little more encouraging was the fact that, the natural products per se, they were close to about 4%. Put together, we are still talking of only 5% of the total drugs that have been approved by the regulatory authorities under the modern medicines regulatory pathways. And here we are talking of a rich heritage of traditional systems of medicine. And we think that it still holds a lot of promise because we are seeing evidence of these traditional systems of medicine. So how do we correlate? How do we take forward this rich resource? What comes out very encouraging is the fact that you can go back to the modern science literature and see that the natural product mimics or the derivatives of natural products, they constitute close to about 30% of the drugs that have been approved by the regulatory path along the modern science pathway. So that is indeed encouraging. And what is more important is what I mentioned before, just considering 9 formulations of Unani for COVID-19 registered on the CTRI, we are looking at a plant base of about 47. Can we use this rich resource to identify what would be the bioactives? Of course, very many times polypharmacology works well in treating various disorders such as this. But what can be combined in the most logical and scientific way to keep it to a minimum and yet again reach the therapeutic efficacy that we are looking at? I think that holds a lot of promise. And I would be very glad to inform you that when I talk of TKDL, we have close to about 4 lakh formulations from the Indian systems of medicine that constitutes Ayurveda, Siddha, Unani, Sovarikpa, and of course a few yoga practices. And of this 4 lakh formulations, we have close to about 2 lakh formulations coming from Unani, and this is just from about 22 books. And just before I entered this room, I was talking to Professor Zillur Rahman, and he actually invited me to Aligarh to look at the facility that he has created, and he says that he has thousands
Sorry?
I believe you have to hold both.
Achha, the buttons? No, it's not working. Hello. Thank you so much, sir. So good afternoon all. Thank you so much.
Ritu Priya from JNU. You have to unmute yourself, madam. Still, we can't hear you.
Am I now audible?
No, yeah.
Okay. I'd like to thank the DG CCRUM for giving me this opportunity for paying my respects to the visionary Hakim Ajmal Khan Sahib and to all those of you who are attempting to follow in his footsteps. The kind of research work that has happened in the past 1 year to meet the COVID challenge is so heartening. And we've all heard about that from Ved Kotecha, about what he and the Ministry of Ayush and the councils have been doing, what Dr. Manchanda shared with all the work that they've been doing in Delhi government health services in an integrative way, and what the entire scientific establishment has done, as Professor Vishwakarma has narrated. But I also want to share the other side, which I see from the position that I am in as a public health person. I see what happened to the informal sector migrant workers, what women cloistered in homes faced during the periods of lockdown, how the pandemic is worst in countries which are high income and which are considered the ones with best medical care systems. That the majority sections are in trouble economically, while the IT companies and pharma companies have made profits many times more than in normal years. You know, these are all things which also we need to think of as scientific minds, as people who are thinking rationally about our societies and the health of our populations. And it is in that context I want to say, why am I bringing it here in this panel? Because I come from modern public health and the stream within public health that considers social, cultural, and economic dimensions as matters of scientific study and crucial for both people's health and health care. I combine epidemiology, social determinants of health, people's health-seeking behaviors for health systems research, policy, and planning. And it's from that systemic view that I am raising all these issues. I look at ecosystems. Nature provides us ecosystems, but we also have, as we all use this word very commonly now, ecosystems of scientific research and healthcare practice, of understanding the interrelationships between the natural ecosystems and the ecosystems of scientific research and healthcare practice. And often we are finding the lack of that interrelationship being adequately acknowledged and recognized. And that is where one looks to systems such as Unani as essential components of our health system, which is there and which within its very roots and fundamental structure gives us the relationship between the natural ecosystem and our ecosystems of research and knowledge as human societies. I look to the pluralism and the complementarity of ideas and practices as a source of strength and resilience of our society. And the experience of the COVID pandemic has been a source for really strengthening this understanding of the value of this plural healthcare system that we have in the country. It has been a great source of resilience for us. And one can see that in the successes that we seem to be having as compared to the much better off countries of the world. But, with all this achievement, I also have a fear, and I think this is the right forum in which to express that and share that, and that's why I'm doing so. The successes of this pandemic may make Unani and Ayush in general take them more along the path of industrial technology-centered modern medicine. And why I'm saying this is because I see that within my own discipline of public health, with my background of modern medicine, that we have diverse streams within the modern itself. We have the more systems approach oriented thinking and scientific endeavor that I subscribe to, and the one which is focused entirely on generation of technology and spread of technological inputs. Now, I see that there are clearly ways of integration across these two, because the same two strands seem to now appear in Ayush as well. There are the strands which are focused more on the product and of creating more products based on the concepts of Ayush. But there are those who would also want to look more at the holistic and multidimensional interventions that Ayush itself and Unani in particular today can make. And I think there is this diversity of views even within our individual disciplines are also important to consider. And the integration that would happen, currently I find from all the examples that we've heard of since the morning, are about the products, are about pharmaceutical products which will certainly be of benefit to humankind, to people at large, and are essential. So I'm in no way denying the value of what has been done. But my concern is that with this, if this is the face of what plural healthcare is about, and with COVID, I'm certainly hopeful that Ayush and systems or other traditional systems across the world will get a better role and status than was recognized before this in society at large. What I'm positing is that we need to ensure that we don't only make the image of Ayush and Unani as one of producer of pharmaceutical products, as producing some drugs as substitute for modern medical drugs, and that's all. They have much more to offer. They have much more in terms of giving us a better understanding of ecosystems and of the relationship between ecosystems and human health. One Health is, of course, a modern public health slogan that is there. But that is one which we need to therefore also build our bridges with and integrate and come in with the notions of Ayurveda or the animal health and plant health together, which are also inherent in the Ayush systems.
Madam,
and how
please
do we
conclude.
Yeah, I will do that in just 2 minutes. If you give me 2 minutes. Yeah, so while we've been repurposing drugs in modern medicine, developing immunoboosting and immunomodulating drugs, we also need to ensure that we keep coming back to this understanding of creating the difference today for those who questioned the advisories given out by the Ayush Ministry, including by CCRUM, questioned them on saying that they were not scientific. I see the difference of episteme, and that epistemic difference is within our individual disciplines as well, as I pointed out earlier, of the ecosystem and systemic views which are more related to nature and holistic, and the narrow medical, only pharmaceutical perspective. So I'm pleading for the fact that we need to decolonize our knowledge system, to contextualize health in its environmental and social domains, to promote the understanding of nature and one's own body, how to understand one's own body. Can Unani and Ayurveda and Siddha, it did that in earlier cultural forms, can it do that again today? Help Indian citizens and the world at large recognize and be able to have the skills to understand its own body. This will require promoting interdisciplinary and transdisciplinary research. In health, where we can study people's health-seeking behaviors, perception studies, understanding healthcare providers and the challenges to them, from community healers right up to the tertiary care level, and what are the challenges they have, and thereby catering to that. Unani, to me, is one of the systems which has roots in such holistic understanding, and the message that the COVID pandemic and debates about it bring us is this kind of a divide. I'm sure at the time when Hakim Ajmal Khan Sahib promoted this kind of link between different systems, has moved to a point where pharmaceuticals and pharmaceutical knowledge is very much part of the conventional understanding, and systems perspectives is what the frontiers of science now are. I would plead that Ayush must link itself to those systemic perspectives as well. And for that, I would suggest 3 or 4 possible directions for us to think about. One, that the research is to be more about the principles and their adoption in the present time, especially about Mijaz, about the four humors, and how do we identify them and translate them into present-day understandings and knowledge, so that those are also seen as valuable concepts and understandings and not just left by the wayside. Developing an organizational structure and interactive ethos across Ayush systems.
Madam, may we request you to kindly conclude?
And I'll stop with that. So this is something that I've heard about from Ved Kutecha, and really happy that that inter-Ayush interaction is happening. I hope that it will be about whole systems research.
Thank you, madam. Please conclude. We are running out of time. Thank you very much.
I'll stop with that.
Thank you
so much. Thank you for the opportunity.
I again repeat, please respect the time. You know, same argument can be made in a time that is allotted to you. I think I'll go to Dr. Geeta Krishnan, and I think he will follow my advice. Where is Geeta? You have only 3 minutes, Geeta. I can at least order you.
Am I audible?
Now you are audible, yeah.
Yes.
Thank you. In fact, most of the things which I wanted to say had been said. So I would really take this opportunity to remember the contributions of Hakim Muhammad, Hakim Ajmal Khan Sahab for the development of Unani in India and across the globe, and other people who had also helped in getting Unani the rightful place within the society of India, such as Hakim Akbar Arzani during the Mughal period to as recently as Hakim Abdul Hamid during our current time. It is the contribution of these great minds and great social reformers who had made a great change for Unani system, as well as for Unani system to be very well entrenched within the society of India. I am looking at Unani medicine very closely since past 2 years as part of the developmental projects which are happening along with WHO in the area of Unani. We in WHO are developing a benchmark document for the practice of Unani, which will be a global document, a global product from WHO headquarters, as well as we are developing we are updating the benchmark document for training, which was published in 2010, which we find which the experts across the globe find that needs considerable review, because the change of acceptance and the kind of number of countries who are looking for Unani as a system of medicine to be included in their country has increased considerably. At WHO, we are also working on creating an international format of standardized terminology for Unani. We have been continuously and rigorously working with it. We are trying to look at almost most of the important textbooks of Unani, and we have compiled something around approximately around 4,500 words, which are most key for Unani, and we are creating English equivalent terms and descriptions for these terms, which I think will be of great importance for Unani's propagation, as well as for the communities to accept Unani, because that will help conversations of between modern science and Unani medicine, and modern society and Unani system of medicine in a much better manner. And with the help of the Ministry of Ayush, all these programs are happening with the help and support of the Ministry of Ayush, Government of India. Recently, we had also started developing the ICD codes for Unani system of medicine. We are for including into the ICD-11 module of traditional medicine, which will be a great advancement for Unani medicine, because it will get accepted within the system. It will get accepted in the insurance programs and policies of the government. It will also help the governments to understand the benefits of Unani medicine and look at it. I will finish with this. Thank you so much for giving me this opportunity, and this was great and a time for having met all of you. Thank you so much.
Thank you, Geeta. Sticking to time, I will go to now Professor Mohammad Idris. I think he's here.
तीन मिनट है सर इसमें, बाकी तो उसी में न चले जाए कहीं.
आप बोल दीजिए.
Hello.
Good afternoon. I'm very much thankful to Professor Asim Sahib, Director General, who give me an opportunity before you and other distinguished panelists, participants. This very rare occasion
K.M. Amin, who has joined now online. Please, Professor Amin, can you hear?
Thank you very much.
Professor Amin sir, we are not audible.
Am I visible and audible?
Sir, you are not audible.
You have to unmute.
I am not audible.
Now you are audible.
Now.
Okay. Just give me half a minute.
Now we can hear you.
Okay. Video off कर दीजिए. Now I think I am audible.
Yes.
Okay, thank you very much. Without going into the introduction and preliminaries, which I hope would have been covered by other speakers, because I took some time to get online, I missed some of the speakers. I would come to 2 points. Firstly, in all traditional medicines and similarly in Unani medicine, the scheme of physiology, pathology and pharmacology is very different from that of Western medicine. It is not based upon molecules. It has got other bases. In Unani medicine, it is the humors, which are the in terms of which the physiology and pathology and to a great extent the pharmacology is described. So Unani medicine has got great potential, there's no doubt about it. I have been conducting experimental and clinical pharmacological research on Unani medicine for about 40 years. And in 99% of the cases, the reports have been borne out. So there's no doubt about the great potential of Unani medicine. But unfortunately, that potential is not fully tapped because of the fact that we try to approach Unani medicine through the principles and scheme of Western medicine, which is based upon molecules. So the first thing is that we should conceive of the disease, and we should conceive of the treatment in terms of the Unani scheme. Very difficult. Process of translation is not very difficult. We can start, the connecting link is the common symptomatology. So we, in Western medicine, suppose we describe it as COVID-19 infection, then under this rubric, under this name, we have got certain symptoms. So when we approach the Unani pathology, which is Ilmul Amraz or Mahiyat-e Marzi, we can search for the same symptoms. And then we will be able to identify the Unani syndrome, the Unani tag for systematizing and describing these symptoms. So once we are able to translate Western pathology into Unani pathology, which is based upon the 4 humors, and of course many other things also, many other principles also. I don't want to go into those details right now. Once we are able to translate the Western pathology into Unani pathology, in this case, in the case of COVID-19 infection, very broadly it would be the increase in phlegm, increase in balgam. The humor balgam or phlegm increases. There's an increase in phlegm or balgam, very broadly and roughly speaking.
So
otherwise, the Unani pathology would be is a bit, of course, more intricate than simply
Professor Amin Sahib, may I request you to kindly conclude? Because of paucity of time, we are sorry. We really wanted to hear your expert talk, but really time, because of paucity of time, may we request you to kindly conclude?
Uh-huh.
Sir, we can't hear you. He's on the way, I think. Professor Vishwakarma Sahab, can we invite the other panelists?
I
think we lost his audio.
Lost his connection. We can go to now Vaid Devendra Trigunaji.
डायरेक्टर जनरल आसिम अली खान जी और सारे पैनलिस्ट, सारे जो लोग इस देश में इस आज यूनानी डे पे हम जुड़े हुए हैं, पहले तो मैं हकीम अजमल साहब को याद करूंगा कि जिस कॉलेज को उन्होंने, तिबिया कॉलेज को, जिसके प्रिंसिपल भी यहाँ बैठे हैं, उन्होंने इसको बनाया और एक दूरदर्शिता थी उनमें, एक नेता थे। शायद एक ही ऐसा कॉलेज है सारे देश में जिसका कि
ट्रायल्स करने चाहिए। सिर्फ लॉन्ग ईयर्स और इतने सालों से औषधि बिक रही है उससे काम नहीं चलेगा। हमारी बहुत सारी कंपनियां हैं, जैसे मेरी मुल्तानी ही कंपनी है, हमने 7 क्लिनिकल ट्रायल्स इधर से नेशनल इंस्टीट्यूट ऑफ आयुर्वेदा जयपुर से कराई हैं। सो क्लिनिकल ट्रायल से हमको दुनिया के सामने पेश करना पड़ेगा कि हमारी औषधियां काम करती हैं। वो क्लिनिकल ट्रायल्स हमें करने पड़ेंगे। इसके अलावा जो हमारे साथ क्वालिटी काउंसिल ऑफ इंडिया के रिप्रेजेंटेटिव बैठे हैं, जो एक आयुष प्रीमियम मार्क, आयुष स्टैंडर्ड मार्क है, इस टाइप के क्वालिटी हमको पैरामीटर्स को भी लेना पड़ेगा, सर्टिफिकेशन को लेना पड़ेगा। हमारे को अपने जो फैक्ट्रीज हैं उनको WHO GMP प्लांट सर्टिफाइड होना चाहिए। मैं गर्व से कहता हूं जैसे मुल्तानी फार्म्स लिमिटेड है, हमारे पास आयुष प्रीमियम मार्क है, आयुष स्टैंडर्ड मार्क है, हमारा WHO GMP सर्टिफाइड प्लांट है। हम सबको, पूरी इंडस्ट्री को उठना पड़ेगा ताकि जो कस्टमर है उसको कॉन्फिडेंस हो हमारी औषधियों में। एक और चीज हमें जो बहुत आवश्यक है वो है R&D, रिसर्च एंड डेवलपमेंट में हमें इन्वेस्ट करना ही पड़ेगा। साथ में जाके
may I request you to conclude? I'm sorry because of positive time, because of
just one moment.
Sure, please.
And we need government approved laboratories in our plants, क्योंकि जब तक हम अपनी जड़ी बूटी इन प्रोसेस फिनिश गुड्स को अपने फैक्ट्री में ही चेक नहीं करेंगे, हम उच्च कोटि की औषधियां नहीं दे सकते। मैं आज के प्रोग्राम के लिए प्रोफेसर आसिम अली खान साहब को बधाई देता हूं कि इस टाइप के प्रोफेशनल तरीके से हमको अपने आयुर्वेदा यूनानी को पेश करना है। आज दुनिया यही मांगती है। एंड हार्टीएस्ट कांग्रेचुलेशंस टू प्रोफेसर खान एंड हिज टीम for organizing such an outstanding program. This language is what the people understand. Thank you very much, sir.
Thank you, Dr. Farooq.
Bismillahirrahmanirrahim. My tribute to Hakim Ajmal Hussain Khan Sahab, may Almighty Allah bless his soul, and my greetings on this Unani Day to the director and all present over here, Asim Ali Khan Sahab. Now the first thing, we may accept the vaccine and support it, what India has launched and has supplied to many countries. We should support, and it is a very good initiative of our country and our researchers, those who have made this vaccine. After that, today's topic, opportunities and challenges. There is a couplet, न जाने कब से जड़ी बूटियां तुम्हें आवाज देती हैं, जो तबीब सो गए सोने दो यारो तुम न सो जाना. These opportunities will continue. As Dr. Idris Saab has just quoted, that 100 years back, what Hakim Saab did, similarly, not only 100 years, but since long, problems were coming and were faced by the herbs only, because Almighty Allah has blessed us and our country with these things. Now the challenges in COVID-19 era, if we see, the very first thing was not to meet, not to talk, not to see, don't do this, don't do that. All these challenges were there. But only Hakim can do this, that can examine a person by asking him to show his tongue or self. I have bought a photo of it, if that can be displayed. This. So with the tongue, with the face, with the eyes, one can diagnose that what the problem is. If infection is there, tongue, there will be white coat on it. Eyes will turn, if fever is there, will turn pink or red. So with these things, one can know infection, what type of infection this person is having on the digital mood nowadays. These photos were, we have placed this in our factories, and a self-inspection was there with the mirror, and I used to say that every day in the morning, you see, if this is there, then have the medicine. Our company was established in 1930, so 90 plus years this company is there, and by the grace of Almighty, none of our workers were affected with COVID. Okay. I myself, because we are in a profession of such type that I had to travel from one place to and I have seen during lockdown, our villages, people were not observing any, all were saved because our food habits of villages is of this type. Nutraceuticals, okay, अपने चेहरे से जो जाहिर है छुपाएं कैसे, तेरी मर्जी के मुताबिक नजर आए कैसे. There is a couplet of इकबाल, मुब्तलाए दर्द कोई वुजू हो रोती है आंख, किस कदर हमदर्द सारे जिस्म की होती है आंख. So with the eyes you can know, and with the herbal medicines, not only this COVID time, but for till this world is there, we will be able to treat the people with the herbs. But one thing one should remember, that nutraceuticals are good, that medicine, food as medicine, but not medicine only as food, because when that type of situation comes and you take medicine only like food, and then food becomes like medicine, and then immunity goes. So you should take medicine as a medicine only, okay, with food or without food. But medicine should be like food, because lot of this golden milk or haldi or lasan with those people have taken, they suffered also. So lot of that, like just food one was taking these decoctions, that was wrong. We should take it as a medicine with the limited dose, whatever the dose is. And my greetings to all of you, and what you said about the industries, and Mr. Pradeep Multani has quoted it, that now when we export to the developed countries, then not only this GMP, CGMP or WHO, we have to do so many precautions over there, or certifications like USFDA and Prof 19, all these things we have to do, then only you can export, and this quality export one should take care, and industry is taking, those who are exporting. My greetings to you. Thank you very much, and Assalamu Alaikum.
Hakeem Mohsin Dalvi.
Thank you very much, Dr. Vishwakarma ji. Thank you, Professor Asim Ali Khan Sahab, for holding this hybrid virtual conference and inviting the Unani Drugs Manufacturers Association. Most of my points I wanted to speak to were covered by Pradeep ji, my colleague. Not only has COVID-19 wreaked havoc across the world, it has also exposed fundamental weakness in their healthcare system. Fortunately, India has the advantage way that we could fight this pandemic was through increasing our immunity. And as Farooq Saab said, that India, our food habits are such that we are using haldi, lasan in our diet. And with the Ayush Ministry giving us directives, giving us formulations of the Ayush Jushanda, Ayush Kala, the Indian have fought this pandemic, and rightly so, because we know that our population was huge and it was a very big challenge to control this pandemic. Otherwise, it would have gone out of control. We have seen what has happened in the westernized countries. They just gave up. And because they had no alternate system, and we were lucky that we had this ASU with us. The Ayurveda, Chavanprash is very good for immunity. We know that Khamira Marwarid has played a lot of role in increasing our immunity. The export potential of Unani, the demand for Unani drugs has gone up. Most of the westernized countries now, we see that they're suffering from depression, anxiety. And for that we have Khamira, Gauzuban Ambari Jadwaru, Saliwala, Brahmi. So these were the challenges that we had to face, that how to go for exports of these products. Like Pradeep said, that we have to modernize our plants, we have to go in for Ayush Premium, we have to go in for WHO GMP, and most of the industry, the Unani industry has started the process of applying for these certifications, and I'm sure that we'll be now, most of the industry will be getting these certifications, and I'll cut my the short because we are running short of time. Thank you very much.
Thank you, sir. Thank you. We go online now to Arvind.
Thank you very much for having
Can
me.
you unmute yourself, Arvind?
Can you hear me now? Are you able to hear me now?
Yeah, yes. No.
Fantastic. Thank you very much, Professor Asim Ali Khan ji, Dr. Ramvish Sharma ji. Thank you very much for moderating this so beautifully. Ladies and gentlemen, and also my dear friends, I think it's a real pleasure and honor to be here with all of you here today. I do believe that a whole lot of the panelists have covered the points that what I wanted to make a mention of. But there are a couple of things that what I would like all of us to think of before we go home today is that when it comes to the regulatory aspect and the regulatory framework, I think that it would be good that, you know, everybody present across over here work towards to see that how we could build across a global framework that would be recognized not only in our own country, but also across the world, whether it's with regards to Unani or the other Ayush systems. I do believe that the Honorable Ministry has taken across certain steps to see that how this can be taken forward. We do see that a whole lot of recognition has been given with regards to the Ayush systems, including Unani, in a whole lot of other countries apart from India as well. One particular thing that what I would like to request CCRUM and also the ministry is to ensure that the Ayush systems are also included into the FDA agreements that what the government does. This is extremely important to see that how we could forward the entire systems, not only here in India, but also across the world. When it comes to the educational institutions present here along with us, we too have a university, Norissa University. So here what we do is that we find it important that the aspect of education starts right from the seed level to ensure that all the students know of their own systems of medicine from their own countries. It's important, say for example, when children grow up, the first thing that what they would require in terms of a first aid, many years back would be turmeric, but then later things started to change. So it's important that we also see a whole lot of imbibing our systems into our educational systems should be the way forward to see that how these systems can thrive going forward. This is something that perhaps a best practice that what China did across. When it comes to the industries, it's important that, like what my very good friend Pradeep ji also made a mention, Shri Shri Tattva also has WHO CGMP, COPP certified, and also Ayush Premium Mark, and also the first ANMAT GMP certified facility for Ayurveda. So what does this mean? It means that the world is ready to take up the entire Ayush systems, in their arms, but it's important that we also speak their language. So the last point that what I would like to make a mention to all of us here is that whether it's with regards to the Unani system or any other Ayush systems of medicine, we need to see that the messaging is very clear. We need to see that we don't need to compete with any other system of medicine, whether it is allopathy or other systems, but we see that how we could work on an integrative approach, saying that it's the lifestyle of the individual that makes a difference at the end of the day, and the entire Ayush systems, the very core of these systems speak about lifestyle changes. So whether it's with regards to Ayurveda, Unani, Siddha, or Saurikpa, or any of the homeopathy, any of the systems, we see that we attend to one's lifestyle. And one thing that what Ayurveda and Unani also have in common, and I feel that this needs to be championed across, is with regards to the aspect of Nadi Pariksha. So I would request that, CCRUM and also the entire, ministry see that how even Nadi Pariksha could be standardized with regards to a system of learning that what the doctors could also have. This is an art that what we feel that definitely needs to be preserved. It's a science. It stood the test of time for so many, years and centuries. And this is something that what I would encourage, whether it's with regards in the field of Ayurveda or Unani, that this is protected. So apart from this, I feel that on my last note, the pharmacopoeial standards needs to be recognized, and our Honorable Dr. Geeta Krishnan here is doing such a fantastic work to see that how this could be recognized at the WHO. So I feel that all as industry, academia, and also the regulatory framework needs to come together to really see that how we message the entire systems in a different way, to see that how, the people of, today's age when it comes to technology are able to understand that what our systems are all about. People are definitely finding that there is so much need for the entire Ayush systems, and these systems are here to stay. Perhaps they would be the next gen modern day medicine, in case if I may say so. Thank you very much, ladies and gentlemen, and a very happy Unani Day to everybody.
Thank you. We are almost out of time. I will request Dr. Santosh Kumar Joshi to just say good wishes.
Good afternoon to all. I am really thankful to Professor Honorable Asim Ali Khan Sahab for inviting me in this great occasion of Unani Day. Today we are celebrating birth anniversary of great Unani scholar Asim Ali Khan, Ajmal Khan Sahab, and it's my all good wishes to all teachers, educationalists, scientists, and all Unani fraternity for carrying forward this legacy of Unani system. I have been given just opportunity to tell you all good wishes. Thank you.
Thank you. So we concluded today's session. We heard a lot of diverse views, sometimes opposite views, but I think that's a part of the scientific process. And with the name that we have assembled today, I think that's a one legend that can give us a lot of clarity in terms of where we want to go. I, as a scientist, always inspired from him and people like him. And I think that's an opportunity that we have, the huge amount of insights, intelligence, information that we have. Now we have to use all the tools of modern science to make new opportunities for dealing with. I think we are dealing with the next generation of diseases, which I think we have to, multifactorial diseases, and I think those are the challenges for our systems of medicine. Thank you very much. Over to Dr. Khan. Yeah.
Thank you very much indeed, sir. Sorry for taking over, sir. We are running really short of time. And may I request Professor Asim Ali Khan to do the honors of presenting memento. We begin by our moderator, Dr. Ram Vishwakarma. To Mr. Vedya Devendra Triguna. To Mr. Vedya Devendra Triguna. To Professor K.M.Y. Amin. Oh, he's not here. Dr. Vishwajanani J. Sattigiri. Dr. Atul Mohan Kochar. Dr. S. Farooq. Dr. Atul Mohan Kochar. Dr. S. Farooq. Professor Muhammad Idris. Shri Pradeep Multani. Shri Pradeep Multani. Hakeem Mohsin Delvi. And Dr. Santosh Kumar Joshi. Thank you, Professor Khan. And a quick group photograph in the front of the stage. And then we will get ready for the valedictory session.
Dr. Ghazala, first. Cheers, Dr. Cheers, please. Come fast.
चलो आप स्टेज तैयार हो गया पानी की बॉटल वगैरह चेंज करवाओ जल्दी से ना देख वो फालतू किसी की तरह जल्दी आओ ये नहीं कैसे से बोलते हैं
पानी की बॉटल्स उठवा पानी की बॉटल्स केटरिंग वालों को बोलो पानी की बॉटल बोले So, ladies and gentlemen, we are ready for the valedictory session, waiting for our dignitaries to arrive on the stage. So, ladies and gentlemen, please welcome our distinguished dignitaries. Honorable Chief Guest Shri Pramod Kumar Pathak, Additional Secretary, Ministry of Ayush, Government of India. Please put your hands together for him. Inviting Professor M. Jagadish Kumar, Vice Chancellor, Jawaharlal Nehru University, New Delhi. Professor M. A. Jaffrey, Vice Chancellor, Jamia Hamdard, New Delhi. Professor Akhtarul Wasi, President Maulana Azad University, Jodhpur. Professor Dr. Balvinder Shukla, Vice Chancellor, Amity University, Noida. Dr. Mukhtar Ahmed Kazmi, Joint Advisor, Ministry of Ayush, Government of India. And also, of course, we have on the stage with us Professor Asim Ali Khan, DG, CCRUM. Namaskar and good evening. Honorable Chief Guest, Shri Pramod Kumar Pathak, Additional Secretary, Ministry of Ayush, Government of India. Our guests of honor, distinguished dignitaries on the dais, distinguished delegates, special invitees, participants, respected members of the press and media, ladies and gentlemen. A very warm welcome to the valedictory session of the Unani Day 2021 celebrations and the National Conference on Unani Medicine, Opportunities and Challenges in the Times of COVID-19, which is being organized by Central Council for Research in Unani Medicine under the aegis of Ministry of Ayush, Government of India. And I would request Professor Asim Ali Khan, Director General CCRUM, to kindly do the honors of welcoming our Honorable Chief Guest and other dignitaries with a medicinal plant and honor with a memento. First and foremost, we welcome our Honorable Chief Guest, Shri Pramod Kumar Pathak, Additional Secretary, Ministry of Ayush, Government of India. Thank you very much indeed, sir. We welcome and honor Professor M. Jagadesh Kumar, Vice Chancellor, Jawaharlal Nehru University, New Delhi. A very warm welcome, sir. We welcome and honor Professor M.A. Jafri, Vice Chancellor, Jamia Hamdard, New Delhi. We welcome and honor Professor Akhtarul Wasi, President Maulana Azad University, Jodhpur. And we welcome and honor Dr. Mukhtar Ahmed Kazmi, Joint Advisor, Ministry of Ayush, Government of India. And I would request Dr. Ghazala to do the honors of welcoming Professor Asim Ali Khan, Director General, CCRUM. We now welcome Professor Asim Ali Khan, DG, CCRUM, doing the honors, Dr. Ghazala from CCRUM. Thank you, ma'am. And now, ladies and gentlemen, I have the proud privilege in inviting Professor Asim Ali Khan, Director General, CCRUM, to kindly present the valedictory remarks. Let's put our hands together to welcome him.
Shri Pramod Kumar Pathak Sahib, Additional Secretary, Ministry of Ayush, and Chief Guest of today's function, Professor M. Jagadesh Kumar Sahib, Vice Chancellor, Jawaharlal Nehru University, New Delhi, Professor Balvinder Shukla ji, she was just here, she had to attend a meeting, she just left, Professor Akhtarul Wasi Sahib, President Maulana Azad University, Jodhpur, Professor M.A. Jafri Sahib, Vice Chancellor, Jamia Hamdard, New Delhi, Dr. M.A. Kasmi, my colleague from Ministry, the Joint Advisor, Unani, participating delegates, friends from media, ladies and gentlemen. I feel immense pleasure in addressing you all on the culmination of the Unani Day 2021 and National Conference on Unani Medicine. We had extensive deliberations where the experts, academicians, researchers, and scholars had discussed the potential of Unani system of medicine in eradication of disease, is strengthening treatment and providing health care, which would play an important role in facing challenges of COVID-19. Panel discussions, expert talks, and scientific sessions were scheduled during the conference. The deliberations were focused on various aspects of COVID pandemic, and we have been enlightened by experts on how traditional medicine can help combat the pandemic and about the potential Unani medicine holds with regard to immune boosting. During the panel discussion, we had elaborate deliberations and discussions, and we have been enriched on the topic of opportunities and challenges in the times of COVID-19. Delegates from different parts of the country participated online in the Unani Day 2021 and the National Conference. Almost 1,400 delegates participated online, around 200 participants were here in this hall. State governments were strongly represented, and medical officers from Maharashtra, West Bengal, Assam, Bihar, Chhattisgarh, Gujarat, Manipur, Punjab, Rajasthan, Uttar Pradesh, New Delhi, Karnataka, Tamil Nadu, Telangana, Madhya Pradesh, and Jammu and Kashmir participated in the event. During this event, we realized and released 6 publications. A few of them are being released now in this function. I must appreciate the efforts put in by the entire team of officers from CCRUM who had worked tirelessly to make this event a success. I must also mention the pre-activities carried out by the peripheral institutions of Council, where various activities in the form of giving health talks, distribution of medicinal plans, and other tasks were carried out. Our social media team at CCRUM headquarters and team at Hyderabad deserves a special mention for their active involvement in social media activity of Ayush Unani Facebook page and providing inputs for Ministry of Ayush social media platforms. Special thanks to social media team of Ministry of Ayush. In the end, I extend thanks to all the delegates and resource persons for their participation. I am hopeful that we will meet again and will continue to establish these scientific linkages in the future. Thank you very much. Jai Hind.
Thank you very much indeed, sir, for presenting the valedictory remarks. And now, ladies and gentlemen, I have the privilege in inviting our guest of honor, Professor Akhtarul Wasi, President Maulana Azad University, Jodhpur, to kindly address the August House present here. Ladies and gentlemen, put your hands together to welcome our guest of honor.
काबिल-ए-सद एहतराम पाठक साहब, वाइस चांसलर जवाहरलाल नेहरू यूनिवर्सिटी, वाइस चांसलर हमदर्द यूनिवर्सिटी, हमारे डायरेक्टर जनरल CCRUM डॉक्टर आसिम अली खान, स्टेज पर तशरीफ़ फरमा हमारे दीगर मेहमानान, बुजुर्गों, दोस्तों, सबसे पहले यूनानी डे की मुबारकबाद। उसके बाद हकीम अजमल खां के कायम करदा कॉलेज के 100 साल पूरे होने पर पूरी मिनिस्ट्री ऑफ आयुष को मुबारकबाद। और इस मुबारकबाद के पीछे एक छोटा सा मकसद भी है कि 100 साल हो गए हैं और करोल बाग के उस कॉलेज को जो आयुर्वेद और यूनानी का पहला समावेश था उसको एक यूनिवर्सिटी बनाने की कोशिश करनी चाहिए और उसको वो दर्जा मिलना चाहिए ताकि वहाँ से जो लोग निकलें वो अपने को बड़े फ़ख्र के साथ वैद और हकीम कह सकें और अजमल खां की रिवायत को और हमारी गंगा जमनी तहजीब को आगे बढ़ा सकें। एक आखिरी बात सिर्फ जो मुझे कहनी है, चूँकि हमारे मेहमान को जाना है, वो ये कि कोरोना वायरस से जितनी भी तकलीफ़ें लोगों को हुई हों, लेकिन एक बड़ा फ़ायदा हुआ कि एक स्टेज पर तमाम आयुष से जुड़े हुए लोग आ गए और एक बात ये हुई कि हमारे जो साइंसदान हैं, मेडिकल साइंस से जुड़े हुए लोग हैं, शोध कार्य से जुड़े हुए लोग हैं, उन्होंने 10 महीने से कम अरसे में उसकी दवाई विकसित कर ली। उसके लिए हम उनको मुबारकबाद देते हैं, उनका शुक्रिया अदा करते हैं और आप सबसे अपील करते हैं कि उस दवा के बारे में जो भ्रम और भ्रांति फैलाई जा रही है उसको मैं किसी को ना आने दें, बल्कि उसका इस्तेमाल करें और याद रखें कि दुनिया में सबसे ज़्यादा अगर कोई कीमती चीज़ है तो वो इंसानी जान है, और इंसानी जान को बचाने के लिए हमें कोशिश करनी चाहिए। मैं एक दफ़ा फिर आयुष के जिम्मेदारों को और ख़ास तौर से CCRU की जो जुड़ी हुई टीम है, डॉक्टर आसिम अली खां की क़यादत में, उन सबको मुबारकबाद देता हूँ और उम्मीद करता हूँ कि आज का दिन कोई मंजिल नहीं है बल्कि ये पड़ाव है, क्योंकि बकौल शायर सितारों से आगे जहां और भी हैं, अभी इश्क के इंतहा और भी हैं। बहुत बहुत शुक्रिया।
हार्दिक धन्यवाद। और now we invite our guest of honor, Professor M. Jagdish Kumar, Vice Chancellor, Jawaharlal Nehru University, New Delhi. And let's put our hands together to welcome him.
My distinguished colleagues on the dais and all the delegates, on the occasion of Unani Day, let me extend my best wishes to all of you. You know, today, the whole day, you carried out several deliberations and brainstorming on the importance of Unani, the challenges and the future of Unani. While it is our traditional practice, it's part of our indigenous knowledge systems of our country, we should also remember that Unani is contemporary and it is evolving. And if it has to evolve into a discipline with greater public utility, it is important that we emphasize on creativity and innovation in Unani too, like in any other discipline. You know, creativity is all about generating new ideas, but being innovative is using these ideas to create value to others in society. And creativity and innovation can happen only when diverse intellectual disciplines collide with each other. And today, in our university system, there is a great opportunity for this kind of interdisciplinary and multidisciplinary research. Just to give you an example, at JNU, this academic session, we started a 5-year BSc, MSc integrated program in Ayurvedic biology. This kind of bringing together experts across the disciplines is very, very important for the development of any discipline. And even in the case of Unani, which is a very, very important discipline for the well-being of our people, it is important that on a large scale, research is taken up on the scientific aspects of Unani. And let me tell you, on behalf of JNU, we will be very welcome to interact and collaborate with researchers working in the area of Unani. With those comments, let me once more wish you all the best for the growth of this discipline in our country. Thank you. Thank you very much.
Thank you very much indeed, sir. Ladies and gentlemen, we have the great honor of having here today for the valedictory session as our Honorable Chief Guest, Shri Pramod Kumar Pathak Ji, Additional Secretary, Ministry of Ayush, Government of India. And I have the proud privilege in inviting Shri Pramod Kumar Pathak Ji for the valedictory address. Ladies and gentlemen, put your hands together to welcome our Honorable Chief Guest for the valedictory address.
Namaskar and Salam Alaikum. Professor M. Jagdish Kumar, Vice Chancellor, Jawaharlal Nehru University. Professor Akhtarul Wasi, President, Maulana Azad University. Professor M. A. Jafri, Vice Chancellor, Jamia Ahmedabad. Professor Asim Ali Khan, Director General, CCRU, Ministry of Ayush. Dr. Kazmi, Joint Advisor, Unani. Participating delegates, friends from media, ladies and gentlemen. It is indeed a matter of great privilege an honor for me to address this August gathering on this valedictory session of the Unani Day 2021, a national conference on Unani medicine organized by CCRUM and Ministry of Ayush, Government of India. In fact, on this pious occasion, we are also remembering Hakim Ajmal Khan, in whose honor this Unani Day is being celebrated every year. And I am fortunate to participate in all the Unani Day functions which has happened till now, starting from the first function. It is an honor to be a part of this concluding session of this successful event of the CCRUM, which provided an important forum for the experts in the field of Unani medicine to exchange views, deliberate, and collectively address the challenges of COVID-19. I am happy to see that delegates from all over the country have participated in the Unani Day 2021 and national conference through both physical and virtual mode. Experts and stakeholders from reputed academic, research and health organizations have delivered keynote addresses, made presentations, and deliberated in panel discussions. I am confident that the conference has provided an opportunity to exchange ideas, to establish research relations, and find partners for future collaboration. I must appreciate the efforts put in by the officers of CCRUM under the able guidance of Professor Asim Ali Khan, DG CCRUM. I am happy to see that the conference has provided a purposeful platform for all the participants from across the country to share their valuable work, which will contribute for further development of Unani system of medicine. I wish all the participants excellence in their future endeavors. In fact, I have to attend another important meeting at 6 o'clock. That's why I may have to leave early, but you can continue function. And I wish all the best for this successful deliberation. We hope that whatever the leads are generated through successful this deliberation, Ministry of Ayush will certainly take it forward and convert it into some meaningful, whatever you can say, drugs, research activities, or something meaningful activities by the concerned concepts. Thank you. Jai Hind.
Thank you very much indeed, sir, for sparing your valuable time and gracing this occasion. I would now invite our guest of honor, Professor M.A. Jafri, Vice Chancellor, Jamia Hamdard, New Delhi, to kindly say a few words.
Bismillahirrahmanirrahim. Actually, after presidential remarks, nothing should be said, but as Pathak Sahab was in hurry, that's why I am here after him. Shri Jaggi Sahab, other dignitaries on the dais and off the dais, since I have taken around about half an hour in morning in giving my address, that's why I, at this moment, will only touch upon few points. As far as this day is concerned, this is the birthday of Hakim Ajmal Khan. The personality of Hakim Ajmal Khan was unique. He was widely accepted across the communities and across a particular system. He was so popular and his work was so important that if I want to give some examples, he established a common Unani and Ayurvedic conference. He brought all the physicians of Ayurveda and Unani at that time at one platform. And he was so accepted, honored, and respected by all the communities that once upon a time he presided a function of Hindu Mahasabha. This shows his personality. And as far as Unani system of medicine is concerned, I just want to touch upon a few points as a student of Unani medicine. What we need, as I said in morning also, we need documentation. Rather, I should say, I've said that at this moment we need digital documentation. We need professional approach. I am frank enough to say that we lack in professional approach. So we need professional approach. And we need more and more research to perform, and we need to submit projects to the council and to other agencies. And from the government of India level, what we need, I would request the government authorities to think for establishing government-approved labs for our industry, as has been said in the panel discussion session. And this is must for the standardization of drugs and quality control. And as far as our industries are concerned, they cannot do. This is what I am saying on the basis of certain experience after visiting various drug industries. I was a panelist. I visited various industries on the advice of QCI as an expert. I found that we say that we need to have Ayush certification if we want to export our drugs. But as far as our industry is concerned, except 2 or 3 major industries, our industries cannot do. So that's why it is, I think, is the need of our that government should establish the testing laboratories for standardization and quality control of drugs. And last but not the least, what I observed in my community, in Unani fraternity, at the level of students and at the level of practitioners, we lack in confidence. So we need confidence building. जहाँ तक कोरोना का सवाल है, बहुत सी बातें सुबह कहीं गई, बहुत सी डिजीज़ में और बहुत से सिम्टम्स के लिए बहुत से अच्छे सजेशंस आए, लेकिन ये बात ज़रूर है कि कोई बिल्कुल क्लियर कट ट्रीटमेंट नहीं है और हमारी सर्टेन लिमिटेशंस हैं. लेकिन आफ्टर ऑल these limitations, we should try our best, because if we see the scenario of a very simple disease, nazla, rhinitis, it is said that if one suffers from nazla, so if we treat, it takes 7 days, and if we do not treat, it will be okay within 1 week. But we have seen tremendous results of our simple thing, jo shandar nazla. If we take 2-3 doses, so generally it goes off. And we have seen the results of in our drugs in viral hepatitis. We have got tremendous results. तो ऐसा नहीं है कि वायरल डिजीज में हम कुछ नहीं कर सकते. आई एम नॉट ए मैन ऑफ मेकिंग क्लेम्स एंड जस्ट फॉर द सेक ऑफ क्लेम्स. हम कर सकते हैं बहुत कुछ, तमाम हमारी लिमिटेशन ज़रूर हैं, लेकिन वी शुड ट्राई हार्ड. बाबे जिंदा बंद गुलशन दूर, जख्मी बालों पर कुव्वत परवाज फिर भी आजमानी चाहिए. थैंक यू वेरी मच.
Thank you very much indeed, sir. I would now request all our guests of honor to kindly do the honors of releasing the CCRUM publications. First, we will release the patent awarded to CCRUM. This book is a compilation of detailed description of 17 patents on innovations developed by CCRUM and is produced from the data available on the website of Indian Patent Office and information available in public domain for the benefit of the society. This compilation will play an important role in disseminating the outcomes of exhaustive researches conducted by the CCRUM. So let's put our hands together on the release of the patent awarded to CCRUM. Next, we will release a technical report on clinical study of Unani formulation, Majun Nisyan in Nisyan amnesia. Nisyan is a state of forgetfulness, and it has become major medical as well as social issue around the world. This book is a technical report entitled Clinical Study of the Unani formulation, Majun Nisyan in Nisyan. Is based on the results of the clinical study conducted at 3 peripheral centers of the Council. And finally, the publication on medicinal plants for longevity, evidence-based geriatric care approach in Unani medicine. The present document comprises description on 35 medicinal plants used for longevity and healthy aging in Unani medicine since long. The information also includes references of scientific studies carried out for establishing effects of Unani single drugs in various age-related conditions. And now, ladies and gentlemen, we wish to honor by distributing the appreciation certificates. We would present to Dr. Naheed Parveen, Assistant Director, Unani. May I request all the dignitaries to kindly step forward, all our guests of honor to kindly step forward, please. Certificate of Appreciation for Dr. Naheed Parveen, Assistant Director, Unani. Shri K.K. Sapra, Assistant Director, Admin. Dr. Ghazala Javed, Research Officer, Unani, Scientist 4. Receiving the certificate now will be Shri K.K. Sapra, Assistant Director, Admin. Let's put our hands together for them. Ladies and gentlemen, these are the people who have tirelessly worked for last many months in putting this event together. Inviting Dr. Ghazala Javed, Research Officer, Unani, Scientist 4. Let's put our hands together. Of course, since morning we've seen Dr. Ghazala running up and down the stage, but this is a very small part of what her efforts have been since the past few months. Dr. Pradeep Kumar, Research Officer, Pathology, Scientist 4. Dr. Pavan Kumar, Research Officer, Pathology, Scientist 4. Receiving Dr. Pradeep Kumar, then Dr. Pavan Kumar. Both are Research Officers, Pathology, Scientist 4. Dr. Zaki Ahmed Siddiqui, Research Officer, Unani, Scientist 4. Dr. Abdul Rahim, Research Officer, Unani, Scientist 4. Dr. Abdul Rahim. Dr. R.P. Meena, Research Officer, Chemistry, Scientist 3. Dr. R.P. Meena, Research Officer, Chemistry, Scientist 3. Dr. Amanullah, Research Officer, Unani, Scientist 3. Dr. Amanullah. Dr. Jamal Akhtar, Research Officer, Unani, Scientist 3. Dr. Nigat Anjum, Research Officer, Unani, Scientist 2. Dr. Jamal Akhtar receiving the certificate, the appreciation certificate. Inviting Dr. Nigat Anjum, Research Officer, Unani, Scientist 2. Shri Mohammad Niaz Ahmed, Research Officer, Publication. Dr. Osama Akram, Research Officer, Unani. Shri Harish Arya, Administration Officer. Muhammad Parvez, Accounts Officer. Muhammad Parvez, Accounts Officer. Muhammad Alishan Qureshi. Syed Hilal Ahmed Naqvi, Arvind Shrivastava, Consultant IT, and Mohammad Husnain Raza, Office Assistant. Mohammad Husnain Raza. And ladies and gentlemen, once again, put your hands together for all these office bearers who have worked tirelessly for last many months in putting up this very successful national conference and Unani Day celebrations. Thank you to each one of you for all your hard work and efforts. Thank you once again. And may I now request Professor Asim Ali Khan to do the honors of presenting a small token of gratitude to all our guests of honor. Professor M. Jagdish Kumar, Vice Chancellor, Jawaharlal Nehru University, New Delhi. Professor M.A. Jaffrey, Vice Chancellor, Jamia Hamdard, New Delhi. Professor Akhtarul Wasi, Dr. Mukhtar Ahmed Kasmi, and I would once again request Dr. Ghazala Javed to do the honors. Dr. Ghazala Javed to kindly do the honors of presenting a token of gratitude to Professor Asim Ali Khan, DG, CCRUM. Thank you very much indeed, sir. And ladies and gentlemen, a huge round of applause for Professor Asim Ali Khan, DG, CCRUM, for putting up this wonderful and very successful event. And may I now invite Dr. M.A. Kasbi, Joint Advisor in the Unani, Ministry of Ayush, Government of India, to kindly propose the vote of thanks.
Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. Professor M.A. Jaffrey Sahab, Vice Chancellor, Jamia Hamdard University. Professor M. Jagdish Kumar Ji, Vice Chancellor, Jawaharlal Nehru University, New Delhi. Professor Akhtarul Wasi Sahab, Maulana Azad, Vice Chancellor, Maulana Azad University. Dr. Mushtaq Sahab, Professor Arif Zaidi Sahab, Professor Idris Sahab और हकीम मोहसिन दहलवी साहब, हमारे जम्मू कश्मीर के प्रीवियस डायरेक्टर जनाब कबीर डार साहब, बेइंतहा खुशी है, मैं प्रोटोकॉल से हट करके जो है शुक्रिया अदा कर रहा हूँ और लंबा नहीं करना चाहता हूँ। मैं सबका बेइंतहा शुक्रगुजार हूँ कि आप लोग यहाँ तशरीफ़ लाए और ये यूनानी की महफिल जिसमें जो है हमारे वाइस चांसलर प्रोफेसर अख्तरुल वासी साहब ने हकीम अजमल खान साहब की याद में, ये बहुत पहले से मुतालबा होता आ रहा है कि चूँकि करोल बाग तिब्बिया कॉलेज उनका कायम करदा बल्कि उनकी मेहनतों और काविशों का सिला है और पूरी एक सदी बीत चुकी है उस कॉलेज पे, तब हमारा फ़र्ज़ बनता है कि हम हुकूमत दिल्ली से और दूसरी जो है जो भी हम उसके लिए तरकीब इस्तेमाल कर सकते हैं पॉलिटिकल लेवल पे, चूँकि उनका एक बहुत बड़ा कद था और एक साल बीतने के बाद तो किसी की जो है किसी की भी मेहनत अकारत नहीं जाती। उन्होंने जो ख्वाब देखा था कि आयुर्वेद यूनानी को का उसका सितारा बुलंद हो, तो बहुत अच्छा मौका है कि ये साल जो है उनकी याद में जिस तरह हम यूनानी डे मना रहे हैं तो उनके नाम पे हम अजमल खां के नाम पे एक आयुर्वेद यूनानी यूनिवर्सिटी के लिए जो है हम यहाँ से प्रपोज़ करें और हुकूमत दिल्ली इसके लिए जो तैयार हो, ताकि जो है हम यूनिवर्सिटी का जो है काम आगे बढ़ा सकें। मैं तमाम डेलीगेट्स का, डिस्टिंग्विश्ड गेस्ट का और ऑफिसर और ऑफिशियल फ्रॉम द मिनिस्ट्री ऑफ आयुष रिसर्च काउंसिल सबका शुक्रिया अदा करता हूँ कि सब लोग यहाँ तशरीफ़ लाए और इस मीटिंग को और इस सेमिनार को, इस कॉन्फ्रेंस को कामयाब बनाया। प्रोफेसर आसिम अली खान साहब DG CCRUM और उनकी पूरी टीम CCRUM की और विज्ञान भवन की सारी टीम काबिल मुबारकबाद है कि उन्होंने बहुत अच्छा ये फंक्शन ऑर्गेनाइज़ किया और इसको यादगार बनाया। इन्हीं चंद अल्फाज के साथ अपनी बात ख़त्म करता हूँ। अल्लाह हाफ़िज़।
Thank you very much indeed. And ladies and gentlemen, before we close the proceedings of the Unani Day 2021 celebrations, may I request everybody to kindly rise for the national anthem.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता, पंजाब सिंध गुजरात मराठा द्राविड़ उत्कल बंगा, विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा, तव शुभ नामे जागे, तव शुभ आशीष मांगे, गाहे तव जय गाथा, जन गण मंगलदायक जय हे भारत भाग्य विधाता, जय हे जय हे जय हे जय 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 हे।
Thank you very much indeed. I once again take this opportunity for thanking each one of you for your participation. Please join us for high tea served outside, and all the office bearers of the council are requested to join us on the stage for a group photograph. All the office bearers of the council to kindly join on the stage for a group photograph.